shining like a beacon of bright stars. I was in a life wandering far until I found the lighthouse guiding me out the
Welcome to Tunga Hospital. We are the largest and most affordable hospital in Mumbai, successfully performing countless surgeries for better health every day. To know more, visit www.tungahospital.com.
When I'm blue, I think of you in your eyes, how they look at mine, so kinda like that. You slow down time and everything's just fine. I was ocean swimming with just wishbone thinking of my life, the vision drifting by until I found a lighthouse in your heart, shining like a beacon of bright stars. I was in a life wandering far until I found the lighthouse guiding me out the
Welcome to Tunga Hospital. We are the largest and most affordable hospital in Mumbai, successfully performing countless surgeries for better health every day. To know more, visit www.tungahospital.com.
When I'm blue, I think of you in your eyes, how they look at mine, so kinda like that. You slow down.
Ask them to come to the auditorium so that we have a long list of sessions, speakers, and we would like to end on time. President, Dr. Satyaprakash Shetty, and the office bearers of the Association of Bunts, Dr. Mumbai, to this first maiden mega medical summit, where there are no white coats, no stethoscope, but a confluence of brilliant minds, compassionate heart, and a visionary mind of health science. So whether it is the wisdom of Dhanvantari, the divine healer in Indian tradition, or the rod of Asclepius, or in Hippocratic oath, the ethical foundation of modern medicine echo one eternal truth, and that is medicine is not a profession, it is a calling. One begins with knowledge, but it is fulfilled with compassion. And the Association of Bunts Doctors have taken this calling and have organized this mega medical summit, adding both cultural richness and gravitas to this event. On a Sunday afternoon, foregoing your afternoon siesta, I welcome you all, the invited guest, the presence of eminent doctors, your family members, your patients who are around, the super specialists, the healthcare professional, other professionals who are here, thought leaders, and also those who still do not understand your handwriting. I think it is a nature's way to give the pharmacist a long time employment, because they start decoding the abstract art of the prescriptions which has been prescribed by you all. On a very serious note, speaking about today's theme and the event, some of you must be wondering, what happened to the math of the doctors? 4 plus 1 is equal to 100. This is precisely the secret which will be revealed here. 4 plus 1 is equal to 100. How to live a very healthy, a very happy, and a fulfilling 100 plus years. This very stage, this very moment after this will be, you all will be a witness to this 4 plus 1 is equal to 100. It is a unique and a secret formula where physical, mental, social, and spiritual well-being, when allied with a purpose, leads to life not only long, it's not just the number of 100, but it is also completing it with happiness and fulfillment. This summit is not an event, it is a movement. It is a movement which echoes a powerful philosophy that true wellness is not built in hospitals alone, but it is in the harmony of body, mind, soul, and spirit. The eminent doctors and experts will be sharing their nuggets of knowledge from their expertise field, from holistic well-being, from the Shetty test preventing heart attack, selecting the right mediclaim, spiritual well-being, talking cancer, vaccination, adult vaccination, menopause, organ donation, diabetes, wellness. All this will be discussed, but it is powered by empathy, enriched by experience, and backed by decades of wisdom. Let this day today be remembered as a new beginning to all of us, the beginning of me, where there is inspiration, innovation, and introspection, where every speaker who comes here becomes a healer of thought, and every listener walks a little healthier in mind and also in spirit. So, ladies and gentlemen, put your hands together for welcoming our eminent speakers for a very power-packed session. I pass on this baton to my co-anchor, the eminent doctor, Dr. Ajit Shetty, Vice President, Association of Bunts Doctor, to take over the scientific program of the day. Thank you so very much.
Thank you, Vijayakka. This is a beautiful day I was born a Shetty many, many years ago, but I've become a proud Bunt in the last couple of months, ever since I joined this movement in the Bunts Medical Association. And today, for the first time, young as I am, I've just paid my fees for becoming a member of the Bunts Association. So this is a rebirth for me too. Today we have a list of the most illustrious speakers that you can have at any conference. And these are stalwarts, one by one. They have CVs which run into pages. And it is not possible to connect and talk about all those things because that itself will be another conference. So what I have decided is that I have the permission of all the speakers who are all good friends, relatives in a different way. And they have all said, no, just talk a little about us and let us talk about the topic. And that is the reason I am not going to go through all the formal CVs. And I know Vijayanna from a real long time. It's very, very long, I think maybe almost 15, 20 years. That doesn't tell you how old we are, but it just tells you that we've been around a long time. Yeah, he had a lot of hair. He's prompting from behind. And I said, Vijayanna has got a very enviable profession. Men come and drop their trousers in front of him. Women come and lift their skirts and their saris in front of him. Now you're looking a little, thinking a little ugly, but how else do you think can he examine knees? Okay? This is a man because of whom the Bunts community stands up and walks upright, and not only the Bunts community. There are so many of us in the audience today who walk with pomp. It's just because they are on solid grounds. And to his credit, he has got so many different things. But I just want like to focus on one beautiful thing because it has got the brand name Shetty Test. And that's what makes this man special for the world and for all of us Bunts. Please, ladies and gentlemen, give him a round of welcome. Yeah? Vijayanna, yours.
Thank you, Ajit. For the time being, let's forget the knee. Okay, so what I'm going to do is that I'm going to focus on that area, okay? Now, why this is important, most of us are doctors here, but there are some who are not. So the focus of this lecture is to make some of them small-time doctors, if I can't make them full-time doctors. So this is about this area of the joint, of the bone, of the skeleton. That is the area we are going to focus on. Now, if you look at this video, you know, we don't really have to be doctors or sports medicine specialists or orthopedic surgeons. Look at him. What has happened to his right knee, right ankle and right knee. So obviously there's some injury. Now see, throughout this lecture, I'll be using the word injury and fractures. They are two different things. I want you to please focus on that area. Now, when you look at the ankle injuries, I'm not talking about fracture or anything else, just the injuries. Look at this figure. The incidence is 55 people per 10,000 population. So that is a figure from our country. Okay, that is the reference that I've provided here. Now, we are this is just yesterday, Googled yesterday, 145 crore people. That means we are likely to injure our ankle. 75 lakhs of us. 75 lakhs of us per year. So, as I mentioned, injury is not necessarily a fracture. So, we should not be always thinking about fracture as doctors when people come into the clinic. Now, when you look at this patient, for example, you see that area. Obviously, this is left ankle. There's a lot of swelling. And what happens? Traditional approach is that as a doctor, you examine them, you look at the joint, then instantly, you know, this is what we've been all taught in our medical schools, instantly we send them for x-rays. That's the first thing that we do. So, x-rays, you know, what happened was, this is a beautiful story. When I came back from England, I started my practice as an individual consultant, and there was this young boy who was, you know, screaming with ankle pain, and he was not letting me touch, so I made him sit on the couch. I said, just support your foot on my hand. That's where the idea came in. So I thought, before we send these small kids, because ankle sprain is also very common in children, before we send these children for x-rays, stop, think for a while. And if you really look at the literature today, 15% of all ankle injuries end up with fractures. Only 15%. If you see 100 people of ankle injuries, only 15 of them may have a fracture. Okay? And if you are looking at x-rays, why we don't want to do the x-rays? You see, when you look at the number again, 85% of them, 85 out of 100, may not have a fracture. That's going by the literature. There is solid mounting evidence on this fact. So, you are sending a small boy or a girl for x-rays. There is still theoretical risk of radiation. I have given you the figure there. I'm not an expert in this field, but I believe 1000 MSV of radiation exposure can cause cancer. The next thing that happens is, you send the patient, whoever it is, for x-ray. You spend minimum of 45 minutes, at least in my hospital, and they come back with the x-ray, and you take another 15 minutes of your time, your consultation time. So how do we avoid taking x-rays? In the 85% of the ankle injury population. Now, look at this. This is basically one of my students. It's demo only. And what happens? This patient comes into your clinic, and he has a right ankle injury. There is, look at him. He's putting weight on his ankle. Okay? And I am there. I am not doing anything, asking him to just rest his ankle and the foot on my left hand. And see the next one. Again, this is also demo purpose only. And he comes in. You observe him. You don't have to be a doctor for this. See, he's not even putting weight on his foot and ankle. You see what happens? See, he's limping. The previous patient was actually putting weight. And here, he's resting his foot on my hand. He's saying, ouch. There is no audio here, but he's saying, ouch. And say, so if my patient says, ouch, by doing this test, I am convinced that there is going to be, or likely to be, a fracture. So I send them for x-rays at that point. And see, this is a real patient. This is an actual patient. Now I've taken informed consent for this picture, and see what happens. And there is a lot of swelling, see, around that area. And then I send him for x-rays, and those are his x-rays. Perfectly normal, and Shetty test negative. Okay, this is just for your demo. And what we did, we wanted to validate this theory. You know, I was doing this, and I had done like maybe 100. I was doing it in my clinic, but how am I going to convince others? So we went on a royal journey along with Tata Institute of Social Sciences, Dr. Harshad Thakur, a very senior medical statistician. I discussed with him and asked him, how can we go about a prospective study? So what we did, we looked at, very simple, 50 consecutive patients of isolated, only ankle injuries, single examiner, that is me. We sent all of them for x-rays because it's legal. You can still do the x-rays, okay? And then we looked at the test results against, my test results against the x-ray results. See what happened. 43 of them were Shetty test negative. Okay, none of them had fractures. That means my test has shown that the positive test, negative test has shown that there is no fracture. So the 7 patients had pain and we sent them for x-rays. 3 of them had fractures. So I want you to, it's a busy slide, but just concentrate on what is you call negative predictive value, which is fifth row. You see 100%. This is the calculation done by Dr. Thakur, and the other thing you see is likelihood, which is the last but one row. Likelihood of the ratio being negative is 0. So that was the birth of Shetty test. Then, you know, it is a very simple test. It can be done by anybody in this hall. You don't have to be a doctor. It can be done in any institution. It can be done in any rural area, suburban area, anywhere. You don't have to run to a casualty emergency when there is an injury in the ankle in your family home. So you don't have to be an expert. All you need is a good hand. So look at the financial implication. This is interesting. This is when my paper actually got accepted. So 3 out of 10 of sports injuries, of all sports injuries, 3 out of 10 are ankle injuries. Okay? 85% of them are actual simple sprains, 85. Now, we know that 55 per 10,000 of global population, that is the incidence of ankle injury. Now, global population, according to yesterday's Google search, is 8.2 billion. That means 45 million people can get ankle injury, not necessarily fracture. So 85, we would have sent everyone for x-rays. So 85% of them is 38.25 million. That means annually we are saving 1,100 crores per exposure. We end up doing 2 x-rays for ankle injuries. That means we are likely to save about 2,200 crores. Some CMN is already counting. so checking on me. Right. So in India, what happens is, you see, 75 lakhs people can get ankle injuries. 60 lakhs we are unnecessarily doing x-rays in about 60 lakh people, which means of 145 crores. So look at this calculation now. In Hiranandani Hospital, an ankle x-ray costs around 375, one exposure rupees, but let's imagine the best 300 into 60 lakhs. It is almost 190 crores. That is for one exposure. For 2 exposure per year, we are likely to save 380 crores. So Shetty test, you see there is no radiation risk. Time spent, almost none. Cost. With the traditional approach, you see the inconvenience, which is very, very important again. So we then finally published this. And I'm glad to say Dr. Chintan Hegde was also one of the authors at the time with me, and Dr. Arun Shetty's son, Vishwas. There are 3 Shettys already in the Shetty test publication. And this was published in European Journal of Orthopedic Surgery. It's an international journal with good ranking. So then I okay, yeah. Can I continue? Yeah. So what happens? I wanted to check what is the global outlook like for this test and what's happening around the world. So I looked at searches on Shetty test, and this was validation 1 from Spain. From Spain, this is published in Spain, and the conclusion is that Shetty test is a valid clinical screening. This is their opinion, their conclusion from Spain. Then came the paper from Australia, and the conclusion was again, Shetty test may safely reduce unneeded radiographs. Of course, further research is warranted because it was only a prospective study. Then came validation 3 this year, amazing. This was really exciting. This is from Greece. And what they have mentioned is, particularly for non-orthopedic emergency department, it's so useful. That means you don't really have to be an expert doctor to identify this. So, in conclusion, it is an idea that we thought about. It is a concept and it's a logic. Thanks for watching.
Thank you, Vijayana. That was really very, very
Thank you.
to the dot of time and very wonderfully spoken. And we are so proud of you and your team for having achieved this unique distinction. Ladies and gentlemen, this is the way to clap so that we really should be there for one another.
Thank you.
I request our president and Sanana to felicitate our speaker. So the last 2-3 years, ever since COVID happened and all the vaccinations happened, the one thing that we've been noticing with quite frequency is that there are people who are supposedly extremely healthy, people who are running marathons all their life, people who are gymmers, people who are actors, who have been gymming all their life. We've noticing that they have been suddenly falling down and dropping dead. And we started trying to associate things with vaccines and with all other things. All the time we were looking at all these things, and there was this gentleman, the man with the golden heart, as I like to call him, Sadanandanna, who is doing his own quiet thing. And one thing to his credit is that week after week, he is going somewhere or the other, he's spreading education, spreading information, and it is through him that I learned the difference between a cardiac arrest and a heart attack. For me, till the time, everything sounded just the same and happened just the way it does normally happen. He is a professor emeritus of the D.Y. Patel College of Medicine, New Bombay, and he is the director of the Department of Cardiology at Somaya. We have a man with the golden heart to speak to us about how to recognize disease in the heart early enough so that we can get better and come back to a fulfilled life. Sadanandanna, the floor is yours.
Thank you, Ajitana Vijayta, and all of you friends here. Yan Tulutu patere chon malpo. English word and one te Tuluku translate malpo try malpo. 15 minutes nanko finish malpo. So what I'm going to do, nama mit plane ponaga or pakki round ponaga. Chittu tunaga masti kinne tojun. So 15 minutes heart attack enchina. ఏం చెప్పిన భారీ కష్ట అండ్ సింపుల్ ఏం సాಧ್ಯ ఉండవని ತೂಪಾನು ನಂಗೆ ಪೂರಕಲೆ ಗೊತ್ತುಂಡು ಹಾರ್ಟ್ದ ಫಂಕ್ಷನ್ ಪಂಪ್ ಮಲ್ಪನ ಕಂಟಿನ್ಯೂಸ್ಲಿ 24 ಗಂಟೆ ಪಂಪ್ ಮಲ್ತೊಂದೆ ಉಪ್ಪೋಡು ಅಂಡ್ ಐಕ್ ಪಂಪ್ ಮಲ್ಪರೆ ನೆತ್ತೇರ್ಬೋದು ಪೂರ ಬಾಡಿಗೆ ಸರ್ಕ್ಯುಲೇಷನ್ಗೆ ಹಾರ್ಟ್ provides blood to all the, you can hear, no? Yeah. Heart provides blood to all the organs, but when heart doesn't get blood, and then we call it as heart attack. If you see here, this is a place where there is a clotting occurs here. If you see here, heart the naroku clot anaga, heart doesn't get blood supply, and then you say that this patient gets an heart attack. So, heart attack anaga first 1 gante bari mukhya time. Echina patient heart attack the first hour they collapse. So importantly the first hour is very important. So we should know what are the warning symptoms. Important, maybe the pointer it doesn't work here. Main various point onji chest da kelon sati shoulder kelon sati nanku symptom are in the tooth, in the dental area, sometime in the brain, so much so ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಆನಾಗ ಎಂಕುಲು ಪೂರ ಸ್ಪೆಷಲಿಸ್ಟ್ ಕೆಲವರು ಡೆಂಟಿಸ್ಟ್ ನಡೆ ಪೋತೇರು, ಕೆಲವರು ಆರ್ಥೋಪೆಡಿಕ್ ಡಾಕ್ಟರ್ ನಡೆ ಪೋಪೇರು, ಕೆಲವರು ದಲ ನ್ಯೂರೋ ಪ್ರಾಬ್ಲಮ್ ಇಂದ ನ್ಯೂರಾಲಜಿಸ್ಟ್, ಕೆಲವರು ಎನ್ನೂರು ಗ್ಯಾಸ್ ഉണ്ട്. ಗ್ಯಾಸ್ ಇಸ್ ದ ಮೋಸ್ಟ್ ಕಾಮನ್ ಮಿಸ್ಟೇಕ್. ಪ್ರತಿಯೊರಿಯಾಗ ಎನ್ನೂರು ನಮ್ಗೆ ದಾಲ್ ತಿಗಲಡು ಬೆಚ್ಚಾಂಡು ಬೇನೆ ಬರ್ತಂಡು ಗ್ಯಾಸ್, ವಿಚ್ ಇಸ್ ನಾಟ್ ಸೊ. ಸೊ ವೇರಿಯಸ್ ಸೈಟ್, ವಾಟ್ ಐ ಶೋನ್ on the left side is the different site where you can get the symptom. There are warning symptoms also of the heart attack. It is not that heart attack just comes like that. You know, there are many times you get a warning symptoms which could occur in the first few days to few weeks. And the classical symptom panda chigalade pain apundu, heaviness apundu, kelon sarti pressure like feeling. Many times when you ask patient pain attu, but something uneasy, you know, like a discomfort. And that's a very, very important symptom of the heart attack. Sweating, dizziness. So these are the classical symptoms what you get in heart attack. Bukkonji panda main, many times patient gets a feeling as if the heart, you know, you get a pressure like feeling in the chest. It is not the pain but tightness. Remember one important point panda, whenever you get any symptom first time in your life, it is not that, you know, suddenly madhya rathri burning andu or suddenly heaviness battudu. Ratri once late night, heavy food, drinks and all, and then you come home, midnight or maybe early morning you get burning. We think it is due to the acidity. Never think like that. It should be more likely a cardiac problem. Ida mutta nange kepala symptom ittiji, but first time you got the symptom, which is more like a heart, and that you should not miss. You should not think, you know, I am perfect, you know, my body is good, I don't have sugar, I don't have a blood pressure, I am doing regular walk, I am otherwise fit. But if you get that symptoms, you get the evaluation. You should not ignore. Bokonji ponjolna kaase anonji specifically panre mululla. But many times ladies are neglected. In fact, many times enkulu clinic edutunaga, they bring husband, you know, and the priority is for the husband. First citizen is husband. But the second, like, you know, many times the ladies don't give priority to their themselves. And many times in ladies we do see one the atypical symptom. That is symptoms nama typical arnjola puda alekka uppuji. Many times is very, very atypical. Aitatra diagnosis for ladies idu one the difficult happen. In fact, late diagnosis. In fact, ladies patient for heart related issue, particularly heart attack, their outcome is not as good as male because the diagnosis is late. And they have got, you know, very small artery disease, and then, you know, their outcome, even a bypass, angioplasty, enya maltandala, one the outcome is not as good as male only because of the delayed diagnosis. Endale kodu, ladies also should take adequate care just like males. We should not ignore. Anyone can get this disease. Now, basically, whenever you get a heart symptoms or an attack like, it's a true emergency. Only one sickness in the body which can take our life in few minutes is heart attack. Remember, like we are sitting, we can collapse. I am talking, I can just collapse to the floor. So this is the only disease in the body which can take our life in few minutes. And so it's a true emergency situation. Our time, the first time, close once, let the patient be completely resting. And then, you know, we should take, if patient is already taking heart medication, we can continue. And, you know, if he becomes unconscious, that means he gets into some problem. Then what is called the CPR, which is very, very important. Nama poorakalala CPR panda cardiopulmonary resuscitation. Undu nama poorakale nama train malpodu. Nama driver, nama servant, nama friends, what is called the CPR can save you. Cardiopulmonary resuscitation. Person gets an attack, within no time you suddenly collapse, you start pumping the, you know, chest and all. So we have to educate actually. For us, organization, different organization, collectively should come forward, teach people, and more importantly, nama own driver, nama own people at home, nama jokulu, nama kelsadakul board, because in the office suddenly you get collapse, 5 minutes to 10 minutes, very important. So CPR is very, very important. Importantly, AED, that means automatic external defibrillator. When patient gets a very fast heart beating called ventricular tachycardia, and this is a life saving. In fact, Namamula organization, we need to keep all the time. Like our society, many clubhouses, many railway station, it is kept today. You know, more and more awareness you have to create. Nama old muliji actually. And recently one mega function was there. I kept a complete mobile ambulance here, 24 hours, with all facility of AED, pacemaker, everything. Automatic external defibrillator is life-saving. It just costs hardly few lakhs, less than 2 lakhs. We should have that in our house here. Now, Kerala collapse under. By the time I shift to hospital, it's going to take time, whereas this is a life-saving thing. ಕೆಲವೊಂದು ಪೇಷಂಟ್ನಕುಲು ಆಸ್ಪಿರಿನ್ ಒಂಜಿ ಬ್ಲಡ್ ತಿನ್ನರ್ ಗೆತ್ತೊಂದು ಪೂರ ಅವೇನು ಗೆತ್ತೊನಲ್ಲಿ ಬಕ್ಕಲ ಬ್ಲಡ್ ತಿನ್ನರ್ ಉಂಡು ಒಂದು ಪೂರ ಒಂತೆ ಕಾಂಟ್ರವರ್ಷಿಯಲ್ ಇಶ್ಯೂ ಬಿಕಾಸ್ ಪೇಷಂಟ್ ಚೆಸ್ಟ್ ಪೇನ್ ಅಂಡ್ ಡಿಸ್ಕಂಫರ್ಟ್ ಅಂಡ್ ಒಂಜಿ ಆ್ಯಂಡ್ ಟ್ಯಾಬ್ಲೆಟ್ ಕೊರಿಯೆ ಆ್ಯಂಡ್ ದೆನ್ ಪೇಷಂಟ್ ಕೊಲ್ಯಾಪ್ಸಸ್ ಲೇಮನ್ ಥಿಂಗ್ಸ್ ಡಾಕ್ಟರ್ ಪಂಡರ್ ಒಂಜಿ ಗೋಲ್ ಗೆತ್ತೊಂಡು ಐ ಕೊಲ್ಯಾಪ್ಸ್ ಇಟ್ ಈಸ್ ಜಸ್ಟ್ ದಿ ಇನ್ಸ್ಟಂಟ್ ಲೈಕ್ ದ್ಯಾಟ್ ಬಟ್ if you are comfortable with the patient you can use aspirin. Now after knowing what heart attack is, how you get the symptom, now how to prevent it. If you look at here, there are many risks is not in our control. The prada menopause anaga heart attack is common. As you age, heart attack is common. If you have got a family history of coronary artery disease, you are going to get male more common than the female. Nanka family the property tikkanda akala seekla tikkun. Appe menegala seek jokle popun. Aitatra these are which are not controllable. This is not in our control. But these are easily controllable. Ennele kodu kali muje seekananka. Blood pressure, diabetes, cholesterol, and keep them in order. Of course, not to smoke, keep your body trim, obesity, and overweight for a control malpodu. These are the common things. Lifestyles are very important. Man is what he is eating, but the body health. And that can be taken easily care by diet and by exercise. Man is what he is thinking, mind, but the mental health. Physical, mental health correlation, balance is important because they are the tools of our living. Of course, there are other speakers following me who are going to speak on wellness and all these points. But importantly, these are the important things. Dietary, simple dietary modification. Like that, mastu onji nama mastu mandabecha malpondiji. Ennale kudu food tinpina decha mandabecha malparvalli. Nama Indian diet, Mediterranean diet, or nama South Indian diet is very easy. Nama tinpina mean, oola nankita, vegetables, etc. Very important. And this is what we have to follow. These are the thing, fruits, vegetables, nuts, fish, nama pura, bhutai, banguda, nama kane. All these our standard fish are okay. The whole grains are very important. But you have to eat small amount and you have to eat, Yetu bodate, not to get this thing. Hita, mita, satvikan. If I have to say in spiritual language, hita, mita, satvikar. If you take care of that, and it will be under control. Heart healthy puts a standard, what you should not eat and what you should eat, which are very important. Anyone would like to go through this in my website, all free educative material is there. Just say drsadharan.com, you can get all the material. Exercise is very, very important for the heart. As I mentioned, only diet, only exercise. Walking is very, very important. This is the way what has been recommended. Anything you can do. The best is walking because it's easy. Swimming, you need a swimming pool. For cycling, you need a cycle. Weight yoga, you need some time. Walking anytime. You can walk here, or walk anywhere. People who are frequent traveler, use your time in the airport for walk. I never sit in this one. I know the time of the flight is so, I walk there. So take that time, whenever possible, walk actually. 1 hour walk in a day is a very, very important thing that will take care. Why exercise is important? It takes care of major illness. Major panda cholesterol, hypertension, baka obesity, diabetes. 3 things, remember that. Diabetes, hypertension and cholesterol. These are our illness. Now coming to how to really prevent. Very easy. According to me, heart attack is easily preventable. Unnecessarily we are making big fuss. Every day you see article. Yesterday also an article. Day for yesterday article. It's coming to 30 years, 40 years. All because we don't give importance to the health. Everyone is a career oriented, nuclear family. Everyone is in a corporate culture, everything. No time for walk. If I have to ask patient, another parang time is the doctor. Late happen. Can't happen. Leave your business for 1 hour, mind you. And not at elderly age, even at a young age, very, very important. And this is what you have to do. Smoking, tobacco, physically active, eat healthy foods, maintain healthy weight, control blood pressure. Undu mooji vishaya nikul nenapdile, 5, 6, 7. According to me, if you take care of blood pressure, hypertension, diabetes and cholesterol, you are the winner. So and second important thing I would like to say, ಯಾನೊಂಜಿ ಬ್ಲಡ್ ಪ್ರೆಷರ್ಗೆ ಮರ್ದಿಗೆ ತಂದುಲ್ಲೆ, ಯಾನೊಂಜಿ ಶುಗರ್ಗೆ ಮರ್ದಿಗೆ ತಂದುಲ್ಲೆ, ಯಾನೊಂಜಿ ಕೊಲೆಸ್ಟ್ರಾಲ್ ಮರ್ದಿಗೆ, and you are happy. It's never under control, but keep this figure important, 120/80 blood pressure. Blood sugar less than 100 fasting, after eating around 140/150. And this is the area where you have to give a lot of importance, cholesterol. And we are in the process of creating a global guideline. I am being an academic coordinator, advisor to the Lipid Association. We are in the process of giving the cholesterol level, what is required for us. Very, very low level. Many pathologists still write what is the old report saying, cholesterol of, 100 LDL, everything is true, is okay, but it is not so. This is the most important thing. Remember one thing, recognize heart attack anaga warning symptoms give importance. Never ignore. Taking a ECG, very important, very easy. I will just show you one thing. I don't know, I have kept it or I don't know. Even a simple, this can take our ECG, People who are rich can keep in your pocket, 30,000 or around so. And this you give about 6 leads, Just keep on the left leg like this, hold it and you get the ECG tracing. Emergency time, take ECG immediately or take contact of the person whoever you know and see that you recognize the symptom. Don't ignore the symptom. Gas is one thing you should never think about it. I used to write Know Your Heart in the Buntara for 25-30 years, ever since I MBBS student. Every month I used to write one or the other about the heart attack, but the gas is the silliest thing, Any patient comes to me, sir, I got a gas, which is not a good thing, So this is important, recognition important, respond, immediately you have to respond, and therefore, you should know that what symptoms are and prevent healthy lifestyle is very important. Yeah, another important thing which I forgot to mention is this, In a society, whole hotel undu, cinema house, everything people know. When it comes to emergency, they don't know who is the doctor. I'm in my society, they don't know that cardiology is there in my society. They search. Remember these 3 things, very, very important. Just half a minute. Emergency to primary doctor, whoever it is, cardiologist, nearby hospital. Don't waste time. Don't waste time that 7-star hospital, 5-star, you are wasting a lot of time. That initial immediate contact and getting the diagnosis. And today it is very easy. Whenever any of my patient calls me, I talk to them on the phone and video call. You just show me where is the discomfort. I can make a diagnosis. If I talk to patient, I can make a diagnosis. So taking, in time is very important. And I would like to end my talk with thank you very much for the patient. Very, very difficult. 18 minutes heart attack, the Panpina Pandayanu, Eat Varsha Kaldina Vidya, but you can go through my website. Thank you very much. I must compliment our President Satya. He's a very dynamic, the way he wants absolutely time. And I have finished before time. Yeah. Okay. Oh.
No, I don't have this is, okay. No, don't worry. That's what professionalism is all about. Not only being a great doctor and a great orator, but to be able to say the same thing that you want to say in 10 minutes or 10 hours. Don't matter. You'll never get Dr. Sadanananda ever afraid. Thank you, Sadanananda, for bringing this absolutely on par. We have started so well, and it is with great pride that I announce that we are perfectly bang on time, maybe a couple of seconds ahead of them. So one thing they always tell us is that never ask a lady her age. And we always have to acknowledge one fact that ladies never grow old. It's just that the numbers keep moving on to a higher number. And along with that age which is going to be advancing, we have to also understand is that there are certain issues that are going to happen, there are certain changes which are going to happen, and these changes need to be understood A, by the lady herself, and B, by the supporting family, and especially the spouses. Okay? Like they always say, besides men, women have their own brand of problems, and when they reach that critical phase, it's called as men oppose. You've heard of that thing? Stop the men in their path. And to tell us more, we have an expert, and none other than the first lady of our association. I request Dr. Sangeeta Shetty to come and talk to us about PCOS and about menopause. Yeah? Thank you.
लोग ने ऐसे ही डाला हुआ है हाँ बहुत मस्त मालूम ఉందా ఉంది I'll start from here ఉందත් पीरा पूरा है बताओ आउट बैठ जाते आउट बैठ जाओ कल కూడా బత్తన్ పోండ్ Thank you, Ajitanda. Women's health is very important to us because anything affecting women's health affects the whole family's health. PCOS women and women having menopausal problems form nearly 50% of my consulting practice as of now. This shows the life cycle of a woman from a baby girl to an old age woman. During these various stages of her life, she faces various challenges. Nature has made her genetically strong to face these challenges and go ahead. Polycystic ovarian syndrome, there are multiple cysts in the ovaries. But it's not just about ovaries. It's about hormonal problems in the skin, pimples, facial and body hair, lack of scalp hair, for thinning of the scalp hair, metabolic problems like diabetes, cholesterol problems, irregular periods, infertility, psychological problems. One in 5 women, around 20% of our girls and women are suffering from PCOS, out of which 50% are not even diagnosed. 50% have a high risk of going for pre-diabetes and diabetes. They have a 3 times higher risk of going for endometrial cancer. There's not one single cause for PCOS. The main reason is obesity leading to insulin resistance and hormonal changes. Obesity is due to unhealthy eating, inadequate exercise, lack of sleep, stress, all leading to hormonal changes and insulin resistance. Nowadays, studies have shown there is a genetic factor wherein a PCOS woman, when she becomes pregnant, and if she doesn't control her weight, the female baby which was going to be born can have obesity and later on PCOS in her future life. There are 3 criteria to diagnose PCOS. When 2 of these criteria are there, we diagnose them as PCOS. Irregular cycles, delayed cycles, sometimes followed by scanty periods, but mostly by heavy and prolonged periods. Hormonal changes, pimples, excess facial and body hair, thinning of the scalp hair, darkening of the skin around the neck and armpits. Sonography shows bulky ovaries, more than 10 millimeters in volume, and multiple follicles in the ovary. Adolescence is the earliest age when we can diagnose PCOS, and if we diagnose them in time and take the adequate interventions and maintain them, we can reverse the PCOS and maybe prevent the complications of PCOS. But there is one glitch in this. Even normal adolescent girls have similar symptoms to PCOS. Like the initial years after they start their periods are irregular. They can have acne. And also the ovaries are a little bulky in size, which over a period of time becomes smaller. So diagnosing such girls as PCOS is not right because it's a social stigma to them and can affect them mentally. So such women, we don't diagnose them at PCOS. We just say that they are at risk of PCOS. So we diagnose PCOS only after the age of 18 years. Complications, there are menstrual problems, irregular periods, infertility, pregnancy complications like increased risk of abortion, diabetes, hypertension in pregnancy, psychological problems, metabolic problems, diabetes, hypertension, cholesterol problems, cardiac problems, obesity and fatty disorders, and they have an increased risk of going for endometrial hyperplasia and endometrial cancer. So we see there is multiple systems which are involved. So depending on the symptoms, it has to be a team approach where the different professionals, medical professionals will handle the different problems. The gynecologist will look after her period irregularities, will help her to get pregnant. Also will try to give her medications to prevent that she will have a risk of going for endometrial cancer. The physician and the endocrinologist will treat her metabolic problems. The dermatologist will treat her skin issues, and the mental health expert will treat her psychological problems. But the main treatment is lifestyle change, which is a healthy diet, regular exercise, proper 7 to 8 hours sleep, and treating her mental health by yoga and meditation. Healthy diet would be more of healthy carbs, less of the total amount of carbs, but more of healthy carbs, more of proteins, more of fiber, which involves fruits and vegetables, and less of fats and oils. Avoid calorie-dense snacks with sugary items, junk food. Always read the nutrition facts on a label, which tells you about the amount of calories, the sodium, the fiber, and the added and the fats. Exercise makes you control and maintain your weight, and also helps you losing weight. Moderate exercise like brisk walking, yoga, at least 30 to 40 minutes every day for 6 days a week is very beneficial. You can combine it with strength training at least thrice in a week. And if you don't like this routine exercise, you can go for some fun exercise like cycling, swimming, and dancing. It every 30-40 minutes every day for at least 6 minutes in a day. We have seen in infertile when they 5 to 10 the periods start becoming regular, the hormones start regularizing, and they become pregnant on their own without any medical treatment. PCOS woman, when she becomes pregnant, if she controls her weight, she can see to it that she doesn't pass on PCOS to the next generation, because the risk of obesity and PCOS is less in the next generation. So obesity is the main cause of PCOS. So we should inculcate good habits in our children, encourage healthy eating habits, more of fiber and fruits in the diet, avoid junk food, calorie dense and sugary foods. At least make them physically active from the 6 years onwards, involve them in games and sports. So taking these interventions during pregnancy and early childhood, and making the society aware of PCOS, our aim is to decrease the incidence of PCOS and PCOS complications in the future generation. Menopause is a very important phase of a woman's life. Due to better health care, our average Indian woman age is around 70 years, and she gets menopause at around 48 years. So she spends nearly 1/3 of her life in menopause. And during this period, she faces a lot of challenges, which if she is not aware of and then she doesn't take care of them, she can end up with health problems. So let's understand menopause. Menopause is when the ovaries start, estrogen production starts decreasing in the ovaries. The periods become irregular and the periods stop completely. When they stop completely for 1 year, then we say it's menopause. The period prior to menopause, 2 to 3 years, when the periods are irregular, it's called as perimenopause. and the years after menopause is called as post-menopause. Average age of an Indian woman for menopause is around 48 years. It's comparatively lesser compared to the Europeans and the Americans. So menopause is a part of natural aging. It's not a disease. So the common initial symptoms of menopause are hot flushes, sleep problems, mood problems, irregular cycles, vaginal dryness, weight problems, joint aches, forgetfulness, and loss of libido. Every woman's experience of menopause is different. These changes happen due to decrease in the estrogen hormones. It affects not only the reproductive tract, it affects the heart, the bone, the skin, the urogenital tract, and the brain. The long-term risks are to the bone, where risk of osteoporosis increases. The estrogen is very protective to the heart, as Dr. Sadanand Shetty said. So, till we have our periods and we have the estrogen hormone, women are at lesser risk of having heart problems. But after menopause, the protection is lost. So, women are at equal risk of having heart problems as men, maybe more because the coronary vessels and all are thinner compared to the men. Urogenital problems like dryness and urinary tract infection. Osteoporosis is a silent killer. It affects nearly 50% of our menopausal women. It causes silent fractures, especially in the hip, the wrist and the spine. There's low backache, and over a period of time, the woman becomes shorter in height and has a hump in her back. To prevent this, she should go for regular exercise, aerobics and strength training exercises, eat a good diet with calcium and proteins, go for calcium and vitamin D supplements, and go for a regular DEXA bone densitometry scan. A menopausal woman should have a balanced diet and regular exercise. She can take non-hormonal supplements containing phytoestrogens like soya bean and flaxseed, which will help her for her symptoms like hot flushes, sleep problems, mood problems, also protective to the heart and the bone. Vaginal creams for vaginal dryness, and if the symptoms are very severe, you go for hormonal replacement treatment. The main management she needs is emotional support. She doesn't know what is happening to her, why this is happening to her. So our family should support her, especially the husband and the children, who should understand what is happening to her and support her. She takes the help of her friends, her colleagues, and other friends who are going through the same phase or maybe have gone through it before. And also other support groups she can join, bhajan and satsang, so that she can stabilize her mental health. She needs to see a doctor only if the symptoms affect her daily life, if she has heavy bleeding, if she has a lot of mood changes, sleep problems, if she has urinary tract infection or painful intercourse. On a regular basis, for a regular health checkup, heart checkup should be done once a year. Bone densitometry should be checked once in 1 to 2 years. She should do screening for cancers, that is a pap smear, mammogram, sonography, abdomen, pelvis, and ovarian tumor markers. So ladies, menopause is a new opportunity to you all. Now you're relatively decreased of your responsibilities to your children. Your problems of pregnancy and periods are gone. So prioritize yourself. Take care of yourself. Have a healthy, balanced diet. Do regular exercise. Do yoga and meditation. Go for regular health checkups. Do things which you could not do and didn't have the time to do. Explore your hidden talents. Join social groups like Mahila Vibhag and Rotary, etc. Be healthy, be happy, and age gracefully. So I'd like to end with a quote by Carl Jung, which says, "Life begins after 40, and up until down we were just doing research." Thank you. I would like to thank ABD President and the committee members for giving me this opportunity to talk at this mega health unit. Thank you, Samit. हो गया ना ज़्यादा?
Thank you, Akka, for this wonderful topic with complete understanding. Let this man show in public that he is grateful for everything that she does for him. So I'm now inviting our President Satya Prakashana to felicitate Akka. Come this side, come this side. Come there, come there. वो बचपन का आदत है उनका. Like they say, it's an age-old adage that prevention is better than cure. And you don't necessarily have to get into the disease process, and that's what the speakers before us also told us. Now I'm going to invite, as what Satyana always calls, the Neela Sitaram of the group, and that is none other than Dr. Vidya Shetty. She is a very, very highly achieved lady, but I'm just going to talk about her latest achievement for which we are still waiting for a party. And the latest feather in her cap is that she got appointed as a subject expert in the field of gynecology to opine on medical negligence cases by the Maharashtra Medical Council. Ladies and gentlemen, this is the way to welcome Dr. Vidya Shetty.
Thank you so much. Puraglegenna namaskara. Matra very sorry, gainak yenk tulutit patere varpuchi. Ajitanna, thank you for that lovely introduction. Thank you so much. It's a pleasure. Namma janakala nadu to incha untonre akalda patere mast ishtapun. Masati Bunts the programs it pote I know many of the faces, but this is a different dais. Undenkala doctors dais ittinek health the one subject, very serious subject I'll be taking, and I hope end of it Nikolonji like the message illak patum popar, which will be very important for our next future as well. So good evening everyone, I'm Dr. Vidya Shetty. Purate the important sorry incidents panenda nama vavula vastu ennenaga avu yet important undu cancers nama yepala enva dadan itte tunda 2025 the data irtu yarda it is increased 2022 the data addu mast echatan daig echatini many reasons cancer the reason kendada enkul as doctors panpa anything under the sun including the sun can be a reason for cancer. So nankla gottu jidada balpun next. Anchana dadara nang solution board. Ini nama a solution dada undu avutuka. Scenario nama India da avastha ettetu yada. Almost 20% ye janaklu sayonduleru. IT 20% janaklu cancer at datra sayonduleru. Next, at least 2.35 million janaklu. E time adu nama paterondu punaga. Cancer suffer avunduleru. Any type of cancer. At least 7.3 lakh people again with cancer. And most important, nama paternaga inkala talk engul panondula edma minute 10 minutes 15 minutes every edma minute onji cancer patient cervical cancer patients ayondulu undu at serious so can we do something? That is very important. Nama konjolna tunda put at the common cancers nangotun breast cancer, cervical cancer, uterine cancer, and ovarian cancer. Nalita vishayalla namak enonduppa nange gottundu eranala pan peru kendara breast cancer ಗೆ ದಾದ ಅಲ್ಪೇರು ಜನಕ್ಲು ದಲ ಇತ್ತಂಡ ಡೌಟ್ ಆನ್ಸರ್ ತು ಬರೋದು ಉಂಟು ಏನೊಂದಿಜ್ಜೆ ಹೆಂಗೆ mammography perfect such a intelligent crowd first self examination ade all of us varane puragli mammography pore apuch aike self breast examination onji vele dala incha mass leka tikanda aidu bakka next inna doctor nadipoli doctor should be a qualified doctor always better to go to a gynecologist please remember undu paternaga mast irritating to junit simple vastu dai panonduller ಪನ್ನೊಂದುಲ್ಲ ದೈಕ್ ಪನ್ನಾಗ ರಾಂಗ್ ಜಾಗೋಗಿ ಪೋಯಾಡ ಆಯ್ತಾ ಡಯಾಗ್ನೋಸಿಸ್ ಆತೆ ಹೆಚ್ಚ ಟೈಮ್ ಪೋಕು ಆ್ಯಂಡ್ ಥರ್ಡ್ ನಿಕಲೆಗೆ ಆಲ್ರೆಡಿ ಗೊತ್ತು ಮ್ಯಾಮೋಗ್ರಾಫಿ ಕ್ಯಾನ್ಸರ್ ನಮ್ಮ ಡೀಲ್ ಮಲ್ಪನಾಗ ಮೋರ್ ಇಂಪಾರ್ಟೆಂಟ್ ಅವೇನು ಬೇಗ ಐಡೆಂಟಿಫೈ ಮಲ್ಪನ ರೈಟ್ ಒಂದು ಪಿಕ್ಚರ್ ನೆನಪುಂಡೆ ಲೇಟ್ಲಿ ಬೋಲ್ತುತ್ತಾರ ಅಹಮದಾಬಾದ್ ರೈಟ್ ಎಷ್ಟು ಜನ ಸೈತೇರ್ ಜಸ್ಟ್ ಇಮ್ಯಾಜಿನ್ ಇರ್ನೂದ್ ಪೊಂಜೋ ಇತ್ತಿನ ಫ್ಲೈಟ್ ಎವ್ರಿ ಡೇ ಬೂರುಂಡ ದ್ಯಾಟ್ ಈಸ್ ವಾಟ್ ಇಸ್ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ಒಂಜಿ ಅಹಮದಾಬಾದ ಫ್ಲೈಟಿಗೆ ನಮ್ಮ ಈತ ಹಾ ಹೂ ಪಂಡ ಒಂದು ದಿನಾಲ ಒಂದು ಮಾತ್ರ ನಮ್ಮವೇನು ಕಂಪೇರ್ ಮಲ್ತು ಒಂದಿಜ್ಜ ದ್ಯಾಟ್ ಸೀರಿಯಸ್ ಸೊ ಎಚ್ ಪಿ ವಿ ವೈರಸ್ ನಮ್ಮ ತುಯಾಡ ಐಟ್ ದಾದ ಅಪ್ಪಣ ಎಚ್ ಪಿ ವಿ ನಿಕುಲ್ ಕೇಂದು ಪಾರ ಎಚ್ ಪಿ ವಿ ವೈರಸ್ ಪೂರೇಟ್ ದ ಕಾಮನ್ ಕಾಸ್ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ದ 95% सर्वाइकल कैंसर्स HPV वायरस से दात्रा पिन तो पूरा कैंसर्स तो यारा सर्वाइकल कैंसर वल्वार कैंसर वजाइनल कैंसर ओरल कैंसर उन पूरा निकले गोतु ಐದಲ್ಲ ಇಂಪಾರ್ಟೆಂಟ್ ಇನ್ ಮೇಲ್ಸ್ ನಂಗೆ ದಾದ ಏನು ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ಉಂಡು HPV ವ್ಯಾಕ್ಸಿನ್ ಉಂಡು ಪೊಂಜೋಕ್ಲಿಗೆ ನೋ ಮೇಲ್ಸ್ ನಕಲೆಗ್ಲಾ HPV दात्रा कैंसर्स आपुन ओरल कैंसर्स पेनाइल कैंसर्स एनल कैंसर्स उंದು पूरा मेल्स आपुन एंड सिंपल इट इज नम एन्गेड नंगे अंडर्स्टैंड मल्पोली ಒಂಜಿ ಗಾಡಿದ ಮೇಂಟೆನೆನ್ಸ್ ಸರ್ವಿಸಿಂಗ್ ಮಲ್ಪರೆ ನಂಗೆ ಏತ್ ತಗೊಂಡು ಒಂದು ಸಾರ ಎರಡು ಸಾರ ಮೇಂಟೆನೆನ್ಸ್ ಮಲ್ಪುನ ಬೆಟರಾ ಹತ್ತು ವರಾನೆ 2 ಲಕ್ಷದ ರಿಪೇರಿಂಗ್ ಮಲ್ಪುನ ಬೆಟರೆ ನಮ್ಮ ಡೇ ಟು ಡೇ ಕೇರ್ಗೆ ತೊನ್ನ ಇಸ್ ಮೇಂಟೆನೆನ್ಸ್ ಅವೇ ಮಲ್ಲದ ಅದನ್ನು ಆಯಿ ಬಕ್ಕ ನಮ್ಮ ಡಾಕ್ಟರ್ ನಾಡಿ ಬಲ್ಪುನ ಇಸ್ ಬಿಗ್ isn't it 2 ಲಕ್ಷ ಇಸ್ ವೆರಿ ಸ್ಮಾಲ್ ಅಮೌಂಟ್ ಕ್ಯಾನ್ಸರ್ದ ಟ್ರೀಟ್ಮೆಂಟಿಗೆ ಮಸ್ತ್ ಸ್ಮಾಲ್ ಅಮೌಂಟ್ ಇತ್ತೆ ಮೇಲ್ಸ್ ನಮ್ಮ ಏನು ಮೇಲ್ಸ್ಗೆ ಏನು ಚಾಪಿಂಗ್ ನಮ್ಮ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ದ ಪಾತೇನು ಸಿಂಪಲ್ ಮೇಲ್ ಪಾರ್ಟ್ನರ್ಗೆ HPV ವೈರಸ್ ಎತ್ತಂಡ ಅಕಲ್ನ ಫೀಮೇಲ್ ಪಾರ್ಟ್ನರ್ಗೆ ಆಪಿನ ಚಾನ್ಸಸ್ ಇಸ್ ವೆರಿ ಹೈ ಇತ್ತೆ ಉಂದಿ ಅಂತ ತೋಜಪ ಒಂದು ಪೂರ ಮೇನ್ ಲಿಟ್ರೇಚರ್ ಒಂದು ಲ್ಯಾನ್ಸೆಟ್ ಇಸ್ ಗಿವೆನ್ genital human HPV prevails among men. More common. Prevention and treatment of HPV in men benefits both men and women. Okay, prevention of HPV in men and women, both are to be done. Neta problem dade, nanka abbas atan ke it is only woman oriented, only cervical cancers. Matra we have to understand partner nakulla ate important to let, right? So nama cancers in tunaga important dade, first important thing, prevention. Aita baka, ita anda, we have to do something, early diagnosis. Aita baka nama malpun treatment. And last stage, dala malpare anaga, akalege ittina problem incha kadame malpare appudu ancha palliation. So facts nama tuyada. Problem late diagnosis datta. Problem is that yenku undare sadhyaj. Correct? Breast mass tikandala konja vanpin yenka apuji. Yenna family day inji. It is not necessary. अरे ओले अंडला डॉक्टर एक तोजप्पाले अंडला इज्जी अंडा वेरी गुड इत्तंडा ट्रीटमेंट अंडला आपण 50% तो ನಮ್ಮ ಡಿನಯಲ್ ಉಡುಪ ನಮ್ಮ ಎಕ್ಸೆಪ್ಟ್ ಮಲ್ಪರ್ನೆ ತಯಾರಿಜ್ಜ कि ಉಂದಾರೆ ಸಾಧ್ಯ ಉಂಡು ಅಂಚಾದ ನಮ್ಮ ಪೂರ ರಿಲೇಟ್ आपण ನಥಿಂಗ್ ಕ್ಯಾನ್ ಬಿ ಇನ್ ಕಂಟ್ರೋಲ್ ರೈಟ್ ಸೊ ಪ್ರಿವೆಂಟ್ ಮಲ್ಪುನ ಇಸ್ ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್ ಐತಮಿತ್ತು ನಮ್ಮ ಹೆಚ್ಚ ಕಾನ್ಸಂಟ್ರೇಟ್ ಮಲ್ತಾಡ ಡೆಫಿನೆಟ್ಲಿ ನಮ್ಮ ಇತ್ತೆ ಈತ್ ಡೆತ್ ಆವೊಂದುಂಡು ಅವು ಪೂರೆ ನಂಗೆ ಕಡಿಮೆ ಅಲ್ಪರೆ ಅಪ್ಪ ಇತ್ತೆ ಏನು ವಾರ ಈತ್ ಟೈಮ್ ದಿಂಚಿ ಮೊಲ್ ಪ್ರಿವೆನ್ಷನ್ ಪಾತಿರೊಂದು ಮಲ್ಪುಂದದ ಐ ಹ್ಯಾವ್ ಅ ಸೊಲ್ಯೂಷನ್ ಸೊ ಪ್ರೈಮರಿ ಪ್ರಿವೆನ್ಷನ್ ಪನ್ನಂಡ ವ್ಯಾಕ್ಸಿನೇಷನ್ ನಮ್ಮ ಕಿನ್ನೆ ಜೋಕ್ಲೆ ಕೊರ್ಪಾದೆ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಕೊರ್ಪಾನ ಇಚ್ಚ ಕಿನ್ನೆ ಜೋಕ್ಲೆಗ ಏತ್ ಏಜ್ ಮುಟ್ಟ ಕೊರ್ಪ ಸ್ಟಾರ್ಟ್ ಮಲ್ಪುನೇಪ ಬಾನ್ ಐ ಸತ್ತಿಗೆ ನಮ್ಮ ಸ್ಟಾರ್ಟ್ ಮಲ್ಪ ಏತ್ ಏಜ್ ಮುಟ್ಟ ಕೊರ್ಪ ಪಪ್ಪನ ಕಳಗೆ ಏನು ಜಾಕುಲೆ ಸೊಮ್ಮಪ್ಪು ಜರ ಅಮ್ಮನ ಕಲೆ ಗೊತ್ತುಪ್ಪುಣು ಅವು ಪಪ್ಪನ ಕುಲ್ ಅಂಗಾಡಿದ್ದು ಬತ್ತಿ ಬಕ ರಾತ್ರಿ ಏನು ಮತ್ತೆ ದಾನಿ ಇತ್ಲ ಬುಲ್ಪು ನಿಂದು ಅದೇ ಸೊ ದ್ಯಾಟ್ ಈಸ್ ನಾಟ್ ಅ ಥಿಂಗ್ ವ್ಯಾಕ್ಸಿನೇಷನ್ 5 years ಮುಟ್ಟ ನಮ್ಮ ನಾರ್ಮಲ್ ರೂಟೀನ್ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಮಲ್ಪ ಅಂಚನೆ HPV ವ್ಯಾಕ್ಸಿನೇಷನ್ ಇಸ್ ಆಲ್ಸೋ ಕಂಪಲ್ಸರಿ ಫಾರ್ ಬೋತ್ men and women. An joklegla, pun joklegla, irvedegla. 9 to 14 years mutta radde dose, 0 dose and 2 months. And 14 at the Bakka 25 mutta, at least 3 doses, 0, 2 and 6. And undu ee age group dai panni panaga ee age group mutta akalna sexual life start up. Sexual life start anda, you have to give it. Before that, like panaga vara sexual life start anda, already virus uppare sadhyam, already infection uppare sadhyam. So HPV vaccine for males is also important. Prevention, cervical cancer the prevention tiyada pap test, nikale puragle gottun. Matra problem dade gottunde. OPD batte enkul pap smear pandi satik patient amone eat kinni appu. Pap smear panandi ire cancer ittu. Pap smear is just to rule out cancer. Changes dala ittanda bega identify appun. Bega identify anda bega treat appun. Bega treat anda bakkada idna problems pura solve appun. So pap test is absolutely required. Tuyada it is very simple. Khali uterus the monida methoda khali undu getonu smear getonu ave testing malpun. That's all. Dala complication iji podi lekkala iji. Please enkul mast camps malpa, come for the camps. Malpad getonle unnecessary undu pura chance budorchi nikalna early diagnosis agatra. So ire cancer the cure da agattej if you care for it at the right time. HPV vaccine nikalna young joklegu sons and daughters. Irveregla. Korpina must important. Nikalna doctors in consult malple. Definitely they will guide you. Otherwise, we are here. Association of Bunt Doctors is for all of us. So please contact us. Very happily we'll help you out. So thank you very much for this opportunity. And I hope we see the numbers coming and the cervical cancers dropping. So thank you so much for this opportunity. Thank you.
Thank you. Isn't that amazing? We have a scientific, we have so many speakers and every one of them, bingo, dead on time, in fact, with time to spare. And this is such a beautiful feeling. Obviously, we have to say a big thank you to a big personality. Vidyaka, thank you so much. Brilliant. Be generous, folks. You are the best community in the world. Yes, let's hear it for one another. Wow, cancer. Isn't it one of the most dreaded words that none of us ever want to hear? Any and everyone who has ever taken care of a family member or near a dear one who went down to the disease knows that it is downright ugly, dreadful, disforming.
I came early.
Oh, you did? Don't go early, but then if somebody has to break the news of such a bad disease, then it better be somebody good looking like this man. I call him a dude. And I like the fact that he has got such a pleasant demeanor. And when you look at the work that he shares, and what about the whole thing, I like in the Bunts Medical Association group that we've been having, he keeps sharing a lot of history of medicine, which is a rather unusual interest which Shishir has in, and he makes sure that he shares this information. So Shishir, I'm giving you the podium to please bring forth and tell us how prevention is better than cure. And of course, he'll also talk to us a little bit about Can Cure. That's his organization, and that's doing a lot of good for society. Shishir.
I bribed him. You can hear me?
Yeah.
I bribed him to give me 20 minutes extra. Normally, cancer wale ko koi bulata nahi hai, so nobody calls me. Enker le puje redde function ag. I can lay din a function ag bega hote nordu unto nal pur jana kulle. Go to the next slide. Next slide. I don't have a. Yeah. So this is a very important slide. Please, English at pan pen. We are experts in creating a problem and then finding a solution. Simple example. Jokulu nama elli uppanaga oduja last minute part odunu copy alpunu cheating alpuna pura last dapunu. Ade municipality dakul building kattuveru road kattuveru repair ಗೆ maltandu. ನಮ್ಮ ಲೈಫೇ ಅವೆ ಪ್ರಾಬ್ಲಮ್. ಕಾರ್ಡಿಯಾಲಜಿ, ಆಂಕಾಲಜಿ, ಡಯಾಬಿಟೀಸ್, we create this problem. We are the one. Even dental, we create this problem. We are the ones. We are the creator of the problem, and then we run thinking, we will find a solution. ನಮ್ಮ ಪೂರ ಊರ್ದಾಕಲು ಒರಿಜಿನಲಿ, ಬಟ್ ಒಂದು ನನ್ನ ಪಪ್ಪನ ಇಲ್ಲ MRPL ಅಲ್ಪ ಇದು ಪೊರ್ಲದ ಜಾಗ. ಬಟ್ ಸಡನ್ಲಿ ವಾಟ್ ಹ್ಯಾಪನ್, MRPL ಫ್ಯಾಕ್ಟ್ರಿ ಬರ್ತೇನೆ. ವಿ ಕ್ರಿಯೇಟೆಡ್ ದ ಪ್ರಾಬ್ಲಮ್. ಅದೇ ನಮ್ಮ ಕ್ರಿಯೇಟ್ ಮಾಡಿದಿನ ಪ್ರಾಬ್ಲಮ್. ಬೋರ್ಚಿತ್ತೆ ನಂಗೆ ಕೌಲು, ದೆರ್ ವಾಸ್ ನೋ ನೀಡ್, ಬಟ್ ವಿ ಡಿಡ್ ಇಟ್ ವಾಲಂಟ್ರಿಲಿ. ಏತ್ ಪ್ರೊಟೆಸ್ಟ್ ಮಾಡ್ತಾರೆ, ಗೌರ್ಮೆಂಟ್ ಡಿಡ್ ಇಟ್. ವೆರಿ ಅನ್ಫಾರ್ಚುನೇಟ್, ಬಟ್ ದಿಸ್ ಇಸ್ ವಾಟ್ ವಿ ಡೂ ಇನ್ ಅವರ್ ಲೈಫ್. ನಮ್ಮ ಪೂರ ಲೈಫ್ ಲಾಂಗ್ ಒಂದೇ ಮಿಸ್ಟೇಕ್ಸ್ ಮಾಡ್ಕೊಂಡು ಎವ್ರಿ ಆಸ್ಪೆಕ್ಟ್ ನಮ್ಮ ಎನ್ನಲೆ ನಮ್ಮ ಏತ್ ಪ್ರಾಬ್ಲಮ್ ಕ್ರಿಯೇಟ್ ಮಾಡ್ದೆ ಆಯ್ತಾ, ಏತ್ ಸೊಲ್ಯೂಷನ್ಗೆ ಆ ಥರ ಬರ್ಪ. ಇನ್ಕಮ್ ಟ್ಯಾಕ್ಸ್ ಕಟ್ಟುಜರು ಬಕ್ಕ ಚಾರ್ಟರ್ಡ್ ಅಕೌಂಟೆಂಟ್ ಚಲೋ ಮಲ್ಲಜ್ ಅದೇ ಗಾಯಿಡ ತಿನ್ಪಿನ ಉಂಪಿನ ಒಂದೇನು 2004 ಸ್ಲೈಡ್ ಮಾಡ್ತೀನಿ. ಅದಾಗ ಎಕ್ಸ್ಪೆಕ್ಟೆಡ್ ಇತ್ತು 2020 1.3 1 ಕೋಟಿ ಜನಕ್ಕೆ ಉಪ್ಪುವಂತೆ ಕ್ಯಾನ್ಸರ್ದ. ಆ್ಯಕ್ಚುಯಲ್ ಫಿಗರ್ ಡಬಲ್ ಆತನ, 2 ಕೋಟಿ ಆತನ, 2 ಕೋಟಿ. ಸೊ ದಟ್ ಈಸ್ ಹ್ಯೂಜ್ ಪ್ರಾಬ್ಲಮ್. ನಮ್ಮ ಈತ್ ಬೆನ್ಪಿನಿ, ಬಂಗಾರ ಪಿನಿ, ಎಜುಕೇಷನ್ ದೆತನು, ಹೋಟೆಲ್ ದಕ್ಕಲು ಮಕ್ಕಳು ಪೂರ ಮಲ್ತದು ಜೋಕ್ಲೆಗೆ ಪೂರ ಕ್ಯಾನ್ಸರ್ ಅಂಡ ಇಂಚಿನ ಆಯ್ತಾ ವರ್ತೇಜ್ ಅದೆ. ವಾಟ್ ಅ ವೇಸ್ಟ್, ಟ್ರಾಜಿಡಿ. ಏತ್ ಜನಕ್ಲೆ ಜೋಕ್ಲೆಗ್ ಯಂಗ್ ಅಡಲ್ಟ್ಸ್ 20 year 25 year 30 year old ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಪೂರ ಅನಗ ಇಟ್ ಈಸ್ ಅ ಡಿಸಾಸ್ಟರ್. ನಂಗೆ ಈತ್ ಪೂರ ಮಲ್ತೆ ತ್ಯಾಗ್ ಮಾಡ್ತೀನಿ ಅಂತ. ಆ್ಯಂಡ್ ಇಟ್ ಈಸ್ ಅ ವೆರಿ ಬಿಗ್ ಪ್ರಾಬ್ಲಮ್. ಕ್ಯಾನ್ ಯು ಪ್ರೆಸ್ ಇಟ್ ಅಗೇನ್ ಜಸ್ಟ್ ಫಾರ್. He is my very good friend, Dheerajand. Dheerappan, I think. I do not know whether you see on Instagram. Can you press this again, please? Just on the laptop. Voice. Arey yaar, you missed the fun. Huh? No voice there. Very typical ate. ನಮ್ಮೂರ್ದಕ್ಕಲು ಬಚ್ಚಿರ ತಿನ್ಪಿನಿ, ಬಚ್ಚಿರ ಬಾಯ್ಡ್ ಪಾಡ್ ತಿನ್ಪಿನ ಟ್ರೆಡಿಷನ್ ಆಗ್ತೇನೆ. ನಮ್ಮ ಟೊಬ್ಯಾಕೊ ಬೀಟಲ್ ಇಸ್ ಅ ಟ್ರೆಡಿಷನ್. ವಾಯ್ಸ್ इज नो वॉइस देयर. आई थिंक इज रन अवे चाइना स्टा करने के लिए. ठीक है, आई प्रॉमिस्ड देरप्पन दैट मैं उसको बताएगा करके. बहुत वेरी क्लोज फ्रेंड. अनफॉर्चुनेटली बीटल एंड पान ನಂಗೆ ಪುಟ್ನಾಗಲಾವಡು, ಸೈನಾಗಲಾವಡು, ಪೂಜೆಗಲಾವಡು, ಪೂರೆಗ್ಲಾವಡದೆ ನವನೇ ಅವು ವಿ ಆರ್ ಗ್ಲೋರಿಫೈಯಿಂಗ್ ಇಟ್. So unfortunate. It is part of our religion. It is so essential in our life. And we have done it. How it came, I do not know. But you do it for pura undek malple tinorchi onji bas sate. Undonji vastu undate. Again, we created this problem. Jabardast. Small packet. Pura doctor nakle Mercedes, Rolls Royce para battini undu onji product. ಹಾಸ್ಪಿಟಲ್ ನಕಲ್ ದುಡ್ಡು ಮಲ್ತೀನಿ ಒಂದೊಂದು ಪ್ರಾಡಕ್ಟೆಡ್. ಡೆಂಟಿಸ್ಟ್ ನಕಲ್ ದುಡ್ಡು ಮಲ್ತೀನಿ ಒಂದೊಂದು ಪ್ರಾಡಕ್ಟೆಡ್. ಕಾರ್ಡಿಯಾಲಜಿಸ್ಟ್ ಮಲ್ತೀನಿ ಒಂದೊಂದು ಪ್ರಾಡಕ್ಟೆಡ್. ಅಮೇಝಿಂಗ್ ಕಾಂಟ್ರಿಬ್ಯೂಷನ್ ಟು ಎಕಾನಮಿ. ಅದೇ no doctor will accept it, but believe me, this is one amazing contribution. Shortened people's lives and are killing them. But one product which we created is doing this. Isn't it amazing? We are doing this. Unfortunately, not many can afford cancer treatment. It is expensive, very, very expensive, especially the modern medicine. It's not easy. So what I say is, please stop doing whatever you're doing. Inkulelu upnaga epala hotel pondittu China sta vanasag. Once in a month, once in 2 months epa pondittu. Every day Swiggy is coming to our house. Ade hotel da kul neru veru. But it is a fact. Jokulna life, jokulna must affect on undu because everybody is busy. ಅವು ಬುರ್ದು ನಮ್ಮ ಮಂಡ್ಯ ಎತ್ತು ಸ್ಟ್ರೆಸ್ ಉಂಟು. 6 ಎಡ್ಡೆ ಸೀರೆ ಪಾಡ್ದೇರು. ಸತ್ಯಪ್ರಕಾಶ್ನ ಟೈ ಎಡ್ಡೆ ಉಂಟು. ಐತ ಟೆನ್ಷನ್ ಬಾಕಿ ದಕ್ಲಿಗೆ ಉಂಟು. ಅದೇ ಮೀನ್ಸ್ ಯೂಸ್ಲೆಸ್ ಟೆನ್ಷನ್. ಆಯ್ ಗಾಡಿ ಎತ್ತುನಿ ಇಂಚೆ ಎತ್ತುನಿಯೇ. that type of tension people are roaming around. ಆಯ್ ಗಾಡಿ ಎತ್ತುನಿ ಇಂಟೀರಿಯರ್ ಮಲ್ತುನಿಲ್ಲೇ ಬಾಪ್ರೆ. Look at what we are doing. What a waste. It is unfortunate we are doing this. So please, I hope we have somebody talking on mental health, but somewhere I think it's all contributing to our life and healthcare. Very, very unfortunate. Small cases, most common cancer. Itte 9 rupees, 10 rupees, tunda packaging guttuji. Yantin puji. But if I had known, I would have really contributed also, really. But this is the type of cancers that you're getting. Very common, very common. Head and neck cancer, is common undu, the dentist nakulla maltundullar. At common atene. And everybody is busy. It's not that everybody is busy. That common type. Purposely I'm showing this. Thing is very, very common. Maharashtra, Gujarat, Orissa, West Bengal, Assam, Karnataka is not far behind. Very important. Body lumps, bumps, please understand they are not cancer. Most of them are common. I can see one cancer surgeon here who will say, "Acha, ye bol raha hai karke." Big tumors, large thyroids, large kidney tumors. If you have urine in the blood in the urine, sorry. If you have blood in the urine, there is something wrong. Why wait? Please go. Pole or doctor na touchpale. Banji mene apun constipation apun pon dicher. Jaundice atan. Sari apun marde tonga, urda marde tonga. Hanchapur apuji. Delay costs you very heavily. Early detection, stage 1, most of the cancer within 1 lakh treatment. If it extends more time, stage 4, you spend 1 crore also, you will not get treatment. And you just spend money. You will just spend and waste your life. Not only yours, your family's. Unexpected surprises like this. Abdomen, very common. Bas, I don't think I should show you some nice posters. But this has already been discussed, so I'll not go there. Genetic cancers like this. We should feel lucky. I get up, I'm breathing well, I don't have disease. Choor blood pressure and choor sugar undu. But otherwise I'm healthy. I don't have any other problem. We should be thankful to God every day. Avu matarurpa. Undu banga. Dumbu cardiac surgery podu janaklete saipe ante. Itte saipujar. Ade? People don't die now. We should be thankful to, for our good life and science around us. But look, they are unfortunate. They get bad skin cancers. This is one example. Huge tumors, young lady sitting just like that. What was she doing? God only knows. Roaming around. Purposely I'm showing these videos to thoda little bit of shocking. I have more videos, I can show lots of them. But this is not cancer, by the way. This is just negligence. Okay? Very important to understand. Mast technology undu, robot undu, laparoscopic undu, open undu, chemotherapy undu, surgery undu, mast type the treatment undu, but you have to choose the right technology. It is not necessary. Expensive does not mean best. Please understand. Robotic surgeries. Materth important. Baka inita onji message. I think Adarsh is here. So Materth important. Please understand. Unno nama body undate old model ambassador Mark 1. Now change atichi. Nikal daithe posat gaadi po. Matra away model. Our model change atichi. Our yet edde dumincha nama gaadi budnaga a kaddadu poravalli. A petrol pump per jinja orchi. Our kerosene padweru. Mool jinjale. Mool edde petrol undu. Yet careful itte nama gaadi maintain arpunaga. Adaga gaadi mast kadame janakal ettini. Ade yet careful. You have to think about it. Same thing you have to be about the body also. No difference. Otherwise it will be like this. There's no difference. Old model. You can't change model. Gaadi change palpuchi. Posat inchinala atichi. Eda pundate parabe anage edde dojanaga. Fit. You have to do everything possible. Everything possible to be fit. Hai na, Adarsh? Everything. Huh? So there's no option. People are expecting कि hospital da ulai poi da paka chaka chak pasat servicing gaadi maltile ka pide barpand. Ade that is expectation. ಗಾಡಿ ಅದಕ್ಕೆ ಗ್ಯಾರೇಜ್ ಪಾಡಿ ಪಿದೆ ಬನ್ನ ಕಟ್ಟ ಕಟ್ಟಕ್ಕೆ ನಡತ್ತೊಂದು ಪೂರ ಕೆಲಸ ಮಲ್ಪು ಅಂದ. ಹೌ ಇಸ್ ಇಟ್ ಪಾಸಿಬಲ್? ಇಸ್ ಇಟ್ ಫಿಸಿಕಲಿ ಪಾಸಿಬಲ್? ಆ ಎಲ್ಲಿ ಉಪ್ಪುನಾಗ ಮಂಡೇಡ್ ತಾಗಿದ್ದಿನ ಗಾಯ ಇತ್ತೆಲ್ಲ ಉಂಡಿರ್ನ ಮಂಡೇಡ್ ಅದೇ ಇತ್ತೆಲ್ಲ ಉಂಡ ಅವು ಪೋಪುಜಿ ಏಪಲ ಪೋಪುಜಿ healing on the open. It's a continuous process. You damage the body, healing may take years. I'm sure the orthopedic surgeon will tell you that. Years. It is never 100%. Never. You have to understand one thing. Dinosaurs pura poditte rakle option ittens. Matra namada inchina option undu. Namada option unditte because it is in our hands. It's in our hands to change what we are doing. In our hands completely. Nobody else's. Barita erra pan pujar amera pe pan per bakabudu per. Ade joku lagal nakal tu per. Especially the women. Akulakal na priority last. Jokulna exam undu, jokulna undu. ಹಸ್ಬೆಂಡ್ ಒಂದಿಜ್ಜಿ ಮೂಲ 2 ದಿನ ಕ್ರೋಸಿನ 5 ದಿನ ಕ್ರೋಸಿನ ತಂದು ಇಲ್ಲಿ ಅಡ್ಕೊಳ್ಳೊಂದು ಉಪ್ಪೇರು ಡಾಕ್ಟರ್ ನಡೆ ಪೋಪುಜೇರು. ಇಟ್ಸ್ ವೆರಿ ಅನ್ಫಾರ್ಚುನೇಟ್. ವಾಟ್ ಆರ್ ವಿ ವೇಟಿಂಗ್ ಫಾರ್? ಯು ಹ್ಯಾವ್ ಟು ಗೆಟ್ ವಾಯ್ಸ್ ನೌ. ಥ್ಯಾಂಕ್ ಯು. ಒಂದೇದು ಬಕ್ಕ ಒಂಜಿ ಲಾಸ್ಟ್ ಒಂಜಿ ಸ್ಲೈಡ್ ತುಲೆ ಬಟ್ ಪ್ಲೀಸ್ ಪುಟ್ ದ ವಾಯ್ಸ್. Insta is a big addiction. Vara chalu maltina 1 ಗಂಟೆ ಇಂಚ ಓಪನ್ ಗೊತ್ತಾಪುಚಿ. Do I have that? Itchy. Back. I'm just waiting for that, otherwise I have finished. Okay. Is that good? Anyway, but life is not this inchane technology kai korpi Nepal. Ade operation daga current ponda pondero yo pondundu jo pondundu. But we are so dependent on technology. So dependent. Mobile then pide dite and kurnaga podi avute ninchina malpoyrendu mokolu. Go back. This is the only message I want to give. Yanu the Instagram ಒಂದು ಲೇಡಿ ನತ್ತು ಯಾ ನಮೂರ್ದಾರ ತೂತಾರೆ ನಿಕಲ್ ಪರ ಮಸ್ತ್ ಎಡ್ಡೆ ಪಾತಿರ್ವರತೆ. ರಡ್ಡು ಜನ ತೀರಪ್ಪನ್ ಬಕ್ಕಮೆ ವಾವ್
ಸಪುರಾಲೆ ಪನ್ನೆ ಅತಿ ಯಾನಿರಡು ಒಂಜಿ ಕೇನು ಸಪುರಾದ ದಾದ ಸಾಧನೆ ಮಲ್ಪೆರುಂಡು ಪನ್ನೆ ನಮಕ್ ಅಂದಾತ ಒಂಜಿ ದೇವೇರು ಕೊಡ್ತಿನ ನಮಕ್ ಒಂಜಿ ಪ್ರಕೃತಿ ದತ್ತ ಒಂಜಿ ಎಡ್ಡು ಒಂಜಿ ಗಿಫ್ಟ್ ಪಂದ್ ನಮ್ಮ ದೆತು ನೋಡು ದಾಯ ಪಂಡ ಮಾತಕ್ಲೆಲ್ಲ ಸಪುರದಕ್ಲೆಗ್ ತೋರ ಓಡು ಪಂಡ ತೋರಾವೆ ರಾಪುಜಿ ಮಾತ ತೋರದಕ್ಲೆಗ್ ಸಪುರ ಓಡು ಪಂಡ ಸಪುರಾವೆ ರಾಪುಜಿ ಆ ಪೂರ ಸೈಯಡ್ ನಮಕ್ ಸಪುರ ಓಡು ಪಂದ ನಮ್ಮ ಒಂಜಾದ ಡಯಟ್ ಮತ ಮಲ್ತದು ಬಗೆ ಬಗೆದ ತಿಂಡಿನ ಕಮ್ಮೆನ ಮತ ಖಾಲಿ ದೆತ್ತೊಂದು ತಿನ್ನಂದೆ ನಮ್ಮ ಬಂಜಿ ಬಾಯಿ ಕಟ್ಟದು ಒಂಜಿ ದಿನ ಪುಟ್ಕ ಬುಡ್ದು ಸೈತಾಂದ ಅಂಡ 14 ದಿನಟ್ಟು ನಮ್ಮ ಇಲ್ಲಲ್ದಕ್ಲು ಉಳ್ಳಾಯಲೆಪ್ಪನಕ ಬಗೆ ಬಗೆತ ಪಲಸ ದೀಪರತಿ ಅವಿನ ನಮಕ್ ತಿನಿಯರೆ ಆಪುಂಡ ಮಿತ್ರ ಕುಳ್ದು ಬಂಜಿ ಬಾಯಿ ಕಟ್ಟದು ನಮ್ಮ ಪೂರ ಬುರ್ದು ಬತ್ತಾತ ಪಂದಿ ಅಡ್ಡೆಗೆ ಎಪ್ಪುನಂಚಿನ ಪರಿಸ್ಥಿತಿ ಬರ್ಪುಂಡು ಅವೆರ್ದು ಉಪ್ಪನಕ ಜೀವನಾಡು ಹೆಲ್ದಿ ಆದ ಡೆಡ್ಡೆ ಫುಡ್ ನಮ್ಮ ಪೂರ ತಿಂದುದು ಪಟ್ಕ ಬುಡ್ದು ಸೈತಿನಲ್ಲ ನಮಕ್ ಬೇಜರಿಜಿ ದಾಯಪಂಡ 14 ದಿನಟ್ಟು ಮಕ್ಕಳು ಬಲಸ ದಿನ ಎರೆಗೆ ಬೋರ್ಡ್ ಪುಷ್ಪಕ ಅಂದಾತ ಬರ್.
Thank you very much. Thank you.
Oh, thank you so much, Anna. Thank you so much. Absolutely wonderful. To laugh in the midst of cancer is also quite a privilege, right? Amazing. I now request our president to say a huge thank you from our Association of Bunt Doctors. Awesome. So let's take the next step forward. How many of you want to live forever? Oh, that's good. The rest, you have some plans? Well, if you don't have any plans and you want to live on and on and on, I will know of a definite way where you can do it. And it's simple. It's called organ donation. You don't need to put on the pyre because while you're going after this, it's not going to be required. So simply leave behind. That's the time that you want to leave behind and give your biggest donation of your life after it's done with, so that somebody else is going to benefit from this and it's going to make some family, some human being's life so much better. And to tell us more about this, I invite Madam Sujata Astekar, who's the coordinator of Roto Soto. Roto Soto is a regional and state organ and tissue transplant, and she's from KM Hospital. I invite you to please tell us about how we can go about it. We also have a counter on the outside, so after we finish the scientific, please go outside, meet with her, and she has a team, I'm sure, of people who will guide you as to how you can go ahead, pledge your organs, and make your life, afterlife, more beneficial for somebody. Sujata ji, floor is yours.
Good evening. Thank you for this opportunity. I'm really grateful to Association of Bunt Doctors and Dr. Satyaprakash Shetty ji. It is not the first time that he's supporting this cause. It's for, I think, for many years, any activity he will try to promote this noble cause. And I must say that we together have tried to save some lives, step towards saving some lives. So thank you for the opportunity. I have come from Roto Soto West and I'm working as an IC consultant there. And what is Roto Soto is something I will tell in one line, because it is regional cum state organ and tissue transplant organization. शायद आप में से बहुत कम लोगों ने इसके बारे में सुना होगा, बट ये मिनिस्ट्री के अंडर है और केएम हॉस्पिटल में इसका ऑफिस है और ये गवर्नमेंट ऑफिस है. नेक्स्ट स्लाइड. ओके, तो in our country there is a law which supports organ donation and prevents commercialization of organs. So the law came into existence in 1994. It was not to promote organ donation but to stop commercial dealings. In the 80s, there were kidney transplants happening. People were given money and the kidneys were taken. Nobody knew what was happening to those patients. There was no regulation. And in any sane society, लोग नहीं चाहेंगे ना कि इसका किसी के साथ बुरा हो या exploitation हो. So our people came together, the people in the parliament passed the law, and now in our country we cannot sell or buy organs. आपको कोई पूछता है हमको किडनी बेचनी है तो नहीं, ये कानूनन गुनाह है. There is a regulation of the government. Any organ which is removed, transplanted, so who was the doctor, who was the patient, to whom it was transplanted has to be informed to the government, and that's why these Roto Soto, Noto and Soto have been established. Noto is national body, that's why it's in Delhi. There are 5 Rotos. Our country has been divided into 5 regions. So east, west, north, south, northeast. So western region Roto is there in KM Hospital, and Soto, each state will have Soto. So for their Soto, Maharashtra is there, Soto Gujarat is there, and we are Rotos for all western region. So all this data is maintained and there is a regulation on removal. Then living donations. Yes. Yeah. So living donations are allowed, but only from the close relatives. आप सबको मालूम होना चाहिए कि अगर मैं किसी को किडनी देना चाहती हूँ तो वो मेरा क्लोज रिलेटिव होना चाहिए, या he has to be related to me because of love and affection. My old friend, my mama, chacha, they can give, but there is one extra interview put by the government कि there is no commercial dealing. So why I am sharing this with you, because we all should know what is the process of organ donation from living donors as well. There are two organs which we mainly donate from living organs, that is kidney and liver. The other organs we take mostly after death or from disease. And it has given recognition to brainstem death. लॉ ने कहा कि आप बेच नहीं सकते, खरीद नहीं सकते, आपको चाहिए तो आप रिश्तेदारों से ही लो, तो फिर जो हार्ट है वो कहाँ से आएगा? So they said that we will now regulate brainstem death, and which has paved the way for organ donation. तो organ donation हम किस लिए करते हैं? There are many of us who are suffering from end stage organ failure. Someone is suffering from end stage kidney failure, someone from liver failure, someone from heart which is not going to work for a long time, someone from lung failure, and ये हमारे में से ही कुछ लोग हैं. So for them there is only one ray of hope, that is a transplantation surgery in which this organ will be replaced by a new organ और उसके जगह नया ऑर्गन लगाएंगे. तो ये नया ऑर्गन वी कैनॉट मेक इट इन अ लैबोरेटरी, वी कैनॉट गेट इट फ्रॉम एनीवेयर. वन पर्सन हैज़ टू हेल्प द अनदर वन. सो ओनली फ्रॉम अ लिविंग पर्सन. उसमें लिमिटेशन है सिर्फ किडनी लिवर, और बाकी अंग हमको चाहिए तो मृत्यु के बाद ही हम डोनेट कर सकते हैं. और हमारे जितने भी पेशेंट्स हैं इनके लिए ये ऑर्गन डोनेशन ये एक आशा का किरण है. So what are the organs which we can donate? If you look to your left, heart, lungs, liver, kidneys, intestine and pancreas. These are the organs which are required for us to be alive. And then they are very important. These are solid organs. And if you go to right, there can be tissues like cornea. कॉर्निया अगर इंसान अंधा है तो वो मरता नहीं है, बट आप ही सोचो कि जिसको आँख मिलती है उसके लाइफ में क्या फ़र्क होता है. सो कॉर्निया डोनेशन इज़ पॉसिबल, स्किन डोनेशन इज़ पॉसिबल. दिस बोथ कैन हैपन इवन एट होम. इफ़ द डेथ इज़ एट होम वी कैन टेक दिस, एंड इवन हैंड्स can be donated. We have done hand donation in KM Hospital in Maharashtra. So all these organs can be easily donated and transplanted in our country and in our state as well here. So as I was saying, donations in case of cardiac death, जब हार्ट बंद हो गया, जो हम सदियों से जानते हैं कि कोई गया मतलब उसका हार्ट बंद हो गया है, तो कॉर्निया, स्किन एंड बोन्स कैन बी डोनेटेड. ये घर पे भी हो सकता है बस 6 घंटे के अंतर. सो वी जस्ट रिक्वेस्ट दैट पीपल शुड कॉल अस. जब ऐसे कुछ होता है तो हम क्या करते हैं, जनरली घर वालों को फ़ोन करते हैं जो हमारे क्लोज रिश्तेदार है, उनके साथ ही एक फ़ोन आई बैंक, स्किन बैंक या रोटो सोटो को जाना चाहिए. अगर आप 6 घंटे बाद फ़ोन करेंगे तो शायद वो टिश्यूज़ हम नहीं ले पाएंगे. सो दैट इज़ वेरी इंपॉर्टेंट. तो आज ये नंबर जो है नोटो सोटो का वो आपके साथ आपको लेके जाना है. बट अदर ऑर्गन्स लाइक किडनी, liver, heart, lungs, small bowel, pancreas can be donated only in case of brain stem death. So what is this brain stem death? It is the stage at which all functions of the brain stem have permanently and irreversibly ceased, and it's so certified. और आप देखोगे कि ब्रेन स्टेम डेथ में हार्ट इंसान का बंद नहीं होता है, दैट हार्ट इज स्टिल बीटिंग. सो पीपल विल आस्क अस कि आप कैसे बोल सकते हैं उनकी तो धड़कन चल रही है, फिर भी वो हमारे बीच में नहीं है और उनकी मृत्यु हो चुकी है. और आप ये मृत्यु है ये भी लॉ ने बताया है, बिकॉज इट सेज permanent disappearance of all evidence of life occurs either by BSD or in the sense of cardiopulmonary. So organ donation में brain stem death मतलब death. Brain stem is a small part in our brain which has the connection between our upper brain and lower body. All the 12 cranial nerves pass through this. If for some reason, if this is not functioning and irreversibly damaged, then the person is declared brainstem death. So it has all important functions for us to be alive. So if what can be the cause? It can be some injury to brain or our head. So this is not common in India, but this is one of the cause, gunshot injuries. This is very common in India, fall from height. Especially Mumbai में जब लोग ट्रेन से भी गिरते हैं बहुत सारे. Road accident, we can prevent young lives if they wear helmet. So it becomes very difficult to go to the parents of 25-year-old and ask for organ donation. So it can be prevented if we all follow traffic rules and helmets are put. But road traffic accident से head injury होती है. Sometimes it need not be always trauma. Medical cases also like intracranial bleed can lead to brainstem death. So ये ICU में ही होती है, ICU के बाहर कभी भी brain death नहीं होती. This patient is not comatose, patient is beyond coma. So if we come to know that patient is at home, then he cannot be brainstem death. He will be in the ICU and we can declare brainstem death only in a registered hospital. Now when there is a ICU, there can be brainstem death. So because of awareness sessions like this, if we get a call, we find out, talk to the intensivist, and if the family is willing, we shift the donor to the nearest registered hospital. So we have around more than 130 hospitals which are registered for organ donation. And patient has to be deeply comatose, but all comatose patient need not be brainstem death. And 4 doctors जो government ने recognize किए हैं will declare patient brainstem dead, and then we approach the relatives. So generally process ऐसी होती है कि doctors को पहले पता चलता है, क्योंकि धड़कन चल रही है तो relatives को नहीं पता चलता. Patient comatose है, ICU में है, तो पहले डॉक्टर्स को जनरली पता चलता है, बट रिलेटिव्स आजकल अवेयर हो गए तो कभी कभी पूछते भी है. डज नॉट मीन कि ब्रेनस्टेम है तो ऑर्गन्स ले लिए, नहीं, वो अच्छे हैं कि नहीं ये भी देखा जाता है. कोई एक्टिव इन्फेक्शन है तो शायद हम नहीं लेंगे. फिर ब्रेनस्टेम डेथ टेस्ट के लिए 4 डॉक्टर को बुलाते हैं. फिर जो 4 डॉक्टर है वो एक बार देखते हैं, फिर 6 घंटे बाद और एक बार देखते हैं, और फिर हमको एक नियर रिलेटिव की परमिशन लगती है. बहुत बार जहाँ पे पब्लिक हॉस्पिटल में ऐसे देखा गया है कि पेशेंट कोमाटोज है, बेड पे है, बट उसके रिलेटिव्स कहीं यूपी में है, नेबर्स ने लाके एडमिट कर दिया. तो वी हैव टू वेट फॉर द रिलेटिव्स, क्योंकि उनकी कंसेंट बहुत ज़रूरी है. और हम उनको पूछते हैं, एंड फैमिली की कंसेंट होने के बाद ही हम आगे उनको ऑपरेशन थिएटर में लेके जाते हैं, जिस पे हम रिटर्न कंसेंट फैमिली की लेते हैं. सो देर इज़ नो क्वेश्चन कि हॉस्पिटल में बॉडी लानी है क्या. नो, ऑलवेज इन ऑर्गन डोनेशन बॉडी इज इन द हॉस्पिटल. सो देर इज़ वन पर्सन कॉल्ड ट्रांसप्लांट कोऑर्डिनेटर इन एवरी हॉस्पिटल. आपको कहीं भी ऑर्गन डोनेशन का कुछ पूछना है तो ऑलवेज आस्क फॉर अ ट्रांसप्लांट कोऑर्डिनेटर इन दैट हॉस्पिटल. यू विल बी प्रॉपरली गाइडेड ऑन ऑर्गन डोनेशन. कुछ डर लोगों के मन में रहता है या कुछ सवाल रहते हैं कि कुछ चांस है कि वो उठ जाएगा क्योंकि दिल धड़क रहा है, तो फैमिली ये पूछती है, विच इज़ वेरी नेचुरल. बट हमको एक चीज़ आज बहुत क्लियरली यहाँ से लेके जानी है कि ब्रेन डेथ इज़ डेथ, नो चांस ऑफ सर्वाइवल. ब्रेन वो पेशेंट को निकालते समय, ऑर्गन निकालते समय कुछ दर्द नहीं होगा, बिकॉज पेशेंट इज़ नो मोर. उसमें भी जो डोनर है उसका कुछ डिसफिगरमेंट होगा क्या, तो नहीं, क्योंकि एक लाइव सर्जरी जिस केयर से की जाती है उस केयर से वो सर्जरी की जाती है, और बॉडी जो है रिलेटिव्स को लास्ट राइट के लिए वापस दी जाती है. तो बॉडी डोनेशन एक रिसर्च पर्पस के लिए होता है. जब एनाटॉमी डिपार्टमेंट में कॉलेज में बच्चों को पढ़ने के लिए बॉडी दी जाती है, तब ब्रेनस्टेम की शायद ज़रूरत भी नहीं है, क्योंकि वो ऑर्गन्स हम निकाल के किसी को नहीं लगाने वाले, उसके ऊपर डॉक्टर पढ़ने वाले. बट ये जो है ये थेरेपेटिक पर्पस के लिए है. यहाँ पे कोई ऑर्गन बैंक के बारे में आप नहीं सुनेगा, क्योंकि ऑर्गन कुछ घंटों में लगाए जाते हैं, 6 घंटे 8 घंटे, और फैमिली को कोई भी कॉम्पनसेशन या पैसा नहीं दिया जाता. और ये पूरा डिस्ट्रीब्यूशन गवर्नमेंट ऑर्गेनाइजेशन करते हैं. व्हाट्सएप पे बहुत सारे मैसेजेस आते हैं कि एक फैमिली इधर इधर एडमिट है, उनको ऑर्गन डोनेशन करना है. तो जो ऑर्गन्स डोनेट करने हैं वो थ्रू गवर्नमेंट ऑर्गेनाइजेशन ही होते हैं. तो ये ऑर्गन डोनेशन हम करने की आज ठान ले. आप उसके बारे में ज़रूर जानकारी लें, क्योंकि जो अंग हम कुछ घंटों में जला देते हैं वो किसी की ज़िंदगी बचा सकते हैं. शायद ये दुनिया छोड़ जाने के बाद हम किसी में ज़िंदा रहेंगे. और हम भगवान को अगर मानते हैं तो इससे अच्छा काम क्या हो सकता है ज़िंदगी बचाने का. और हम 7 या 8 लोगों की ज़िंदगी बचा सकते हैं. और जिन्होंने ये किया उनसे अगर आप बाद में बात करते हैं तो वो बोलते हैं कि कुछ नहीं समझ आ रहा था, सब खत्म हो गया था, बट हमने ये किया और आज अच्छा लगता है कि हमारे वजह से किसी की ज़िंदगी बच गई. सो ये एक स्कैनर है. अभी आपको लगता है ये सब सुनने के बाद कि इसके बारे में मैं थोड़ा जानना चाहती हूँ या आई वांट टू डू इट. सो नाउ देयर इज़ अ गवर्नमेंट लिंक from the Ministry of Health and Family Welfare, which is open for all over India, which is common to all of you. So you can see the name of the link or you can scan. Scan करेंगे तो आपको एक इसके ऊपर मैं आई एम ट्राइंग टू यूज़ द हाइपर लिंक बट आई एम नॉट एबल टू लिंक. बट मेरे पास एक वीडियो था, forget about it. But this is something. When you scan, the link will get open. I'm just keeping it for 1 more second so that more of you can scan this. There is a stall outside, you can scan this. आज कम से कम ये स्कैनर तो घर लेके जाइएगा. Then you can sit at home, think about it, discuss with your relatives, and then you put your Aadhaar number. After you put your Aadhaar number, you will get a verification code, and then it will ask for which organs you want to donate. It will ask for name of the relatives to whom you want to inform. It will ask for emergency contact number, and when you submit, then you will get a certificate like this, and this you download and share with all your friends, family members. एक दिन के लिए उसका status भी रख दो, क्योंकि people will know that you have donated. Because if you don't share and something happens and the relatives say no, it's a no. So it is important, more than this form, it is important कि we all share our wish with our relatives and friends, so that when the opportunity comes, they don't say no. So it is possible that even after pledging, sometimes we may not be able to take organs, because if tomorrow I don't die a brain death, I may only will be able to give skin and cornea. So there is a long waiting list and very few donations. You can see only 172 donations and 7,000 patients are waiting for kidney. So it's a long waiting list. So we can reduce this gap by taking one step towards organ donation today. So donate organs, save lives, and scan the QR code. Thank you very much.
Madam Sujata is available she is available sitting outside. If you want to pledge, definitely you can discuss and you can fill up the form, or you can, I think website is there. Yes. She's going to explain everything. Myself and my wife, Dr. Sangeeta, we have already pledged. I request all of you, visit the stall, and definitely it's for a noble cause. I think both of us, we are promoting this since many years now. Thank you.
Thank you, Sujata ji. It's really heartwarming to realize that we are still useful after we are so-called useless. And we are a very generous community, and I'm sure that when we take anything to our heart, we fulfill that every desire. And that is something which is close to everyone's heart here. We have seen our family and friends being in hospital. You've seen them going through long, extended disease processes. And at that time, there are two worries that normally come to the front. One of them is a worry about whether relative is going to get completely well and how long is it going to take? And the second thing is that, oh boy, is it going to cost an arm and a leg to get back? So all of us have taken some kind of the other of some insurance policies. But then when you comes to time of submitting your claim, you realize that the insurance companies start showing you new tricks and they are not fulfilling and not happy to fulfill their side of the promise. Maybe we've done something wrong, maybe we have not done everything right. And this happened all the time till today. Today we have an expert, we have CA Bhavesh Thakkar, who is an authority on this subject, and he will guide us about having our policy with the right company, with the right policy, and also with the right way to do things. This is all very important, and you need to, and we need to learn from an absolute expert. And that is why we have Bhavesh ji, who is also referred as a financial doctor. And very importantly, please realize that he's an active participant of the $1 Million Roundtable USA. So he is highly achieved. And ladies and gentlemen, my proud privilege to present Bhavesh Thakkar ji. Bhavesh ji, the floor is yours.
Matar Elega Namaskar. This is the only word which I have learned in Tulu, and thanks to Dr. Sangeeta Shetty, who could quickly train me on this. So thank you so much. Thank you so much for lovely introduction. My gratitude to Association of Bunt Doctors for giving me this opportunity, particularly Dr. Satyaprakash Shetty for giving me this opportunity to share my views on most simple yet complicated subject, mediclaim. Now, let's start. Have you come across this information on social media? This was viral few days back. Actually, I got this from one of the doctor. This was a post on LinkedIn. One of the family member, he lost the claim in spite of submitting all the requirements. And frustration when he has posted this on LinkedIn, it was so much viral. Iske saath saath, there was one more news in newspaper, Times of India. Have you come across this? आपका मोबाइल का गूगल लोकेशन यदि आपके हॉस्पिटल से मैच नहीं होगा तो क्लेम रिजेक्ट हो जाएगा. ऐसा एक न्यूज़ आया था न्यूज़पेपर में. कभी सुना है इसके बारे में? सो डोंट वरी, हम लोग इसके बारे में बात करने नहीं आए. बट ऐसा यदि इन्फॉर्मेशन आपके पास आया है, बिकॉज मेनी ऑफ माई क्लाइंट दे गॉट वरीड कर ये सब क्या है. मतलब हम लोग को अभी व्हेन वी गेट हॉस्पिटलाइज वी नीड टू कैरी मोबाइल विथ अस एंड दैट टू विथ द लोकेशन बीइंग केप्ट ऑन, which is practically not possible. So now let's do one thing. यदि ऐसा कोई information आपके पास आता है, so don't get worried. या आपने कभी experience किया इधर through your relative या maybe through your patient, हम लोग क्या करेंगे? We will just try to discuss today कि can we try to find out a solution for this. Before I start on this subject, let me share with you one important thing. I started this career way back in 1990s. और तभी mediclaim was very, very, very simple. If I share with you what was, I think many of you were there in 90s और आप लोगों ने शायद 90s में mediclaim लिया रहेगा. If you recollect, in 90s, mediclaim was very simple to understand. एकदम सादा simple था. Premiums were very low because cover itself was so low. बड़े बड़े amount मिलते नहीं थे. Exclusions बहुत कम थे. तो understanding was very, very easy. Sum assured was ranging anywhere between 10,000 to 5 lakh was a huge amount. और जो प्रीमियम था, आई रिकलेक्ट साल का प्रीमियम वॉज अराउंड 100-200 रुपीज एंड वो भी पीपल वर नॉट गोइंग फॉर. सो दिस वॉज अ केस इन 1990. नाउ इसके कॉन्स क्या थे? कवरेज वॉज वेरी वेरी लिमिटेड. इट वॉज कवरिंग यू ओनली फॉर हॉस्पिटलाइजेशन. नो कैशलेस. कैशलेस फैसिलिटी तभी इतना इधर इंट्रोड्यूस हुआ नहीं था या बहुत कम लेवल पे था. पेपर वर्क वॉज मैन्युअल, मतलब वो प्रपोजल फॉर्म फिलअप करो, राइट डाउन ऑल द इंफॉर्मेशन. क्लेम प्रोसेस ऑल्सो वॉज वेरी वेरी स्लो. देर वेर फ्यू चॉइसेस बिकॉज देर वॉज ओनली गवर्नमेंट कंपनीज अवेलेबल. कॉम्पिटिशन नहीं था जिसकी वजह से हम लोग को ऑप्शन अच्छे नहीं थे. सम एश्योर्ड वॉज मैक्सिमम 5 लाख. 5 लाख तो बहुत बड़ा हुआ, 1 लाख के ऊपर कोई लेता नहीं था. सो हायर सम एश्योर्ड का ऑप्शन नहीं था. नाउ लेट्स टॉक अबाउट मेडिक्लेम इन टुडेज सिनेरियो. आज क्या क्या ऑप्शन है? वाइड कवरेज, ओपीडी मिल जाता है अभी. यू कैन ऑल्सो गेट कवर्ड फॉर डे केयर, वेलनेस, मैटरनिटी कवर, ऐसे बहुत सारे बेनिफिट्स आज मिल रहे हैं जो पहले नहीं मिलते थे. क्लेम्स कैशलेस, ऑलमोस्ट एवरीवेयर और मैक्सिमम हॉस्पिटल्स में यू गेट कैशलेस क्लेम. डिजिटल, हाँ, ऑनलाइन परचेस कर सकते हैं, ऑनलाइन रिन्यू कर सकते हैं, इवन वी कैन लॉन्च द क्लेम ऑनलाइन. तो एवरीथिंग इज बिकमिंग डिजिटल नाउ, वेरी कन्वीनियंट. एड-ऑन्स, यू कैन मेक योर ओन मेडिक्लेम का पॉलिसी. आपको क्या चाहिए आप बताओ, मतलब दिस इज लाइक पिज्जा. पिज्जा ऑर्डर करो और टॉपअप लेते जाओ, जो बेनिफिट आपको चाहिए सब मिलेगा. ऑल टाइप्स ऑफ एड-ऑन्स एंड राइडर्स आर अवेलेबल, सम एश्योर्ड अप टू 5 crores. सो देर आर मेनी टेकर्स हु गो फॉर 5 crore का मेडिक्लेम इंश्योरेंस. लेकिन इसके साथ साथ देर आर सम डिसएडवांटेजेस. कॉम्प्लेक्स टर्म्स एंड कंडीशन, यदि नहीं होता तो मैं आज आता ही नहीं ना. एवरीवन वुड हैव अंडरस्टूड. इट इज वेरी वेरी कॉम्प्लिकेटेड. आज का मेडिक्लेम इज एक्चुअली अ कंफ्यूजिंग वन. प्रीमियम्स राइज शार्पली, थोड़ा भी एज बढ़ा प्रीमियम तुरंत बढ़ जाएगा. क्लेम लिया, कोई सब स्टैंडर्ड लाइफ है, कोई प्री एग्जिस्टिंग डिजीज है, लोडिंग लग जाएगा, इमीडिएटली प्रीमियम विल शूट अप. हाँ, सब लिमिट्स, को पेमेंट्स एंड लॉट ऑफ एक्सक्लूजन्स. ये सब चीज़ें क्या करती है, पीपल गेट कन्फ्यूज्ड. And in this confusion, many a times people buy a wrong policy, या they end up not getting the claim. See, purpose of mediclaim is very simple. वो पॉलिसी सबसे अच्छी है जो आपको क्लेम देगी, कोई भी कंपनी रहने दो. Now, ओवर मार्केटिंग एंड मिस सेलिंग. गलती से आप में से कभी किसी ने पॉलिसी बाजार पे जाके अपना मोबाइल नंबर शेयर किया है? किया रहेगा ना. एनी पोर्टल, क्या होगा, हैमरिंग. दिन में 10-12 कॉल, रोज कॉल. सो ओवर मार्केटिंग. मिस सेलिंग नॉर्मली बैंक्स वगैरह के यहाँ से बहुत सारा होता है, बिकॉज दे जस्ट वांट टू सेल द प्रोडक्ट. सो ये भी काफ़ी हो रहा है. क्लेम रिजेक्शंस, हम लोग आज यहाँ पे है बिकॉज क्लेम्स आर गेटिंग रिजेक्टेड. लाइक वी कांट से कितने क्लेम्स रिजेक्ट हो रहे हैं रोज के रोज. एक भी छोटा भी इंफॉर्मेशन में गड़बड़ हुआ, क्लेम स्ट्रेट अवे गेट्स रिजेक्टेड. सो व्हाट वी विल डू, इंस्टेड ऑफ टॉकिंग अबाउट विच कंपनी इज गुड या विच प्रोडक्ट इज गुड, लेट्स टॉक अबाउट क्लेम कैसे कैसे रिजेक्ट होते. एंड आई एम गोइंग टू शेयर विथ यू माई पर्सनल एक्सपीरियंस. तो जो भी मैं शेयर करूंगा वो वही क्लेम्स रहेंगे जो मैंने खुद पर्सनली एक्सपीरियंस किया. अदर पीपल हैव कम टू मी और आई हैव शेयर दैट एक्सपीरियंस विद ऑल द पीपल. ये जो क्लेम्स है, दिस आर फ्यू केस स्टडीज. आपके मेडिकल साइंस में जो होता है ऐसा ही सेम केस स्टडीज. नाउ सबसे कॉमन केस, नॉन डिस्क्लोजर ऑफ पीडी. आप में से ये काफ़ी लोगों ने एक्सपीरियंस किया रहेगा. वेरी कॉमन थिंग. अभी आई गॉट अ केस ऑफ अ 58-year-old मेल. ही वॉज हॉस्पिटलाइज फॉर हार्ट अटैक, एंजियोप्लास्टी परफॉर्म हुआ, क्लेम का अमाउंट 2.5 lakh. क्लेम गॉट रिजेक्टेड. रीजन, डायबिटीज एंड हाइपरटेंशन वॉज नॉट डिस्क्लोज्ड व्हेन दे बॉट द पॉलिसी. क्या कर सकते हैं, हमने फॉर्म भरा था, गलती से रह गया बताना, हार्ट अटैक, एंजियोप्लास्टी हुआ, क्लेम रिजेक्टेड. Now when people they come to me with this case, absolutely helpless situation, कुछ भी नहीं कर सकते. But we can learn. What is the lesson? जब भी पॉलिसी लो, honestly disclose each and everything. कितना भी छोटा क्यों ना हो, just disclose blindly. Don't think much कि ये बताओ कि नहीं बताओ. Second case that comes to me is waiting period clause. ये बहुत ही common है. So I got a case, 33-year-old female. She was hospitalized for uterine fibroids. Claim amount was 75,000. Her claim got rejected because she bought a policy, and after buying a policy, within 6 months, she got operated for this surgery. Unfortunately, this is not covered in first 2 years. आप में से काफ़ी लोग को इसके बारे में पता होगा कि दिस इज नॉट कवर्ड, बट जो लेमैन होता है ना, उनको ये सब नहीं पता होता है. सो ऐसे बहुत सारे वेटिंग पीरियड के क्लॉजेस है. हमें क्या करना है, इसमें कितना भी आप फाइट करो, इवन इफ यू से कि व्हेन आई टुक द पॉलिसी कुछ भी नहीं था, मुझे अचानक से हो गया, तो भी क्लेम नहीं मिलेगा. सो व्हाट यू नीड टू डू, अंडरस्टैंड पॉलिसी में कौन से वेटिंग पीरियड क्लॉजेस अप्लीकेबल है. नाउ देयर आर मेनी वेटिंग पीरियड्स. फॉर एग्जांपल, लुक एट दिस. इनिशियल वेटिंग पीरियड, first 30 days. Most of the policies, they don't cover any treatment taken in first 30 days of policy being issued, except accidental case. Waiting period for PD, it can range from 1 year to say 3 or 4 years. Then waiting period for specific medical condition. जो मैंने case study आपको बताया, that was specific medical condition. Mostly first 2 years, This specific medical condition is not covered. Waiting period for accidental, इसमें mostly waiting period नहीं होता है. Maternity, it can range from 1 year to say 3 or 4 years. Newborn, again mostly it is 0, but some policies they have a waiting period of 1 year to 3 years. COVID अभी mostly not applicable. आपका group health insurance है, तो group health insurance का terms and conditions are absolutely different from buying an individual policy. So हर एक group policy का terms and conditions would be customized, would be separate. अभी ये सारे waiting period आपको study करने होंगे when you buy the policy, but not when you claim. So ये बहुत ही important conditions है. Going further, I got one case study which was a lapse policy. Now what do you mean by lapse policy? I got a 63-year-old lady ka claim. She was hospitalized for pneumonia. Claim amount was around 98,000. Claim was rejected because her policy got expired 2 days back. मतलब समझो somebody is hospitalized on 10th August. 8 August को policy बंद हो गया, expire हो गया. Now let me tell you, policies में grace period होता है. And within that grace period you can renew. Let me repeat, you can renew, but यदि गलती से claim आ गया, claim नहीं मिलेगा. And many a times people forget that. So simple lesson, policy का due date का at least we strongly recommend एक आध हफ्ता पहले renew कर दो. At least 1 week before your due date. Don't miss that date at all. Case 4, cosmetic treatment. Now, 28-year-old male, he was hospitalized for septoplasty with cosmetic nose reshaping. Claim amount was 60,000. Seedha claim got rejected because this is cosmetic surgery. Now, cosmetic surgeries are not covered. Lekin, in some cases, they also covered cosmetic surgeries. Can anyone share what that cases would be? Accidental, absolutely right. So, plastic surgery in case of accident are covered. Otherwise, any cosmetic surgery is not covered unless medically warranted. So, accident case is one of the example. Going further, I got one case for room rent limit. Now, this is again a very, very common. Every policy has capping. Now, this case was about a 47-year-old businessman. He was hospitalized in a hospital with a deluxe room, which was around 5,000 per day. Claim amount 2.8 lakhs. Room rent capping. Now, 3 lakh ka policy tha. Room capping was 3,000. So, eligibility is 3,000, but he chose 5,000 ka room. So how much money should be deducted? 2,000? I think many of you know, अभी ऐसा नहीं है. If your eligibility condition is not fulfilled, proration clause applicable होगा, and he got claim of only 1.6 lakhs. So again, an important lesson to be learned. Select a room which is your eligibility condition में. जो आपके policy में लिखा है, as on date, if you see, many policies that don't have room capping. So select a policy जिसमें room capping है ही नहीं. So this will automatically solve the problem. Next claim, rejection due to congenital disease. Now this is again a very, very common reason. एक 5 साल का बच्चा, he was covered under a family floater from a father. He was hospitalized for congenital heart defect. Corrective heart surgery हुआ, 4.2 lakh का खर्चा हुआ. But claim got rejected. Now इसमें बहुत सारे layman थे कम कि भाई हम जब birth हुआ था तब तो हमें पता नहीं था problem है, कुछ भी नहीं कर सकते. Medical science is such a science जहाँ पे जो है वो है. If this comes under the category congenital, आप वो 5 साल की एज में करो कि 15 साल की एज में करो, it won't be covered. So what is to be done? Select a policy जिसमें congenital भी covered है. And today there are many policies they cover for congenital benefit also. Next case, rejections during porting. Now porting हम लोग normally कब करते हैं? Either the person is not satisfied with the advisor or company. So people say कि चलो इसको port कर दो and our continuity will continue. अभी 36-year-old male, he ported from insurer A to insurer B. 3 साल पहले इन्होंने पॉलिसी लिया था. He was with insurer A for 3 years. Then he ported to insurer B. और 4th month में किडनी स्टोन का सर्जरी हुआ. Claim got rejected. See the reason. Claim got rejected because insurer B found a sonography report जहाँ पे already ये ailment present था. Now policy was taken 3 years back. Porting किया मतलब you get all the continuity benefit. But unfortunately यहाँ पे क्या हुआ? एक sonography report मिल गई जहाँ पे ये already ailment था which was not disclosed when the porting was done. पूरा क्लेम रिजेक्ट हुआ. सो व्हाट नीड्स टू बी टेकन केयर ऑफ व्हाइल पोर्टिंग, एंश्योर फुल डिस्क्लोजर. जितना भी पीडीए सब डिस्क्लोज करो. जिस दिन आपने पहला पॉलिसी लिया था एंड द डे व्हेन यू पोर्ट, उसके बीच में भी यदि आपने कोई भी रिपोर्ट्स कराई है, प्लीज डिस्क्लोज ऑल दैट रिपोर्ट्स. वन मोर केस, नॉन डिस्क्लोजर ऑफ स्मोकिंग हैबिट, अ वेरी कॉमन वन. यहाँ पे एक 45 का मोल है जिसको सीओपीडी का क्लेम था, एंड दिस पर्सन 3.5 लाख का क्लेम गॉट रिजेक्टेड बिकॉज ही हैज नॉट डिस्क्लोज्ड स्मोकिंग हैबिट. नाउ ये बहुत कॉमन है. ऑल लाइफस्टाइल हैबिट्स, स्मोकिंग, ड्रिंकिंग, इवन ऑक्यूपेशनल हजार्ड्स, ये सब डिस्क्लोज करना है, अदरवाइज क्लेम मे गेट रिजेक्टेड. ना मोस्टली ये जो क्वेश्चन है ना स्मोकिंग हैबिट का या अल्कोहल का, ये यदि लीवर रिलेटेड कुछ क्लेम आया तो दे डेफिनेटली आस्क, या कोई एक्सीडेंट केस आया, सो दे ऑलवेज लुक फॉर एन एफआईआर जहाँ पे ड्रिंक एंड ड्राइव है कि नहीं. मेनी पीपल दे आस्क मी कि भाई वी ड्रिंक, सो शुड वी डिस्क्लोज. यू शुड डिस्क्लोज. सोशल ड्रिंकिंग बताओ चलेगा, बिकॉज वो डिफ्रेंशिएट करना जब लीवर का डिजीज आएगा ना कि सोशल ड्रिंकिंग था कि ही वॉज क्रोनिक, वो बहुत डिफिकल्ट है. सो बेटर टू डिस्क्लोज. वन मोर क्लेम. नाउ यहाँ पे ऐसा क्लेम आया था जहाँ पे एडमिट होने का जरूरत ही नहीं था. दिस फीमेल 39 ईयर, शी वॉज हॉस्पिटलाइज फॉर माइग्रेन. सिर्फ उसको 12 घंटा हॉस्पिटल में रखा, उसको आईवी फ्लूइड्स दिया, पेन मैनेजमेंट किया. क्लेम अमाउंट वॉज 28,000. क्लेम वॉज रिजेक्टेड बिकॉज दिस कुड हैव डन ऑन ओपीडी बेसिस. 24 आवर्स एडमिट नहीं किया था, एंड दिस इज ऑल्सो नॉट इन अ लिस्ट ऑफ डे केयर हॉस्पिटल्स. नाउ लेट मी टेल यू वन मोर थिंग. इससे और एक चीज़ सीखना है कि 24 आवर्स एडमिट करने के बाद भी क्लेम मे गेट रिजेक्टेड. होता है ऐसा? इफ इट इज प्रूव्ड कि 24 आवर्स एडमिट किया बट इट वाज नॉट नेसेसरी फॉर आईपीडी, दे कैन रिजेक्ट द क्लेम. सो यहाँ पे थोड़ा कॉशियस रहना है, संभल के रहना है. एंड द लास्ट केस स्टडी इज अबाउट रीजनेबल एंड कस्टमरी चार्जेस. नाउ दिस बिकेम पॉपुलर आफ्टर कोविड. कोविड में काफ़ी लोगों ने एक्सपीरियंस किया रहेगा. नाउ दिस क्लॉज इज वेरी यू कैन से ट्रिकी क्लॉज. ये क्लॉज में आई गॉट अ क्लेम ऑफ ए 52-year-old मेल underwent appendix surgery. Surgery cost a 1.85 lakh and he got only 90,000, saying कि reasonable and customary charges clause is applicable to you. अभी यहाँ पे क्या करना है? Now what this clause says कि आपका जो 1.85 लाख का बिल है, आपके आसपास में जो भी हॉस्पिटल है, if they are charging 90,000, we will pay you only 90,000 and not 1.85 lakh. बहुत डेंजरस क्लॉज है. कोविड के आसपास इसको बहुत फुल्ली इट वॉज यूज्ड एंड मेनी ऑफ द पीपल दे लॉस्ट हैवी अमाउंट इन क्लेम्स. यहाँ पे ध्यान क्या रखना है? सी द डेफिनेशन ऑफ क्लॉज इज expenses reimbursed up to the amount that is reasonably and customarily charged for similar treatment in the locality. यहाँ पे ध्यान क्या रखना है? या तो when you select hospital, please check कि कितना अवेलेबल है. Easiest way to get rid of this is go for cashless. Cashless में बहुत ही रेयर पॉसिबिलिटी कि आपको रीजनेबल क्लॉज लगाया जाएगा. सो दिस इज वन ऑफ द गुड सॉल्यूशन यदि आपको ये सब चीज़ों से बचना है. नाउ आफ्टर अंडरस्टैंडिंग दिस 10 केस स्टडीज, देयर आर मेनी केस स्टडीज है बट इतना टाइम नहीं कि हम लोग डिस्कस करें डिटेल में. लेट्स सी व्हाट वी लर्न फ्रॉम दिस, या क्या हम लोग को केयर करना है. सबसे पहले यू नीड टू हैव मेडिक्लेम. कोई चॉइस नहीं है अपने पास, बिकॉज जो मेडिकल का इन्फ्लेशन है इज वेरी वेरी हाई एंड वी नीड टू टेक केयर ऑफ दैट मेडिकल राइजिंग मेडिकल कॉस्ट. अभी एक भी बड़ा इलनेस आ गया दैट कैन ड्रेन योर सेविंग्स. सो डेफिनेटली यू नीड मेडिक्लेम, बिकॉज अच्छा मेडिक्लेम रहेगा तो इट्स अ पीस ऑफ माइंड. और मेडिक्लेम लेने के बाद में भी पीपल लूज पीस ऑफ माइंड बिकॉज उनको डर है कि जब क्लेम आएगा तब क्लेम नहीं मिला तो. सो व्हाट वी नीड टू डू बिफोर सेलेक्टिंग अ कंपनी, फ्यू थिंग्स टू टेक इनटू कंसिडरेशन. सेटलमेंट रेशियो, we recommend 90% plus is a good ratio. 99.99% does not mean that company is good, because of 0.01 आपका ही हुआ तो. So it's better to select a company with 90% plus. उसके साथ साथ what you need to look into, they should have wide network of cashless hospitals. Third, good reviews from existing customer. You can always get recommendation from your colleagues, from your relatives who have already opted for and they have got the claim. Plus good customer service. And last and most important, the brand should be trusted brand. कोई नया कंपनी नहीं होना चाहिए. It should be a trusted brand with a proper financial strength. How to select a good product? Now we recommend कि at least 10 से 20 लाख का सम एश्योर्ड पहले होना चाहिए. For you all, मतलब ये क्राउड के लिए at least 50 लाख से 1 करोड़ का मेडिक्लेम होना चाहिए. कॉम्प्रहेंसिव कवर, रूम रेंट में नो कैपिंग, So always look into a policy जिसमें कोई भी room capping नहीं हो. Your ICO is covered, your daycare is covered. Daycare का भी wide list है, and domiciliary should be covered. No restrictive co-payments. So बहुत सारे policies आपको online में reasonable सस्ते मिल जाएंगे, but फिर पता चलेगा उसमें co-payment clause है. So see to it कि आपके policy में co-payment नहीं हो. Sub limits. This is very interesting. आपके association की policy में there are so many sub limits. Similarly, many group policies, they come at a very reasonable price, but they have sub limits. So you need to see कि आपके product में sub limit नहीं होना चाहिए. And your policy should have no claim bonus. Also, it should have restore benefit. Now, care to be taken while purchasing Mediclaim. Disclose all PD conditions honestly, without missing anything. Understand waiting period. मैंने आपको 8 waiting period बताया. There could be more than that. Understand आपकी policy में वो है कि नहीं और क्या है. Read exclusions. It can be permanent exclusion. It can be temporary exclusions. Choose whether you need floater policy या individual. So it depends upon age group क्या है, what is the entry point, family structure and so on. Last point, very important. When you claim, few things याद रख दो. This is very important. सबसे पहले, if you are going for cashless, कोई problem नहीं. I strongly suggest cashless ही लो, but समझो cashless का that hospital is not on a cashless and you want a treatment there, what you need to do? Immediately inform insurer within 24 hours. Otherwise, again, claim may get rejected. Prefer cashless if available, I told you. Keep all original documents if reimbursement and reports. Prescription, reports and bill. ये ऑर्डर में सब कुछ बराबर से संभाल के रखना है. Pre and post, very important. And last, take photocopies of all the documents. Because एक बार पेपर सबमिट हुआ, वापस नहीं मिलने वाला है. We get actually, we can claim that papers वापस, but better है कि photocopy निकाल के रख दो. Now, 65 crore people, they don't have Mediclaim in India. Main reason is that they don't have anyone to guide them. या उनके मन में एक fear है कि मैं policy लेके क्या करूँ, claim तो मिलेगा नहीं. So we strongly suggest कि Mediclaim करना बहुत जरूरी है, because medical का inflation is 14%, which is very very high. So final takeaway, you all protect lives. Mediclaim protect your lives. So thank you so much. I am sure, I think we don't have time for question answers, right? So in case you have questions, you can post a message on my mobile. I will try to answer that. And this is my website. A small request. You can take the picture of this or I will share the Google form with you. This is a feedback form. In case you want to give some feedback, what all changes you will require here, I can update my presentation and you can even ask personal questions related to Mediclaim on this. So thank you once again. Thank you so much.
Thank you, Bhavesh ji. You have really ensured that we keep the faith in the policies and make sure that our lives are going to be more safer in the future. A small token of appreciation from us to you to carry forth for us. Well, we Bunts are extremely sweet people, right? By nature and by everything in our behavior. But the one thing that all doctors advise us is that we need to keep our sugar levels, at least in our bloodstreams, low. And this, I think, is quite a considerable challenge because the number of percentage of people who are getting into the diabetic fold seems to be increasing year after year after year. Now, who better to tell us about how to gain control of the situation and to be able to lead a life which is near normal? Ladies and gentlemen, it gives me great pleasure to introduce and call in Dr. Rajiv Koil, who's the right commander to lead this battle for us. He is the director of diabetic care in Nanavati Hospital, and the poor gentleman is extremely tired because 3 days of huge conference which he himself has organized, which I believe was going on till almost 8 and 9 every night. I just am curious, do you serve desserts at your conference?
Yes, with a calorie count on it, you know.
Thank you, Rajiji. Take over.
Thank you so much. Thank you, Association of Bunt Doctors and Dr. Satya Prakash Shetty, Dr. Sadanand Shetty, Dr. Prakash Rai, Dr. Ashit Hegde. So many of you all for inviting me here. If Bhavesh has not left the room. He forgot one particular case. The case is that a person went in for surgery and he told the doctor and his assistants that I don't have diabetes. And when it went into Mediclaim, he was a diabetic for 10 years. Do you see that happening very often? Is my slides coming up? It's still Bhavesh on. So can we change the slide set? Oh, it's me. No, it's. So this happens in real life because patients do not accept that they have diabetes. There's a huge denial. They feel that it is probably not probably the lab went wrong, or I just went for a wedding, I went for a vacation, and these reports are now, I'll do it again after a month. So this keeps on going, but one needs to understand that a lot of time genes and heredity loads are gone, and the trigger is pulled by our lifestyle. So this is a huge burden of diabetes, as you can see, 15 to 20%, and as age goes up, it keeps on increasing. This is the ICMR data. Lancet says that we have almost 250 million, and there are a lot of hungry people ready to join this gang of diabetes, because we have more people with pre-diabetes in India than anywhere across the globe. And India and China are coming very close by, not because of Trump, but because of the genes and the kind of food we eat. So diabetes has no boundaries. Mumbai also, across, so is no longer a rich man's disease. Earlier we used to say that it's a rich man's disease. Rural, tier 1, tier 2, urban India, across there is diabetes. So, and what do you think is causing this? Anybody? I was stress. You are partially right. Lifestyle, partially right. Food habits, hereditary. So all of you all are right, because diabetes is a multifactorial problem. I'll tell you a small story that, 300, 400 years back, we never got access to food. There was malnutrition, famine. We were not getting food. So our genes were developed in a way that we store food. So maybe in the next 3 or 4 days, you may not get food. So we used to go out, either get some fruits or hunt animals and eat, and maybe the next 3-4 days, we may not get food. So our genes were developed to store fat. So our liver stored fat, our muscles stored fat, everything stored fat, so that it is like a hibernating animal. So that the next 3-4 days you don't get food, then your liver gives out food. Now, suddenly, industrialization, which occurred in the rest of the world, took 75, 80 years to develop. In India, it occurred in a very short time. So when you have these kind of genes which store fat, and suddenly you get energy-dense food, then everywhere it gets stored. Your liver gets stored, in the blood vessel gets stored. So Dr. Sadanand Shetty does a lot of angios then. So the problem is that when it gets stored in wrong parts, ideally fat is under our skin. That's the natural physiological storage area, which we call as subacute fat. When it gets stored in different organs, those organs' functions go down. We call it in different names. So when it gets stored in the liver, we call it as fatty liver. When it gets stored in any other place, we have fatty kidney also. And when it gets stored in the pancreas, we unfortunately call it diabetes, but it's a fatty pancreas. And if we are able to lose, if a new person with diabetes comes in, and if you are able to lose weight, now you have a lot of around on social media, everywhere you have this, that reversal, remission, freedom. But what actually it is, if you're able to lose 10-15% of your weight at diagnosis or within 2 to 3 years of diagnosis, you go into a remission phase. As doctors, we call it as a remission phase, where you don't need oral or injectable drugs. And how does this come about? The fat in your pancreas goes down. So the functional capacity of the pancreas goes up. So India is a country where we have the people who are dying from malnutrition in one side and obesity on the other side, and obesity is driving all these non-communicable disorder, whether it's diabetes, cardiovascular disease, cancers, all of them are driven by obesity. Obesity is the mother. So this is the burden of uncontrolled diabetes in India. Almost, and this is from proper referral places and doctors like us, experts who are treating, only 20% are controlled. There are a lot of challenges. Challenges is about awareness, diagnosis. People say, no, I don't have cholesterol. My cholesterol has come to normal. My sugar has come to normal. I have to stop the medicines. Social barriers, adherence to recommended guidelines. Doctor has told me 3 times, I will take only once. Doctor doesn't know I'm extremely busy. And a lot of lack of knowledge, because you can be very, very literate. You could be a PhD and super specialty and all those things, but your health related literacy is very, very poor. And we get ourselves literate from sources where we should not be getting health literacy. I think our doctors and experts should be the whole source of information, but unfortunately the world is flat and you get information from various other places. Like, for example, I get a lot of referral from kitty parties. So I asked them that why was I discussed? So they say, no sir, your patient was there. No, she said that you are a good doctor for weight loss, so we came to you. I said, okay. So what happens is that health is a very personal issue. It's like your wealth, like Bhavesh Bhai was telling us, it's like your wealth. You should discuss it with your doctors only. Maybe you could give a referral, but health conditions are very personal. And that's very important, that you take all your knowledge about diabetes, and the resource of knowledge should always be from people who are experts of it. Awareness, a lot of people in diabetes and people with diabetes believe that diabetes is just a blood sugar problem. If you get your sugar under control, then you will never have a problem. But diabetes is a more diffuse, multifactorial, multi-vessel kind of a problem, where sugar is just one part of the problem. So to call yourself as having diabetes, your blood sugar should be high, but to prevent complications of diabetes, blood sugar is just one of the variables or one of the parameters, and probably the least important also. A lot of delay in diagnosis occurs, as I said, that people give their own reasons that this lab is wrong, doctor is wrong, everything, and there are a lot of direct and indirect costs of diabetes, and a lot of financial constraints over a period of time, and cost of monitoring, cost of anti-diabetic drugs, doctor visits, hospitalizations are very, very high. There are a lot of indirect costs to complications also, and there are a lot of complications. Again, a lot of people have this stigma towards allopathic medications or any medication. They say, sir, we will treat it naturally. We don't want to take any drug. And the next line is, sir, we don't want to be addicted to a drug. There's no addiction to the drug. If your pancreas has lost the functional capacity to make enough insulin to take care of the blood sugar, then today's options are very, very advanced. The medical care is very, very standardized, and there are no ifs and buts today. Today we are categorizing patients in a particular way. People are not given medications based on their blood sugars. People are given medications based on the risk they carry and the complications they can have, and that is how the medicines are given. In some types of diabetes, there are some gene mapping done, and you can give medications accordingly. And the future in the next decade or so, when you go to a diabetologist or an endocrinologist for diabetes treatment, first thing they will draw your blood, and do a gene testing, tell you this, you have this form of diabetes, and you will have this complication at 12 years and this complication at 20 years, and these medications will work for you. So how you have a Janam Kundli, maybe 10 years now from late, you may have a diabetes Kundli. So research is quite ahead, and in the last 15 years, there's a lot of revolutionizing of medicine and our understanding of diabetes also, because now we are not like cowboys chasing blood sugars. Now we are more like metabolic managers or metabolic physicians, where we are treating all the issues which surround diabetes and all the complications which are there with diabetes. The present government has done a lot towards NCD care and NCD task force, and there are a lot of task force. But I think education of people with diabetes is core. People should be knowing what their targets of each health-related variable. It's not just the blood sugars, but all other variables. There is a frequency of testing which needs to be done, and it is not just blood sugar, multiple other testings, and also to seek redressal of the problem or opinion to the report, because many a time when people consider them as people with diabetes only when their blood sugar is abnormal. So they say ki sir, I had diabetes in 2018, and then 2019 I didn't have, it again appeared in 21, then it again appeared in 24. It's not that way. You are a diabetic from 2018, so we count the whole. People say ki no, when my sugar was controlled, I was not a diabetic. That's not the way it is. Again, a lot of guidelines are followed in treatment of diabetes, and that's the reason that across the board, you will see that we prescribe very similar drugs. Major issue today with good care across in patients is adherence. And adherence is a problem globally also, because people don't want to adhere to the medications, adhere to the lifestyle or the food. And somebody was speaking to us about Swiggy and all this. So the area that I practice, I at least have 4 to 5 dozen families who do not have an established kitchen. How many of you all do not have a kitchen at home? Anybody? So there are a lot of families who do not have an established kitchen, because that kitchen, what they do is they either Swiggy out, morning they have, they only have a microwave and they have a fridge. So when I questioned them, this is more than a decade back, the answer was that we don't need a maid, we don't need groceries, we don't need kachra dabba, kachra wala, nothing. And that one room, which was earlier a kitchen by the builder, is utilized as a study or things like that, because corporate people are eating lunch in office and dinner is Swiggy, morning breakfast can just be bread or biscuit, so there's no established kitchen. And if this continues, we will reach diabetes, heart disease, cancers, all NCDs very fast. So there's a need that we need to change the way we are eating. That's extremely important. And that's the reason that only 19% of our people with diabetes across India are under poor control. And we love to eat. We live to eat. And tonight at the lunch, you all will also agree with me. Because the food needs to be, and today we have a lot of medications which is mapping our brains. And a lot of people think that somebody eats more, that this person has a sweet tooth, that person is a foodie, he cannot live without ice cream. So it is not his fault. Have a little bit of empathy, sympathy for the person who's eating food extra. Is purely because his brain is not mapping. There's a lot of craving which is occurring. This is all a chemical locha in the brain which is happening, which is making him crave. So glucose and sugar is the biggest addiction. We had Dr. Shishir speaking about tobacco. Today, glucose is not yet accepted as an addiction, but it is the biggest addiction. It is much higher than tobacco or alcohol or any other substance. So, and that's because the brain craves for it. And today we have a lot of medications which we use for people with obesity, which can map the brain. And why I'm saying this is that our very high carb intake leads to a lot of damage to our vessels. You eat very high carb, then go down, and this ups and downs, and majority of people in India remain in a post-absorptive state for 14 to 16 hours. And insulin is very much delayed. Again, many a time when we prescribe insulin to our people with diabetes, they tell us that, doctor, you're punishing me, give me a oral drug or anything like that, because they feel that insulin is the last stage. There are a lot of myths about insulin, but insulin is not the last stage. And today we have a lot of medications which can actually help you prevent also insulin. So management has always been a challenge. Monitoring is something which we have to do. Extremely important, and it's monitoring of blood sugar, blood pressure, cholesterols, eyes, feet, liver, kidney. These are very, very important organs. And that's why if you only do A, which is HbA1c, you're losing the game. It's better to have a moderately high HbA1c and your vascular supply to your heart and vital organs very, very well preserved as such. And diabetes, why we have to do that? We have a lot of complications, whether they are microvascular, we call it as small vessel, large vessel, and a lot of newer complications are getting added to diabetes. There are mental health challenges, there are cognitive declines, Alzheimer's, dementias, depression. All these are liver issues. All these are added to the list of complications which diabetes have. And we just came up with a consensus statement yesterday that we need to redefine and reclassify. First, we need to redefine diabetes, because when we say a person has diabetes, that person feels he has a blood sugar problem, and if blood sugar gets corrected, everything gets corrected. Diabetes is a far more diffuse systemic problem. And we also came up with a statement saying that we need to reclassify the complications of diabetes, because today mental health, cognitive decline, dementias, liver issues, and cancers. The cancers in diabetes are more than 20-25% higher than age-matched individuals without diabetes. So the complications are different, and it's mainly to our vessels. And diabetes is a vascular disorder. It reduces the supply to vital organs, and that's what we need to do. And the major organs also get affected by the blood supply and the excess of fat in them, and that causes all these coronary artery disease, peripheral artery disease, heart failure, stroke. All these vascular issues are higher. After getting a complication, there's a lot of handicap and quality of life issues which can be prevented. And Dr. Sadanand Shetty will tell us that what is a life after a bad heart failure or an amputation related to peripheral vascular disease. The quality of life is very, very poor, and this is what we as doctors, our main treatment for diabetes today is, one, improve quality of life, prevent complications in people with diabetes, and make them live longer. And we are not chasing blood sugars as of now. Blood sugar is one of the parameters that we chase, and these are complications which are there in people with diabetes. Alzheimer's dementia is called as type 3 diabetes. The treatment that we use for diabetes, which are injectable, called GLP-1, will come as a treatment for dementia in the next year or two, because the same insulin resistance which occurs inside our systemic organ and body causes the same insulin resistance in the brain. Brain is the kingpin in this metabolic blunder which we call as obesity or diabetes. It has, after the kingpin, you have people on the road who are taking care of it. The liver is the second in command, and the liver then causes a lot of issues, and it could be in the pancreas, it could be in the kidney. So these are all agents, but the kingpin is the brain and then the liver, and that kind of a circuit, it's like multiple sleeper cells of terrorist sleeper cells, and once they get activated, you have this explosion which we can call it as diabetes in some people, we can call it as obesity in some people, we can call it as heart disease or coronary artery disease in some. It's almost the same when it comes to it. So the burden of diabetes in India is very huge. We have a lot of people with diabetes. The awareness is very, very poor. There are a lot of challenges which are associated with diabetes management, because patient needs to upgrade to a level to understand that the doctor's trying to make me live better, live longer, and also give you a better quality of life. So just sugar should not be a parameter. And again, our whole intention today is to prevent complication. And if you have got a complication, to prevent the progression of that complication, and we have a lot of drugs to use them. Thank you all for a patient hearing. Thank you so much. Intermittent fasting. Good question. I will ask it. I will answer it in a broader way. That there are a lot of fads, a lot of social media fads, and that doesn't treat. So whether you do intermittent fast or you do caloric restriction over a period of time, there's no difference. Thank you, sir.
This is for us, from us to tell you thanks, Dr. Rajiv, for a wonderful presentation and opening our eyes and giving us more insights into how to handle our sugar. Thank you so much. I remember as a child when my parents used to take me to a doctor, I used to wonder, why are they taking me to a doctor when I'm feeling perfectly fine? And I remember going to the doctor and my father asking me dads used to be dads in those days, pant kale. Take out your pants and then just get a jab in your butt and you come back, pain because of that, fever because of that, and I thought it was all done with in my first childhood. But I realized that as we go on in age, and now it's time for the second childhood, and I guess it's time to do it all over again. A little bit has been said already about vaccination, but now let's hear it from the man himself, Dr. Ashit Hegde, who's a consultant for medicine and critical care, PJ Induja Hospital, and we ask him to address us about how to go about this business of vaccination. Ladies and gentlemen, join my hands together to welcome Dr. Ashit Hegde.
Thanks, Ajit, and I tend to speak pretty fast, so this is going to be a very short presentation. Now, like Dr. Vidya gave a very nice talk, talked about, one of the achievements of modern medicine nowadays, in fact, the achievements probably are the eradication of polio, the eradication of smallpox, and neonatal tetanus. To some extent, actually, I like trivia, so I think actually the film industry has some role in this. All of these three diseases have been eliminated because of vaccination, and the film industry played a slight role in this. Geeta Bali, Shami Kapoor's wife, died of smallpox, and after she died, actually the whole smallpox vaccination program took off. The polio vaccination program took off after Kuwara Bap, where Mehmood's son, I think, really like polio patients. So actually, but these three major diseases have been eliminated all because of vaccination. But like Dr. Vidya said, we tend to think that vaccination is confined to the children, except when there's an epidemic like COVID where you think everybody needs to get vaccinated. Otherwise, we make sure that our children, grandchildren get vaccinated, but then we forget about it. We never think about vaccination for our own selves because we think now we are too old for all that. But actually, as we grow older, as we grow more vulnerable, it's these so-called vaccine preventable diseases which quite often add to misery and quite often might actually be contributing to our own death, also a premature death. So actually, it's not just vaccines, like I said, are not just only for kids. Adult vaccination is a very important thing. And fortunately, now there's more and more importance given to adult vaccination. In fact, this is from the Association of Physicians of India, which is with all the other societies, has brought up this consensus guidelines on adult immunization. They've talked about several vaccines. I'm not going to really bore you all with great details about all these vaccines. I'll talk about what I think are the important vaccines that adults should know a bit about. So this is what recommended for people in the medical field. That again, I won't talk too much about because most of these again are also something that general adults also need to know about. So what we're going to talk about really are about, again, don't get worried, I'm not going to talk about all these vaccines. I'm going to really talk about what I think are the important vaccines that adults. Generally, I'm talking more about people above 50. Below 50, generally you don't need these vaccines unless you have some other condition like diabetes or heart disease or some other immunocompromised state. Generally, most of the vaccines are not applicable to you. But as we grow older, like especially above 50, as you become more vulnerable, you probably need many of the vaccines that I'm going to talk about. So first I'm going to talk about the so-called inactivated influenza vaccine. Now, I'm sure all the family physicians, all the physicians in this audience are now being inundated with patients suffering from flu. And we should think that just a flu, nothing much, just a cough, cold. But you must understand that as you grow older, especially you've got other diseases like heart disease, you've got liver disease, you've got lung disease, the flu could be the final straw that could actually kill you. So flu is not as benign as we think it is. And even if it doesn't kill you, it can lead to a lot of morbidity. I remember that before I took the vaccines, every year I used to get a bad flu and every day I used to be out of action for almost 15 days. But now that I take the vaccine routinely, I'm not saying I don't get the flu. I get the flu, but I'm able to live through it. I'm able to even work through it. So 15 days every year I'm saving. I'm not sure, I'm a lazy person. Probably sometimes think I've been better off taking the 15 days off and staying at home. But definitely the flu vaccine may not, like I said, may not prevent it, but definitely makes the flu much milder, and many patients might actually prevent the flu. So when do you actually take the flu vaccine? It's a tetravalent flu vaccine, which ideally you should take before the onset of the flu season. The WHO releases strains twice a year. We follow the southern hemisphere, which means that we should take the vaccine before the onset of the monsoon, sometime in February, March. But the important thing, you should make sure that when you're getting the vaccine, you should make sure the batch manufacturing date should be of that year. Quite often the chemist will pass on the date which is expiry date. You should look at the manufacturing date. The manufacturing date should be of that year. So if you're going to take a vaccine this year, you should look at the manufacturing date, which vaccine should be produced this year. And you should take it around March, April, because that's when the new strain is released. That's when you get the new batch produced for that year. And ideally you should take this once a year. In this part of the country, North India, they take it around September, October. Pneumonia is supposed to be called the captain of the men of death, because quite often that is the final straw for many people, especially as they die ultimately of pneumonia. So prevention of pneumonia is very, very possible nowadays, especially because the commonest cause of pneumonia is a condition called pneumococcus. The bacteria causing pneumonia is pneumococcus, and there are vaccines available to prevent pneumococcal disease, and it's probably mandatory for everybody above 50 to take a pneumococcal vaccine. Now there are two kinds of vaccine. One is called a polysaccharide vaccine, which is not as strong as the other vaccine, but is much cheaper. Therefore, for large-scale vaccination, probably you would use the polysaccharide vaccine. But for people who can afford it, there's something called a conjugate vaccine, which until recently there was something called a PCV13, but now in a couple of months, they're going to get a vaccine called a PCV21, which will cover all the strains. So if you get that one vaccine, if you can afford it, you don't need any other vaccines. So for people who can afford, it's not very, very expensive, 6,000 or 7,000 rupees. So if you take that one vaccine, you probably don't need any other vaccine for the rest of your life. And as already somebody has talked about in the vaccine, Dr. Vidya so nicely said, preventive maintenance is definitely much cheaper than actually getting the disease. So I think this is one other vaccine that you need to consider about, either PCV or first take PCV13 followed by PPV, that is whatever you want. But I think pneumococcal vaccine again should be part of everybody after 50, but other people with comorbidities can think about pneumococcal vaccine. Shingles is the other thing. We all know how painful it's called Nagin or Sarpa in herpes zoster, which is actually an activation of chickenpox, and it can be very, very painful. It can happen many times. So shingles can actually be debilitating. What's called the pain, even though the rash disappears, the pain can persist several months. It's called post-herpetic neuralgia. Extremely painful. People can often cry in pain every day. They don't get sleep. They are on high dose of painkillers, and this can be easily preventable by just 2 doses of vaccine called the shingles vaccine. You need to take 2 doses 2 months apart. That's it for the rest of your life. And in fact, now there are studies which are showing that not just protect you against shingles, the shingles vaccine actually protects you from heart disease as well. So which is again any very strong reason to consider taking the shingles vaccine. So this again is slightly expensive, but like I said, probably well worth the cost. So these are 3 vaccines that I would think for everybody above 50 definitely needs: a flu vaccine yearly, pneumococcal vaccine, and at least 2 doses of shingles vaccine in their lifetime. Some of the other vaccines are plus and minus. Rabies. Now rabies is not part of the prevention program, but I would think in our country where there's so many stray dogs, we're at danger of getting bitten by a dog. Many of us go for a walk and there's a danger, and rabies is completely incurable. We know that there is no cure for rabies. If you get bitten by a dog, you need to take a globulin. People just get the vaccine, they don't realize they need to take a immunoglobulin. But if you have already preventively taken the rabies vaccine, if you get a dog bite, you're relatively much more protected than somebody who's not taken a vaccine preventively. So I think This is, though, like I said, it's not part of the standard protocol, but I think this is something somebody of people who are staying in the cities, who are quite often exposed to stray dogs, should consider taking just 3-dose course of rabies vaccine. Very, very well worth it, not very expensive, and definitely for a life-threatening illness like rabies, which has no cure, I think we should all consider it's a good idea to consider taking rabies. Very, very good idea, because like I said, once you get bitten, and if it's a rabid dog, if you don't take precaution time, there is no cure. So I think rabies is another thing you need to consider. DPT is something that is, again, the vaccine that we need to consider. Basically, we can, after, like I said, after we got vaccination for tetanus in the childhood, we almost forget about diphtheria and tetanus, but now it's been recommended that you vaccinate yourself every 10 years. Diphtheria, pertussis, and tetanus. The pertussis is optional, but diphtheria and tetanus, every 10 years, you need to get vaccinated, no question. We probably forget this. We tend to neglect this because we don't think tetanus is still there, but tetanus kill can still happen. So I think just once in years, diphtheria, tetanus, and pertussis if need is recommended. If you get a wound, what do you do? If you get a wound, if it's a minor wound, then you probably, only if you're not taking the vaccine last 10 years, you need to take a course of 3 years. But if it's a fairly large wound, even in the last 5 years, if you have not taken a course of DPT, you probably need to take all 3 doses, like you start from all over again and take it again. That's what you do if you get a wound and you have diphtheria and you take the vaccine. Hepatitis B, this is some recommendation that I don't agree with. The API says that every healthcare professional, that means the doctor, should get vaccinated every 5 years. But I think once you've taken the dose, once you've taken the course of vaccine once in your lifetime, and if you've demonstrated antibodies at least once that are adequate, you probably don't need to get revaccinated unless you're immunocompromised or you're on dialysis, etc. But that's a different population. For the average person, once they get vaccinated, if they have adequate antibody levels, they don't need vaccination again. And that's usually actually not for the average population, but for healthcare workers who are at a very high risk of developing hepatitis B, probably should mandatory. It's obviously mandatory for everybody, no matter what their age. Every healthcare worker needs to be vaccinated against hepatitis B. And finally, typhoid. Typhoid, of course, again, people say typhoid vaccination is not a mandatory recommendation, but typhoid is so prevalent in our country that I think, many people do fall sick because of typhoid, and probably no harm in taking the typhoid vaccine. Like I said, it's not really an absolute must, and of course, you must understand that this typhoid vaccine doesn't protect against paratyphoid, which can also cause a similar illness. But I think in our country, where especially in the monsoons, when there are so prevalent, it can keep you away from work, contribute to morbidity and mortality. There are different types of vaccines available. What is recommended, of course, the best is the typhoid conjugate vaccine. You need to take just 1 dose, but maybe need to give a booster every 3 years. So these are some of the vaccines, but like I said, top 3 would probably be the flu, pneumococcal, and shingles. The rest, rabies, which I think is good, but optional, and hepatitis B and typhoid. So that's it. Thank you. I think not too late to vaccinate. Thank you. Just managed to stay in time. Thank you. I go to be faster actually.
You know why I love this man? So business-like, so to the point. His CV was exactly what he sent to me, was only 3 lines. But look at the volume of knowledge that he has, and join your hands in appreciating this wonderful work that Ashitarna is doing for us.
Thank you.
Thank you, Ashitarna.
Thank you.
We all have our own mindsets, and we all look at our own life and our events around us in our own different ways. How many of you feel lucky? Nobody? Some, yes, there are very few hands. But then the next speaker, he's somebody who believes that he is lucky. And not only does he talk about himself and his luck, but he will convince you that you also are lucky. Because he starts talking about this. And actually it started with when Satyana said, we are going to get this. He's an awesome speaker. He's a TEDx speaker. I said, wow. So I said, I must get to know a little bit about him. So I said, let me go and look at that video. And then I realized that he is a pediatric surgeon, and saw that video of his, and I realized that he looks at everything in his life with the same childlike quality. So when you and I see something, and the way Lucky sees something, these are 2 separate different worlds. And this is a world which we lost in the so-called act of growing up. So Lucky is our man, and we are lucky to have Lucky with us. And this is the beginning of the change in each and every one of us. Ladies and gentlemen, may I present to you, join me with a big round of applause
Hello.
to give you lucky kasar.
Hello. Slide change. Hello. Hello. Hello everyone. Hello everyone. नहीं आवाज नहीं आ रहा है. May I request each one of you to please stand up? हो जाए, खड़े हो जाए. Please, please. हाँ, हरीश सर को छोड़ के चलेगा. बाकी सब, yes, come on boys and girls. There is a person on your right side, left side, behind and in front of you. Yes, Bhavesh? Okay, so you have to shake hand with the person on your right first and then loudly say to him or her, I love you very much. चलो shake करिए hand. बोलिए I love you very much. Left में करिए, पीछे भी करिए. I love you very much, Dr. Satya. I love you very much. Dr. Harish, I love you very much. यहीं से. चलो, thank you so much. हो जाए, जोरदार तालियां हो जाए भाई, खुद के लिए, सबके लिए. Come on. So this is a topic given to me, transforming spirituality or your spirituality to social life. तो थोड़ा heavy लगता है. It looks like wow, and थोड़ा सा hesitant भी होता है कि यार is it possible? Spirituality और मैं कहीं संबंध नहीं है ना? So many of us feel so, but everyone is born with their innate spirituality. There's no question about it. There's no doubt about it. Everyone, we are human beings having a spiritual experience, right? But this is absolutely wrong statement. We are not human beings having a spiritual experience. We are spiritual beings having a human experience. And that is why we have to understand and agree that we have our innate spirituality. ये पत्थर दिख रहा है आपको? Trying to balance that social life. But the better way to balance our social life is being like a feather. Being like a feather and trying to balance it in a lighter way. आराम से. कोई तकलीफ के बगैर. Possible है क्या? Let us see. So I'll start with a very important thing, and that is through Bollywood. Very easy way to understand spirituality in social life. अमिताभ बच्चन से शाहरुख खान सब लोग समझाएंगे हमको, अच्छा लगेगा, लाइट है, इजी भी है समझना. So first, a very important story, and this story is very important because this is the backbone of the whole presentation and understanding कि क्या किस तरीके से मैं अपना spirituality social life में transform कर सकता हूँ, transcend कर सकता हूँ. So there was a donkey and it was tied to a fence, and one day a ghost cuts this rope of this donkey and releases the donkey. All right? अब ये donkey जैसे shoot कर रहा है, तो this donkey goes haywire, berserk, and destroys the crops of the neighboring farm. जैसी वो farmer को मालूम पड़ता है उसकी wife को कि मेरा पूरा farm destroy हो चुका है, तो she gets very angry, very infuriated, and then she goes out in anger, shoots the donkey and kills the donkey. अब ये जो donkey का owner है, this owner becomes very sad, he is devastated. इतना गुस्सा आता है ना उसको कि वो उठता है and he goes and kills the wife of that wife who killed his donkey. Now the wife is killed, उसका husband को आ गया गुस्सा, naturally he takes a sickle and goes out, and now he goes and not only kills the donkey but the wife of the owner of the donkey. Now the wife of this donor in retaliation goes to that farm again और उसका पूरा घर जला देते हैं. उसमें 2 बच्चे रहते हैं, वो भी मर जाते हैं. See the mayhem which is going on, and then this farmer again retaliates and kills the wife and children of this donkey owner. So पूरा का पूरा खेल खत्म हो गया. और इसके बाद this farmer is now finally full of regret. अब थोड़ा senses आया कि क्या हो गया यार, बर्बादी बर्बादी हो गई, एक दिन में सत्यानाश हो गया है पूरा. So how to go about it? And he is now full of regret, full of regret. So he asks the ghost. Now listen very carefully. He asks the ghost, why did you kill them all? Why did you kill them all? तेरे वजह से सब मर गए. Why? Why did you kill them all? Ghost बोलता है हंस के, I killed nobody. I killed nobody. I just released a donkey which was tied to a rope. बड़ा बड़ा subtle, deep meaning है इसमें, हाँ? I just released a donkey that was tied to the rope. It is you who released the devil inside you. It is you who released the devil inside you. So naturally the question will come to me, devil inside me? मुझ में क्या राक्षस है क्या? And does the ghost bring out the devil inside me? Possible? Yes, it is possible. Or no, it is not possible. There will be a divided opinion. But the truth is, no. The ghost cannot come out with the devil in you. It is you who releases your devil. बड़ा बड़ा important समझ की बात है. This is the whole game. If you can understand this. So friends, their donkey कहता है कि you are like me. Everyone sitting here is like him. ठीक है, बाद में मत मारना मुझे, डॉक्टर शेट्टी को छोड़ के, नहीं तो अगली बार he'll not invite me. He says, you are like me. And you are tied to the tree. A tree, what is the tree for us? The society, social media, WhatsApp, Instagram, Facebook, right? The traffic, बच्चे, बीवी, husband, relatives, Bunts samaj, everything. We are tied to this rope. And what is this rope? This is the rope of your conditioning. This is the rope of your attachment to these things. And that is how you are tied to the rope. The ghost is saying, I am just cutting your conditioning. I am cutting your attachments. But it is you who is going berserk and killing everybody in the farm, in the society, creating pagalpanti. It is not me who is doing it, Bhavesh. It is you, the devil in you who is doing it. Why? Because आपकी एक कंडीशनिंग हो चुकी है. ये अगर हमें समझ में आ गया तो क्या मतलब हुआ? ये मतलब यही हुआ कि अगर हम इसमें से निकल पाए अपने कंडीशनिंग से, अपने अटैचमेंट से, that is the birth of spirituality. That is the bubbling up of the spirituality within me. चलेगा, रहने दो, पक्का स्पिरिचुअल हो गया. पहला साइन है. Okay. So again I say, I killed nobody. I just released a donkey which is tied to a rope. With deep understanding of this, let us see, is it me who is releasing the devil inside me? Yes. Not the ghost, it is me and only me. So friends, we have to ask yourself, to what all things are we attached to? आज घर पे जाके जरा लिखना. किसको अटैच है? Most of the husbands will not write the names of their wives, I know that. But I am attached to my children, I am attached to my spouse, I am attached to my property, I am attached to my car, I am my Mercedes, I am attached even to my Maruti Ciaz. Then I am attached to my Mediclaim. So on and so forth. Goes on and on, write down and see that rope of attachment to you. Okay? I am attached to so many good things. I am also attached to so many bad things. Ye bad traffic, ye social media, and so on and so forth. Once you understand this, then what is spirituality in daily social life is very easy to grasp. What is spirituality in daily social life? Knowing, first of all, we have to know and accept that I am tied with the rope. And then knowing that it is not the ghost, but it is me, the devil inside me. जो बरसक होता है, जो सत्यानाश करता है खुद की लाइफ का। ये सामना दो चीज जरूरी है। दैट इज द बर्थ बबलिंग अप ऑफ द स्पिरिचुअलिटी। सो फ्रेंड्स, discover the monk and the meditativeness inside you. And how to discover this monk and meditation? It is only by discovering how to transform your spirituality the Bollywood way. यहाँ पे बॉलीवुड बड़ा बड़ा हेल्पफुल रहेगा। तो दे ताली बॉलीवुड के लिए जोरदार। Come on. Okay, so Bollywood says, which is the first step? आज डिसीजन हो गया है कि मुझे मालूम पड़ गया है कि भाई आई एम अटैच्ड। दिस इज द रोप ऑफ कंडीशनिंग एंड अटैचमेंट विच इज द होल ट्रबल। आज से डिटैचमेंट शुरू करना है, बट कैसे करें शुरू? व्हाट कैन मेक मी स्टार्ट दिस? एनीवन? हाँ जी, रिलीज तो डोंकी करना है, लेकिन कैसे करें? इच्छा ही नहीं हो रही ना। मालूम होता है कई बार, अभी सुनेंगे लेक्चर, 1 घंटे बाद फिर अटैचमेंट आ जाएगा। अभी बाहर निकले, ट्रैफिक मिलेगा खराब, अरे तेरी बंबई का तेल लेने गया, सब ऐसा हो गया वैसा हो गया। व्हाट इज द फर्स्ट स्टेप नीडेड? बाय मेडिटेशन इज वेरी वेरी, वो आएगा ही नहीं मैम। दैट मेडिटेशन विल नेवर कम टू यू बिकॉज दिस फैक्टर इज नॉट देयर। यू विल नेवर थिंक ऑफ मेडिटेशन। इंट्रोस्पेक्शन विल नॉट कम टू यू अनलेस दिस फैक्टर इज देयर। Acceptance will not come to you if this factor is not there. हाँ जी, emotions का जो भी बोल रहे हैं आप will not come to you. It is a late phenomena unless this factor is overcome. This is the first kickstart. Bhavesh, what is it? हाँ जी, how to do that? That factor, उसके लिए ये factor बहुत जरूरी है, to cut that rope, to initiate that thought process कि I want to cut that rope. एटीट्यूड, वो एटीट्यूड डेवलप ही नहीं होता है बिकॉज दिस फैक्टर हैज नॉट कम। हाँ जी, रियलाइजेशन ऑफ व्हाट? डिजायर। डिजायर कट नहीं होती, नेवर, इम्पॉसिबल। द ओनली फैक्टर विच विल हेल्प, ऑल दीज आंसर्स आर करेक्ट, बट द फैक्टर विच इज कॉमन डिनोमिनेटर फॉर दिस इज यू हैव टू डेवलप लव फॉर योरसेल्फ। अनलेस आई लव माई सेल्फ, I will never feel that I am in need to cut the rope of attachment. और ये करीना कपूर एक पिक्चर है जब भी मेट, उसमें एक बहुत ही बेहतरीन डायलॉग है। थ्रू बॉलीवुड वी कैन लर्न दिस कि मैं अपनी फेवरेट हूं। आर यू अ फेवरेट ऑफ योर सेल्फ? अच्छा, क्यों बुलाया सर? डीप एक्सेप्टेंस ऑफ सेल्फ as you are, where you are, that is important. Whatever is the state of yours, financially, career wise, health wise, वगैरह, deep acceptance of that, as you are, and then understand your conditionings. So ये picture है। आज मेरे पास माँ बंगला है, गाड़ी है, माँ तो बाद में आएंगे, सॉरी। आज मेरे पास बंगला है, गाड़ी है, बैंक बैलेंस है, सब कुछ है। व्हाट इज दिस? दिस इज कंडीशनिंग, करेक्ट? और फिर ये बंदा कहता है मेरे पास मां है, दिस इज अनकंडीशनिंग, नॉट गोइंग बरसक। सो फ्रेंड्स,
जिन आदर्शों के लिए तुम अपनी जिंदगी पर खेलने के लिए तैयार हो, क्या दिया उन आदर्शों ने? एक 400-500 रुपए की पुलिस की नौकरी, एक किराए का क्वार्टर, एक ड्यूटी की जीप, 2 जोड़ी खाकी वर्दी। देखो देखो, ये वही मैं हूं और ये वही तुम हो। हम दोनों एक साथ इस फुटपाथ से उठे थे, लेकिन आज तुम कहां रह गए और मैं कहां गया? आज मेरे पास बिल्डिंगें हैं, प्रॉपर्टी है, बैंक बैलेंस है, बंगला है, गाड़ी है। क्या है तुम्हारे पास? मेरे पास मां है।
क्या बात है? So we are tied with this rope of conditioning and tied to this tree of all sorts of things you can list out. So friends, what you need to do is search your wrong patterns and habits. There are wrong patterns in every one of us, including myself, including everyone. And ये जिंदगी में शाहरुख खान का एक बहुत बेहतरीन डायलॉग है। वो कहता है कि जिंदगी में कोई पैटर्न या आदत बनती है तो सोचना चाहिए सोचना चाहिए, क्योंकि जीनियस वही होता है जो जानता है कब रुकना है ना? सो इट इज एम्फसाइजिंग स्टॉपिंग द रॉन्ग पैटर्न्स. लेट अस सी दिस.
जिंदगी में जब कोई पैटर्न बनता या कोई आदत बनती दिखाई देना, तो उसके बारे में अच्छी तरह से सोचना चाहिए. Genius is about knowing when to stop.
So genius is all about where you need to stop. Identify कहाँ पे कितने अटैचमेंट्स हैं मेरे, जहाँ पे मेरे पैटर्न्स फिक्स हो गए. ऐसा कुछ हुआ तो मैं ऐसा रिएक्ट करता हूँ, इस तरीके से गुस्सा आता है. ऐसा कुछ हुआ तो मैं ऐसा जेलस होता हूँ, and so on and so forth. I go on comparing and doing these things, and this is a pattern in me because of my conditioning, because of that rope. तो ये एक बार आइडेंटिफाई हो गया तो नेक्स्ट स्टेप इज डोंट गिव अप. कुछ भी हो जाए, नॉट गिव अप. और चक दे इंडिया में बहुत ही सुपर डायलॉग है टू अंडरस्टैंड दिस. वो कहता है शाहरुख खान कि जो नहीं हो सकता है वही तो करना है. जो नहीं हो सकता है वही तो करना है. इम्पॉसिबल मीन्स आई एम पॉसिबल, है ना? सो फ्रेंड्स, वी आर टायर्ड हियर. डोंट गिव अप टू कट योर ओन रोप. इट स्टार्ट्स विथ सेल्फ लव. यू विल नॉट गिव अप टू कट योर ओन रोप, क्योंकि तभी आप दूर जाओगे और तभी हो सकता है कि जो नहीं हो सकता तो वही मैं कर सकता हूं. एंड देन नेक्स्ट स्टेप इज बी करेजियस, टेक द रिस्क. बी करेजियस, टेक द रिस्क. बर्फी पिक्चर में सुपर डायलॉग है. क्या कहता है कि लाइफ में सबसे बड़ा रिस्क होता है कभी कोई रिस्क लेना ही नहीं. नो झंझट. सो इफ यू रिस्क नथिंग, यू रिस्क एवरीथिंग. यू हैव टू टेक द रिस्क. क्या होगा? ज्यादा से ज्यादा यू विल गेट डिफीटेड, but you learn the lesson. बढ़िया. And then next step is begin where you are, how you are. हम लोग पोस्टपोन करने की फिराक में, अगले साल जब सिचुएशन अच्छी होगी ना तब से मैं करूंगा, या 1 महीने के बाद. अभी थोड़ा सा स्लैक चल रहा है, 1 महीने के बाद करता हूं, है ना? होता है भाई. मेडिकल पार्ट को छोड़ दो, सर्जिकल पार्ट होगा, सबका स्लैक ही चल रहा है ना अभी तो, है ना? तो वही बिगिन वेयर यू आर, हाउ यू आर. वंस अपॉन अ टाइम इन मुंबई में एक बहुत ही सुपर डायलॉग है, एंड दिस डायलॉग इज वन ऑफ द बेस्ट. रास्ते की परवाह करूंगा तो मंजिल बुरा मान जाएगी. आहा, दाऊद ने कहा था. हाँ, वो दाऊद था उसे. राइट राइट. सो इट इज एम्फसाइजिंग ऑन द गोल, नॉट ऑन द डिफिकल्टीज. अरे ऐसा सब प्रॉब्लम्स है, अरे करना है, मेडिक्लेम तो करना है. भावेश को पूछ लो, झंझट खत्म करो, चैप्टर क्लोज. राइट. एंड देन फ्रेंड्स, नेक्स्ट स्टेप इज बी रेडी टू लूज इनिशियली. स्टार्टिंग में कुछ लॉस होएगा, वो ताकत होना चाहिए कि भाई हमने उसको सहन करना चाहिए. व्हाट बेटर टू अंडरस्टैंड एंड बाजीगर. कभी कभी कुछ जीतने के लिए कुछ हारना भी पड़ता है, और हार कर जीतने वाले को बाजीगर कहते हैं. राइट.
कभी
एक मिनट.
कभी कभी जीतने के लिए कुछ हारना भी पड़ता है, और हार कर जीतने वाले को बाजीगर कहते हैं.
सिंपल, कोई खास बात नहीं है. शाहरुख खान कह रहा है तो मान लेना चाहिए. कुछ हारेंगे तो भी हरकत नहीं है. बट इट्स वेरी इंपॉर्टेंट. स्मॉल थिंग्स बट वेरी वेरी इंपॉर्टेंट. सो फ्रेंड्स, नेक्स्ट स्टेप इज टू डिटैच. नाउ कम्स द, विद दिस मच ऑफ तैयारी, with this much of readiness, then only consciously you start with small things of detachment. कि आज मेरे बच्चे ने ऐसा कुछ बोल दिया तो मैं उसमें ज़्यादा अटैचमेंट नहीं लूँगी, and I will continue with that kind of small things, है ना? तो ये जवानी ये दीवानी में again there is a wonderful dialogue कि कहीं पहुँचने के लिए कहीं से निकलना बहुत ज़रूरी है. You have to let go. Unless you leave the shore, you cannot, बोलते ना, go on the voyage of the ocean. कैसे पॉसिबल होगा? तो यू हैव टू लेट गो ऑफ द शोर. यू हैव टू लेट गो. और वो जब तक नहीं होता है तब तक आपका वो डिटैचमेंट नहीं पॉसिबल है. So that will be the initiation of your detachment. So let go your tight rope of whatever positive attachments are there or negative attachments are there. Positive kya hai? I have good money, I have good talent, I'm a good speaker, I'm this, I'm handsome, है ना? I'm earning in CRs, I have a Merc, I have a fantastic wife, वगैरह वगैरह वगैरह. All these are attachment, positive attachments, but attachment will give you misery at the end. No question about it. And then of course the bad traffic, bad climate, bad society, bad samaj, and so on and so forth. Let go this tying of the rope. इतना लोड लेने की जरूरत नहीं है. 10-20 साल तो बाकी है. कितना जीने वाले हो? कितना लग रहा है सर आपको? 25. तो 25 साल क्यों लोड लेने का है? ले लिया ना 50 साल, अभी 40 साल, बहुत हो गया. क्या मिला? झाँक के तो देखो क्या मिला. जिसको जो करना था उसने तो किया ही है ना? So let go and then decide and act. Decide and act like Manji, the mountain man. His wife he passed away because she could not get the treatment because the PHC, Peripheral Health Center, was beyond this mountain. This one person took an oath कि मैं ये पहाड़ में रास्ता करूंगा. अकेले उसने 16 साल खोद के विछन्नियां तोड़ा. He created a road through the mountain. This is a fantastic movie you must never miss in life. Maji, है ना? So he says something very super. He says भगवान के भरोसे मत बैठो, हो सकता है भगवान ही तुम्हारे भरोसे बैठा हो. क्या बात है ना? And so
दशरथ माजी आप ही हैं?
सुन लो, ये से डायलॉग है.
कैसे हैं?
शानदार, जबरदस्त, जिंदाबाद.
सुने आप कई सालों से पहाड़ तोड़ रहे हैं. क्यों तोड़ रहे हैं?
अपना कब्र खोद रहे हैं.
मजाक कर रहे हैं.
तो क्या कहें कि ताजमहल बना रहे हैं?
अरे आप तो बिगड़ गए.
लोग कहता हम पागल हैं, जिंदगी खराब कर रहा है. आप अपना टाइम खराब मत करिए. ये भीतर का घाव जब तक ये टूटेगा नहीं, करेगा नहीं.
इस असंभव काम को संभव करने के बाद क्या कहना चाहेंगे?
हम तो ये कहेंगे कि भगवान के भरोसे मत बैठिए. क्या पता भगवान हमरे भरोसे बैठा हो.
Super. है ना friends? And then be persistent about whatever you have taken up. Persistence is the key. है ना? Shoot out at Vadala में super dialogue. One of the best dialogues ever you'll hear. Persistence के ऊपर कि जंग हथियारों को लगता है, इरादों को नहीं. अगर इरादा कर लिया है, persistence लाना ही है, क्योंकि जंग हथियारों को लगता है, इरादों को नहीं. Ambitions always reveal the direction. Unless you are ambitious कि I want to detach, unless I take up that goal, anything, मुझे यहाँ से नीचे जाना है. If I decide on this particular ambition, small ambition कि मुझे नीचे जाना है, then only I will find the direction. Otherwise I will never find the direction. Ambitions, they always reveal the direction in life. Why we are not finding directions is because we are not ambitious about that particular thing, whatever we want to overcome or come out of. So friends, spirituality is maintained by keeping the rope cut. जंग हथियारों को लगता नहीं है, लगता है, इरादों को नहीं लगता है. And then what you think you become. It's a very powerful statement. It is a very powerful statement. What I think I become. कौन सा पिक्चर है? ओम शांति ओम. सुपर डायलॉग. इतनी शिद्दत से मैंने तुम्हें पाने की कोशिश की है कि हर जर्रे ने मुझे तुमसे मिलाने की कोशिश की है. बात है हमने इतनी शिद्दत से चाहा ही नहीं है कि कायनात भी हमें मदद करने के लिए आ जाए. तो कहता है कि भाई आवाज
पाने की कोशिश की है कि हर जर्रे ने मुझे तुमसे मिलाने की साजिश की है. कहते हैं अगर किसी चीज को दिल से चाहो तो पूरी कायनात उसे तुमसे मिलाने की कोशिश में लग जाती है. आज आप सब ने मुझे मेरी चाहत से मिलाया. थैंक यू वेरी मच. मैं आप सबका शुक्रगुजार हूं कि आपने मेरे ख्वाबों को यकीन में बदल दिया. इतना कि आई फील लाइक द किंग ऑफ द वर्ल्ड. और इस बात का भी यकीन हो गया कि हमारी फिल्मों की तरह हमारी जिंदगी में भी एंड में सब ठीक हो जाता है। हैप्पीज एंडिंग्स। और अगर ठीक ना हो तो वो दी एंड नहीं है दोस्त,
है ना? तो अगर ठीक ना हो तो वो एंड नहीं है दोस्तों। मेक द मोस्ट ऑफ योर टाइम यार। कब जाएंगे कब निकल पड़ेंगे मालूम ही नहीं पड़ेगा। जो कुछ है पोस्टपोन मत करो। मुझे जाना है कहीं तो आज ही चले जाओ, टाइम है तो चले जाओ भाई। अगली बार किसको मालूम जाने मिलेगा कि नहीं, है ना? सो मेक द मोस्ट ऑफ योर टाइम। हु कैन एक्सप्लेन यू बेटर? ओनली आनंद। ओनली आनंद क्या कि बाबू मोशाय जिंदगी लंबी नहीं बड़ी होनी चाहिए। जिंदगी लंबी नहीं बड़ी होनी चाहिए। मैं मरने के पहले मरना नहीं चाहता। सुपर। और क्या चाहिए यार इंस्पिरेशन के लिए? मैं मरने के पहले
आपकी उम्र क्या?
मरना नहीं चाहता।
30। 100 में से 30 गए, कितने रह गए दोस्त? 70। आपकी जिंदगी 70 साल से ज्यादा नहीं। आपको मालूम है आपकी बीमारी क्या है? आपकी बॉडी, जिस्म, शरीर जो कि आहिस्ता आहिस्ता खत्म हो रहा। आप कहना क्या चाहते हैं? यही कि क्या फर्क है 70 साल और 6 महीने में? मौत तो एक पल है बाबू मोशाय। आने वाले 6 महीने में जो लाखों पल में जीने वाले उसका क्या होगा? बाबू मोशाय जिंदगी बड़ी होनी चाहिए, लंबी नहीं।
वाह। सो नॉट कटिंग योर रोप इज डाइंग डेली। यू हैव टू कट योर रोप क्योंकि मैं मरने के पहले मरना नहीं चाहता। क्या रोज रोज का मरना है? उससे अच्छा डंके की चोट पे जियो यार। भले ही 5 साल ही जिएंगे पर डंके की चोट पे जीना है। राइट? सो फ्रेंड्स, इग्नोरेंस इज नॉट ऑलवेज ब्लिस। ये हमें सिखाया जाता है बचपन। इग्नोरेंस इज ब्लिस। इट इज नॉट ऑलवेज ब्लिस एंड यू विल इमीडिएटली अग्री टू दिस। करेक्ट है ना? तो आप चतुर हो। एवरीवन सिटिंग हियर इज अ चतुर, होशियार, क्लेवर, पर फिर भी चमत्कार पे चमत्कार किए जा रहे हो। एंजॉय दिस बट टेक द लेसन होम।
आदरणीय सभापति महोदया, अतिथि विशेष शिक्षण मंत्री श्री R.D. त्रिपाठी जी, माननीय शिक्षकगण और मेरे प्यार सभापतियों, आज अगर ऐसी आसमान की बुलंदियों को छू रहा है तो उसका श्रेय सिर्फ एक इंसान को जाता है, श्री वीरू सहस्त्रबुद्धे। गिव हिम अ हैंड।
कौन बोल रहे हैं पर शब्द हमारे हैं।
He's a great guy, really, you are. पिछले 32 साल से इन्होंने निरंतर इस कॉलेज में बलात्कार पे बलात्कार किए।
इसका मतलब है चमत्कार पे चमत्कार किया है।
उम्मीद है आगे भी करते रहेंगे। हमें तो आश्चर्य होता है कि एक इंसान अपने जीवन काल में इतनी बलात्कार कैसे कर सकता है। इन्होंने कड़ी तपस्या से अपने आप को इस काबिल बनाया है। वक्त का सही उपयोग, घंटे का पूर्ण इस्तेमाल कोई इनसे सीखे। सीखे। आज हम सब छात्र यहाँ हैं, कल देश विदेश फैल जाएंगे। वादा है अब से जिस देश में होंगे वहां बलात्कार करेंगे।
So discover the monk and meditativeness in you. आप चतुर हो पर चमत्कार पे चमत्कार मत करो भाई, ख्याल रखिए, है ना? So the ghost is saying that transcend your innate spirituality to your social life. हर पल यहाँ जी भर के जियो क्योंकि जो है समा कल हो ना हो। फ्रेंड्स, हर घड़ी बदल रही है रूप जिंदगी। ख्याल रहे कि कल हो ना हो। सो लिव लाइफ फुल्ली, एंजॉय दिस सॉन्ग, इम्बाइब द स्पिरिट, टेक द होम दिस काइंड ऑफ स्पिरिट वी हैव।
हर घड़ी बदल रही है रूप जिंदगी। छाँव है कभी कभी है धूप जिंदगी हर पल यहाँ जी भर जियो जो है समा हो न हो हर घड़ी बदल रही है रूप जिंदगी छाँव है कभी कभी है धूप जिंदगी हर पल यहाँ जी भर जियो जो है समा हो न हो
So friends, ghost will always cut your rope. Remember this, this is the rule of life. Ghost will always cut your rope. Deeper your attachments or conditioning, deeper will be the chaos in life. And it is dependent not on the ghost, it is on you. So last lesson is commit yourself for cutting your rope. Wanted picture में सलमान खान सही सही कह जाता है कि भाई एक बार मैंने जो कमिटमेंट कर दी तो मैं किसकी भी मैं अपनी भी नहीं सुनता फिर खुद की भी नहीं सुनता. क्या बात है. ये लेवल का कमिटमेंट आना चाहिए और एक बार आ गया तो ही पॉसिबल है कि देयर इज अ होप एंड अपॉर्चुनिटी इन दिस रोप. राइट. देन ओनली देयर इज अ होप एंड अपॉर्चुनिटी इन दिस रोप. Transcend your spirituality. That stone needs to convert into a feather. Balancing their life with lightness. With lightness. क्योंकि as शाहरुख खान says, लाइफ इज स्टिल देयर. भले एक दिन की हो, लाइफ इज स्टिल देयर. पिक्चर अभी बाकी है मेरे दोस्त. थैंक यू डॉक्टर शेट्टी फॉर गिविंग मी दिस अपॉर्चुनिटी. थैंक यू सो मच फ्रेंड्स. थैंक यू सो मच.
मंजिलों को छीन ले आशाएं.
Boy, aren't we all lucky? We really got an exposure to another aspect of life which we have kept somewhat suppressed, still tied down. But Lucky, thank you. Thank you so, so much for bringing something to the fore. Let us say a big round of applause, say a big thank you, because that's part of getting lucky. Isn't it been a wonderful evening? We have had so many brilliant speakers, one after the other, each coming and surpassing what everything we have learned today. And it is fitting that an evening like this should have another awesome speaker, a man who needs no introduction, because each and every one of you know him as much or more than I do. I'm calling in on the dais is none other than Harish Anna. I think my favorite, our favorite, who has held us and regaled us and told us how to live life, and he's made our life so much better for having brought out the inner child in us. Ladies and gentlemen, put your hands together for Harish Anna.
ಮಧ್ಯಾಹ್ನ ಉಂತಿಜಾರೆ ನಿಗುಲು ಉಂತಿಜಾರೆ ಒಂತೆ ಗೆತ್ತೊಂದಿಜಾರೆ. If I say clap, you will not clap. If I say tali, you will not tali. Chappala! मज़ा नहीं आया. Once more, chappala. So my dear friends, I genuinely congratulate the team. Satya Prakash, Uday, Shravan, to really bring this entire occasion so beautifully. Shetties are vertical takeoff jets. In the morning, I met one man known as Tilak. Dalatti jayada. Arada dalattiji. Itte 8 hotel 4 jana ಒಟ್ಟಾದ ನಡಪಡುವರು. What has happened across the last 40 years? We have learned teamwork. We have confidence, and risk-taking appetite is fantastic. Let us all clap for all the Tilaks, small, big, and bigger. My dear friends, in ya nikule depression da dala pan punikul shetr nikul depress are sadyanage. And one tageton vere. Ye chanda pan malfire. Marnded geton rebelli. Let me talk about wellness and not illness. How does it start? Is this the first slide? No, it's not the first slide. This is forward and this is back. Back. We and Bunts Wellness. We are the fastest growing community. Many of us don't know about this in all professions. And first dialogue. Occasional exposure to workplace violence is associated with 74% excessive heart problems. Anchanaga, corporated shetranagulite for a mitturdu tirthumuta CEO, Vice President, CHRO, HRO, matra nama jokeleg panodu. Boss putting etada, aig sama malpule, atra buddu pole. ಒಕ್ಕಡೆ EMI ಉಂಡು ಎನ್ನ ಎಂಕಿತ ಫ್ಲ್ಯಾಟ್ಗೆ ತೊಂದರೆ ಉಂಡು ಊರುಡು ಮೆಗ್ದಿಗೆ ಮದ್ ಪೂರಾ ಪುಂಡು ಬುಡ್ದು ಪೋಂಡ ಪೊಸತ್ ಜಾಬ್ ಎಡ್ಡೆಡ್ ತಿಕ್ಕೊಂಡು ದಾಯಗ ನಮ್ಮ ಶೆಟ್ರು ನಮ್ಮ ಬಂಟೆರ್ ನಮ್ಮ ಮೂಜಿ ರೂಮ್ದ ಬ್ಲಾಕ್ ಉಂಡು ಅಂಚಪ್ಪನ್ ಪೂಜತೆ ಒಂದು ಕಿಚನ್ ಒಂದು ಬಾತ್ರೂಮ್ ಒಂದು ರೂಮ್ ಅಂಚಪ್ಪನ್ ಪೂಜ ನಮ್ಮ ಮಲ್ಲ ಮಲ್ಲನೆ ತೂಪಿನಿ. I have seen in the last few years, bad CEO leads to heart attack in the company, many heart attacks. So no toxic boss. And if your son or your daughter is tense and toxic, tell him, "Buddu budu marava, one thingul illadugul, dala puji," and that is something which is very important. Now, boss here, unde to boss here. ಕಣೆನೇ ಬುಡದಿ ಗೊತ್ತಾಪೋಜಿ ಆ ಪೊಂಜೋನ ದಾಲ ಸಮಜ್ಜಿ लक्ष्मीकांत सलमान खान का नाम मत लो, बिश्नोई आपके दुकान में गोली मारेगा. सलमान खान बंद. इत्ते ಕೆಲವೆರುಲ್ಲೇರು ಕಡೆನೇ ಹತ್ರ ಬುಡೇದಿ ಜಿಂದಗಿ ಬರ್ ಕ್ರಿಟಿಸೈಸ್ ಮಲ್ತೊಂದುಲ್ಲೇರು ಯಾ ನೀಕು ಎಡಮ ಲಕ್ಷದ ಹಾರ್ ಕಂತೆ ನೀಕು ನಿನ್ನೆ ಪಿಜ್ಜ ಅಂದ್ ಅಲ್ದ ತುಲ್ಲೆ ಐಡ್ದು ಮಲ್ಲ ಹಾರುಂಡು ಹತ್ರ ಅಂಜೋ ಕೆಲವು ಸರಿ ಇನ್ಸಲ್ಟ್ ಮಲ್ತೊಂದೇ ಉಪ್ಪು ಇನ್ಸಲ್ಟ್ ಮಲ್ತೊಂದುಪ್ಪನಾಗ ಹಾರ್ಟ್ಗೆ ತ್ರಾಸ ಹಾಕೊಂಡು ಇನಿಪೋದು ಪೇರಿಗೆ ತೊಂದು ಕಣೆ ನನ್ನ ಕಾರ್ ದೆಕ್ಕಲೆ ಕಣನೆ ಬುಡೆ ದಿನ ಕಾರ್ ವಿಸ್ಕಿಡ್ ದೆಕ್ಕಡೆ ದಾಲ ತೊಂದರೆ. But what is important, the point I want to drive is humiliation, excessive criticism continuously can cause heart problems. Now, hospital bullying has been found to have increased incidence of heart disease. There are other factors which Sadanand will say or he must have said, but this is a new finding, lot of data on the same. Itte ಬಾಸ್ ತ್ರಾಸ್ ಕೊರಿಯಡ ಒಂದು ಪಿಕ್ಚರ್ ಏತೆ ಜನಕ್ಕಳು ತೂತಾರೆ ತೂವರ್ಚಿ ನಿಗುಲೆಗ್ ದ ಐಟ್ ಗೊತ್ತುಂಡತ್ತೆ ಅವು ಜನ ಪನ್ಕೊಂಡಿದ್ದೆ ಮೈ ಬಾಡಿ ಪಾರ್ಟ್ ಇಜ್ಜೆ ನಿಗುಲು ಎಂಚಿನ ಮಲ್ತಲ್ಲ ರೆಡಿ ಇದನ್ನ ಎಡ್ಡೆ ಪಿಕ್ಚರ್ ತೋಡದೆ. ಇಟ್ಸ್ ಅ ವೆರಿ ಗುಡ್ ಮೂವಿ, ಐ ಥಿಂಕ್ ಯು ಶುಡ್ ಆಲ್ ವಾಚ್. ದ ಪಾಯಿಂಟ್ ಈಸ್ ಇಫ್ ಇಟ್ಸ್ ಅ ಟಾಕ್ಸಿಕ್ ಬಾಸ್ or if it's a toxic husband or her wife, janakulu 3 types the response undu. Onju response enju gottande ee panonde uppula ee panonde uppule yan enna kelsa maltondu lek dala sar pura ponjo anchenittule ponjo pura telpuntu avu undu apashabda yan panpuji avu type maltina edde tojundu. So sometimes people cope by this. Nothing happens to me. Sometimes they believe that they're Buddha, but they take it in. They keep quiet. ನಮ್ಮ ಪಾತೆರೆ ಬಲ್ಲತಾ ಒರಿ ಪೊತ್ತನಗ ಒರಿ ತೆಕ್ಕವಡು ಇನ್ನು ಅಜ್ಜಿ ಪನೊಂತೇರು ನಮ್ಮ ಪಾತೆರೆ ಬಲ್ಲಿ ಮನಿ ಪಂದಿ ಕುಲ್ ಅಗಲೆಲ್ಲ ತ್ರಾಸ್ ಮಸ್ತ್ ಹಾಕೊಂಡು ಬಿಕಾಸ್ unconsciously humiliation and criticisms go to the heart, and this is something very important. ಇನಿ ಒಂದು ಎಲ್ಲ ಹಿಡ್ದು ಅರ್ಧ ಲೀಟರ್ ಪೇರು ಹೆಚ್ಚಿಗೆ ತೊಂದಲೆ, ಒಂಜಿ ಕ್ವಾರ್ಟರ್ ವಿಸ್ಕಿ ಹೆಚ್ಚಿಗೆ ತೊಂದಲೆ, ಕಾರ್ ದೆಕ್ಕಡಿ ಜೋಕಲೆಗೆ ಮಂಡೆ ಬೆಚ್ಚ ಅವ್ನು ಮಾತು ಎಂಚಿನಾತೀನಿ ಅದಾಗ ಎನ್ನ ಪುದರ್ಗೆ ತೊಂದರೆ ಬಲ್ಲಿ ಸತ್ಯಪ್ರಕಾಶ್ ಹೆಗಡೆಯನ್ನು ಅಡ್ವೈಸ್ ಬಂದರು. When both are critically and extremely bad, then it affects both. Will you play the video? ಕೆಲವು ಸರಿ ಕ್ರಿಟಿಸೈಸ್ ಮಲ್ಪುನ ಬುಡೇದಿ ಇಜ್ಜಿ, ಕ್ರಿಟಿಸೈಸ್ ಮಲ್ಪುನ ಹಸ್ಬೆಂಡ್ಲೆ ಇಜ್ಜಿ, ಮತ್ತು ಅಚಾನಕ್ ಸ್ವಭಾವ ಚೇಂಜ್ ಆಪಡು. ಅವು ಸ್ವಭಾವತ್ತು ಅವು ಮೈಂಡ್ ದ ಫ್ಯೂಸ್ ಔಟ್ ಆತೀನಿ. ತೆಲ್ಪೊರ್ಚಿ ಎರ್ನಲ ಫ್ಯೂಸ್ ಔಟ್ ಆದರೆ ಸಾಧ್ಯ ಉಂಡು. ಜಾತಕಡು ಉಪ್ಪು ಸಮ ತೂಲೆ, ಜಾತಕ ತೂಲೆ ಏನ ಎನ್ನೆಲ್ಲ ಔಟ್ ಆದರೆ ಸಾಧ್ಯ ಉಂಡು. ಸತ್ಯಪ್ರಕಾಶನ ಔಟ್ ಆದರೆ ಸಾಧ್ಯ ಇಜ್ಜಿ. ಸೊ ಇಟ್ ಈಸ್ ಇಂಪಾರ್ಟೆಂಟ್ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಇಫ್ ದ್ಯಾಟ್ ಹ್ಯಾಪನ್ಸ್, ಇರಿಟಬಿಲಿಟಿ ಆರ್ ಸ್ಯಾಡ್ನೆಸ್, ದ್ಯಾಟ್ ಈಸ್ ಡಿಪ್ರೆಷನ್, ಆ್ಯಂಡ್ ದ್ಯಾಟ್ ಈಸ್ ನಾಟ್ ದ ಕಾಸ್ ಆಫ್ ನೇಚರ್, ಆ್ಯಂಡ್ ದ್ಯಾಟ್ ಈಸ್ ಸಮಥಿಂಗ್ ವಿ ನೀಡ್ ಟು ಟ್ರೀಟ್. ನಾವು ಓದುಲೆ ಮಾರಿ ಇಂಗ್ಲೀಷ್ ಅವು ಕುಂಬಾರನ ಭೂತ ತೂಯಿಪೆಟ್ಟಿಗೆ ನಮ್ಮ ಕುಂಬಾರನ ಶುರು ಅಲ್ಪ. ರಿಮೆಂಬರ್ ಒನ್ ಥಿಂಗ್, religious beliefs provide an abiding sense of well-being. Relationship of religious beliefs with distress means people who are religious without fear, agalla mental health eddepundu. Ini podu Instagram open malpurchi bhagyada Lakshmi Baramma panle. Alignment to religion improves mental health, but there's one caveat there, that is, don't pray because you are scared. Pray because you love your God. And that is so important. And start with your children very early. Sadanand Shetty, Dr. Sadanand Shetty, sends a quote every day. I know he's committed. He's religious, he's spiritual. Bokka, ನಮ್ಮ ಜೋಕಲೆ ಕೆಲವು ಅಭ್ಯಾಸ ಶುರುವಾತ ನಿಂಚಪ್ಪ. ಯಾನು ರಿಲಿಜಿಯಸ್ ಹತ್ತು, ಯಾನು ಸ್ಪಿರಿಚುವಲ್ಗೆ ಕೆಪ್ಪಂಡೆಗೆ ನಾಲ ಪಾಡೋಡು ನಾ ಅಜ್ಜಿ ಪಾಟ್ಲೇರ್ ಕಟ್ತಾರೆ. Religion and spirituality cannot be differentiated. It is linked. ಕಾನದ ದೇವಸ್ಥಾನ ಹೋಗಿ ಅನ್ ಪೋನಾಗ ಅವ್ ದೇವಸ್ಥಾನ ಈತ ಶಾಂತ ಉಂಡು ಭೃಗುರು ಶಲ್ಬ ಒಂದ್ಸರಿ ಬತ್ತಿತ್ತಿರ್ಗೆ ಇನಿ ಕೂಡ ಡಿಪ್ರೆಷನ್ ಎಂಗ್ಸೈಟಿ ದಾಗೆಚ್ಚಾತೀನಿ. Connectedness ijji. We don't feel we are part of a big whole. We don't feel that we are a part of a very great civilization, more than 10,000 years old. ಮರಾಣಿಗೆ ಒಂಜಿ ಶೆಟ್ಟನ ಇಲ್ಲ ಪೋತೆ ಮಗೆ ಗಾಜಾಡಿ ಭಾರಿ ಅವು ಮತ್ತು ಬಾಂಬಿಂಗ್ ಬ್ಯಾಡ್ ಅತ್ತೆ ಆಮೇಲೆ 100% ಬ್ಯಾಡ್. ಬಾಂಗ್ಲಾದೇಶದಲ್ಲಿ ಎಂಚಿನ ಹಾಕೊಂಡು ಅವಳ ತುಲೆ, Pakistan engine apnawala today. When you narrow your vision, anxiety increases. When you are connected with the big whole, anxiety goes down. Panic attack. EMI attu. You feel disconnected. You don't feel part of the whole. So it's extremely important to see that your grandchildren start praying if you don't pray. Belief in literal afterlife. Punarjanma undu. ಬರಿತೆಲ್ಲಡು ಕಾಸು ತಗಲಿಲ್ಲಾಡಿ ಎನ್ನ ಜನ್ಮ ಹಾಕೊಂಡು. Death is a comma, not a full stop, and that is very, very healing. My dear friends, meaning in life is important. A lot of people here have meaning in life. All these doctors and chartered accountants who have brought this entire group together have meaning in life. And in the morning when I was speaking to Dr. Satya, he said we are going to have health systems for Bunts and for the country. And that is meaning in life. Meaning in life is not counting how much money you have made. That is a thrill. Earning wealth is important. Simple living, simple thinking, not important. High living and high thinking, but meaning in life. If you have a meaning in life, your health is much better, your mental health is much better. Sometimes these doctors come and tell me, अभी क्या है, हॉस्पिटल हो गया, EMI गया, लोन सब क्लियर हो गया, अभी अपने को IMA का प्रेसिडेंट बनने का है. क्योंकि आइडेंटिटी नहीं तब तक you feel lost. Then you go for an partnership with God has to start from day one. When you're earning 1 rupee, you have given 5 paisa to Nityanand Swami. All those elderly Shettis know who Nityanand Swami was. And that is meaning in life, and that improves mental health. Nama, Nigala, Barit Christian Nagulitereda, Agale Kenle, Sunday Jokul Wode Popan. They go to Sunday Bible classes. Every school has Bible classes. Muslims, they, even if they are in the topmost school of the country, they will call a mullah to teach the Quran. Nama jokulenchen malpwa. Pizza giva. Our internal security is in danger. If you don't know, अपने बम के नीचे बॉम्ब है, यदि आपको पता नहीं है तो. It is important for all our institutions, Buntasanga School, Buntasanga College, to have Sunday classes of sanskar, of Hindu culture. If you can't start one, go to Chinmay Bal Vihar, they will start for you. There are many organizations. You will lose your country if you don't start this now. We have to build a nation. When you build a nation, mental health automatically improves. And I'm sure that these words which I say will go deep into all our friends and centers. And whichever place you have, start the Sai Baba. You can do the Sai Baba classes, or my sister Shivani also has. All these centers are protecting our country. They are buffers against Mr. Trump and Mr. Yunus. Unless we add and multiply this, mental health will not improve. My dear friends, why can't SM Shetty School at Powai, the school and the college here, open Sunday classes? I am angry because I was not taught the Bhagavad Gita when I was in school. Now, don't get ashamed. Log kya bolenge? Kasat has said, log kya bolenge karenge to बार बार तुम्हारा जन्म इस पृथ्वी पर होएगा, ब्रह्मांड के साथ आप विलीन नहीं होंगे. Continuously, undakka vanna, address change out punga. You have to do it because we have to do it. There is no choice. It's not a reaction, but a positive action. All the rich guys here, please, when you donate to temples, see to it that the activity in the temple is also under your control. And they do Sunday sanskar classes. My dear friends, next, Bunji Jana, Yeng Pande, Yeng Santa Cruzuru Uppare Jind, our airport, our Samayan onji, Vaside onji, like the illigatonde, Alpa Pura green. Budedi Pande, Irpole Yamar Puj. Nam Budedi Nam Ponjeg, mean the market Muttabodu, parlor Muttabodu, Mighty than Illa Muttabodu, Appemela Muttani Podu. Arpoer Jana. Orte, when Tingoland, Iponjo Altopoji, when Tingol Loka, are Prienchal and two hour pen. I will poi book, I'll stop dial. Unji dina 2 nights and 2 days kuliol. Imbe kas gitonje. ಬೊಕ್ಕ ಮೂಜಿ ತಿಂಗಳದ ಬೊಕ್ಕ ಶಿ ವೆಂಟ್ ಆ್ಯಂಡ್ ಸ್ಟೇಡ್ ಆ್ಯಂಡ್ ರಿಟೈರ್ಡ್ ಇನ್ ದಟ್ ಪ್ಲೇಸ್. ಎನ್ನಲ ಅವೇ ಸಂಕಟ. ಎನ್ನ ಊರು ನಂದಳಿಕೆ ತಪ್ಪರಿಗೆ ನಿವಾಸ್. ಉಳ್ಳೇರೆ ಮುಲ್ಪೈನ ಊರದಗುಲು ಮಸ್ತ್ ಉಳ್ಳಿರುತ್ತೆ. ನಂದಳ್ಕೆ ಜಿಂದಾಬಾದ್. ಉಳ್ಳೇರು. ವಿ ಹ್ಯಾವ್ ಇನ್ಫಿಲ್ಟ್ರೇಟೆಡ್ ಆಲ್ ಆರ್ಗನೈಸೇಷನ್ಸ್. ಎನ್ನ ಇಲ್ಲು ಮಿತ್ತು ಕಾಡಿಪಿರವಡು ತಿರ್ತು ಕಂಡ ಎದುರು ತೋಟ ಅಂಚಿಡ್ದು ಮಂಗೇರ್ಲು ಇಂಚಿಡ್ದು ಉಚ್ಚು ಅಂಚಿಡ್ದು ನಾಯಿ ಇಂಚಿ ಪುಚ್ಚೆ ಕೋರಿ ಬ್ಯೂಟಿಫುಲ್ ಪ್ಲೇಸ್ ಎಂಕ ಅವಳು ಪೋದು ಸೆಟ್ಲ್ ಅವಡು. ಎನ್ನ ಬುಡದಿ ಪನ್ಪಿನಿ ಈರು ಪೋಲೆ ಅಂಬರ್ ಪೂಜೆ ಎಂಚಿನ ಮೊಗಲೆ ಬೊಂಬಾಯಿದ ಚಟ ಅದೇ ಮದ್ಮೆಗೆ ಪೋಡು ನಿಶ್ಚಯಕ್ಕೆ ಪೋಡು. So my dear friends, there is evidence, I am not speaking out of evidence, researched evidence that viewing nature from home is very good. ಅಂಚಪ್ಪನ್ನ ಒಂಜಿ ಪಂಟೆ ಶೆಟ್ರಿಂಕ್ ಯಾನು ಊರುಡು ಬಂಗ್ಲೆ ಕಟ್ಟಿಯೇ ಹಿಂಗೆ ಗೊತ್ತಾಂಡು ಇಂಚ ಬಂಗ್ಲೆಂದು ರೋಡ್ದ ಬರೀಟು ಒಲ್ಪಣ್ಣ ಬಂಗ್ಲೆ ಉಡುಪಿಡು ರೋಡ್ ಸೈಡ್ ಡೇ ಮಸ್ತ್ ಕಾಸು ಕೊಡ್ದು ಕಟ್ಟಿಯೇ ಇದ್ದಾದ ಅಲ್ಪ ಗಾಡಿ ಲೆಕ್ಕ ಮಲ್ಪಂದುಲ್ಲೆ ಯಾವಂಡೆ ಊರ್ನಗದಾದೆ ಕಂಡ ಪುಣಿ ತೋಟ ಉಗ್ಗೇಲು ಉಚ್ಚು ನಾಯಿ ಪುಚ್ಚೆ ಎಂಕಲ್ನ ಊರು ಲೆಪ್ಪಡ್ಲ ಬರ್ಕೊಂಡು ಪಿಲೀಲ ಬರ್ಕೊಂಡು ಅವು ಇಜ್ಜದ ದಾದ ಯೂಸ್. ಸೊ ಅವು ಪಂಡಿ ಬೊಕ್ಕ ಒಂಜಿ ಲೆಕ್ಚರ್ಡ್ ಆಜಿದಿಂತ ಬೊಕ್ಕ ಒಂಜಿ ಪೊಂಜೋನ ಫೋನ್ ಬತ್ತಂಡು ಅಣ್ಣ ಇರು ಎಂಚಿನ ಲೆಕ್ಚರ್ ಕೊರಿಯರು ಎನ್ನ ಹಸ್ಬೆಂಡ್ ಪನ್ಪೇರು ಕಾಡ್ದ ನಡುಟು ಒಂಜಿ ಬೈತೆಲ್ಲು ಕಟ್ಟೋಡು ಮಂಡೆ ಅಂಚ ಮತಂದಾಲ ಮಲ್ಪೊಚ್ಚು. ಇಟ್ಸ್ ಇಂಪಾರ್ಟೆಂಟ್ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ದಟ್ ವ್ಯೂಯಿಂಗ್ nature improves health, and perceived amount of green space is associated with better mental health. ಆ ಒಂದು ಬತ್ತಂಡು ರೆಸ್ಟ್ಲೆಸ್ ಆವರ್ಚಿ ಹೆಚ್ಚ ಕಿನ್ನಿ ಫ್ಲ್ಯಾಟ್ ಇತ್ತಂಡ ಒಂಜಿಲ್ಲಾಡು ಕೆಲವು ಪ್ಲಾಂಟ್ಸ್ ಗ್ರೋ ಮಲ್ಪೋಡು ಐಕ್ ಪುದರ್ ಕೊರೋಡು ಕಣೆನ ಬುಡಿದಿನ ಪುದರ್ ಕೊರೋಡ್ಸಿ ಪುದರ್ ಕೊರ್ನಾಗ ಪಾತ್ಯ ರೋಡು, and that also helps improve mental health. My dear friends, nature indirect, intentional and incidental helps mental health. ಸುರುಟ್ ಒಂದ್ಸರಿ ಪಂತೆ ನಿಗುಲಿತ್ತಾರ ಮೂಲು ಬಾತ್ರೂಮ್ ಉಡ್ದು ಕಾಂಡೆ ಬೇಗ ಪಿದೆ ಬರ್ರೆ ಬಲ್ಲಿ ಮಸ್ತ್ ಮೀವಡು ಬುಡೇದಿ ನಾಕ್ ಮಲ್ತಂಡಲ್ಲಪ್ಪ ನೋಡು ಅವು ಎಂಕ್ಲಿಗೆ ಡಾಕ್ಟರ್ ಸತ್ಯಪ್ರಕಾಶ್ ಪಂತೀನಿ. Water is one element which calms down your sympathetic tone, brings down your heart rate, brings down your cortisol levels. ಒಂಜಿ ವಸ್ತು ಇರು ಸ್ಟಾರ್ಟ್ ಮಲ್ಪೆ ನಿಗುಲು ಪೇಪರ್ ಓದರೆ ಬಲ್ಲಿ ನೀರು ಬೂರ್ನಾಗ ಅಂದಾಜು ಉಪ್ಪೋಡು ಎಂಚ ನೀರು ಬೂರುಂಡು. ಐ ಥಿಂಕ್ ದ್ಯಾಟ್ ಈಸ್ ಆಲ್ಸೋ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಮೈ ಡಿಯರ್ ಫ್ರೆಂಡ್ಸ್, ಆಸ್ ಐ ಸ್ಟಾಪ್ ಪ್ಲೇ. ಹಲೋ, play the video.
Can take more time.
I know. Play the video, please. ಎಂಚಿನಂಡಣ್ಣ ವನಸುಲ ಬ್ಯಾಂಕ್ವೆಟ್ಲ ಶುರುವಾತಿಜಿ. play. Anyway, ಆಪುಜೆ Amog can check. No, it's a video which can be played from here. You have to just click here. If you can't, it's okay. No problems. This video, can you believe that 150 years ago, young boys and girls had heroes, and they were warriors and great knowledgeable people. They were not actors, nor they were cricketers. Bollywood did not talk about Pahalgam at all. They did not talk about Pahalgam at all. Tell your children this. At the same time, Infosys president, Mr. Murthy, says nationalism is not good, patriotism is good because it's an interconnected world. I understand that. Business is there all over. But if India does not survive, where will your business survive? And so what is important for us to teach our children? Nigale convince aati pokkale change malkochu. Sama bajile chappala pokkala incha. So my dear friends, actors and Indian businessmen and cricketers did not criticize Pell. Very few. They did not. They will play with Pakistan. Unless you become a little more vibrant and little more united, our country is in danger. So when we are connected, mental health is much better. My dear friends, as I slowly stop, 13 साल के बच्चे से 25 साल के उम्र के लोग अपने विकसित भारत जब 2047 में होगा, तब वो विकसित भारत को बनाएंगे. कसाट ने तो बोल दिया तुम कितना जियोगे 20. सबको थोड़ा पैनिक अटैक आया होगा. तुम 10-20 और कितना जियोगे. अपने हिंदू धर्म में मरण है ही नहीं, चलता रहता है, वो साइकिल चलता रहता है. एंड दीज बॉयज 13 to 25, apart from Sunday classes, they should be taught leadership. How will they lead in the future? V.S. Naipaul once wrote in his famous book, India, a Land of Million Mutinies. And that he wrote that Indians only cast a shadow, but they don't. And then Indians only work under a shadow, but they don't cast shadow. Now Indians are casting shadows. Leadership training has to be given to our children in all our institutions. In all our institutions. You have to teach them how to lead. My dear friends, it's important to understand that don't discuss Ukraine war. Doesn't matter. Trump को तो अपन साला घुमा देगा. मतलब हिंदुस्तान है यार. तुम्हारा 200 साल का इतिहास है. अमेरिका का अपना 10,000 साल का इतिहास है. The collective unconscious will stand, and it will help. Trump is nothing. He's like our roadside. Don't talk about him. Don't talk about Ukraine, Israel. No, my dear friends. Take care of your gullies, take care of your lanes. Find out how many girls have run away with people whom they should not have run away. You don't know what is happening in India. How many of your mates go and pray to gods which you do not know? Be aware. If nation survives, Buntasang also survives. It is not otherwise. It's not otherwise. That is something we need to know. My dear friends, this book, Harvard's book, it's a happiness study across 75 years. They followed hundreds of families across 75 years. And at this age, your happiness depends upon your connectivity. I married yaar masta bari boot dale jao ireg ulad throw you know. A problem irna. I think it's so important to be connected. Every young man and woman in your family should read this book. It's a happiness study. As I stop slowly, you will say, what is this India talking about? Mental health you're supposed to talk about. Civilizational pride leads to self-belief. When you're proud of Rani Abbaka, you feel nice. When you're proud of somebody who tortured our country, you don't feel nice. You have to awaken all those spirits inside you. And so that our children, our ajis, our ajjas, our papas, our mummies, our uncles and aunties start getting pride. Civilizational illiteracy leads to leads to illiteracy. And civilizational India knowledge India barpuji. Civilizational ridicule leads to an inferiority And this is something very important. So when you think about mental health, you need to think about your environment. My dear friends, I stop in the next 2 minutes or 2 to 3 minutes. There are some important people who have come. Please clap. Clap more, others, they will not sit. Now they sat. My dear friends, Shashi, hi. I was waiting for you. Thank you, sir. Shashi Kiran is a very special friend. My wife's best friend's husband. Now we are the best friends. And I was speaking about Shetties as vertical takeoff jets, and you are one. And so many of others. Yeah. ಅತ್ತುಲೆ ನಿಗಲೆ ವಿಶ್ವಾಸ ಆಯ್ ಬಟ್ಟು ಯಾನ್ ಬಟ್ಟುದೆ ಬಟ್ಟುಡು ಮಾತೆಲ್ಲ ಬಟ್ಟಲೆ ಮಾರ್ರೆ. I'm proud of you, sir. And the nation is proud of you and all others. So, my dear friends, 4 days ago, there was a lot of riot on Facebook. One woman wrote, Yan Sanatani, Yan chanting Malton Dupanaga, Pura Jihadis Nagul Popere. Ya Mande Samaji. We are Dharma Palaks. But time has become, we have to become Dharma Rakshaks. ಬಿಸತ್ತಿಲ್ಲ ಬಿಡಿಲ್ಲ ಕೈಟಿಗೆ ತೊನ್ನ ಟೈಮ್ ಬೈದಂಡು ಎಡ್ಡೆ ಕೆಲಸಗೂ ನಮ್ಮ ಇತ್ತೊಂದ ದುಂಬುಲ್ಲ ಮತ್ತು ಎಡ್ಡೆ ಕೆಲಸಗೂ ಬಿಸತ್ತಿಲ್ಲ ಬಿಡಿಲ್ಲ ಮೆಟಫರಿಕಲಿ ಐ ಆಮ್ ಸೇಯಿಂಗ್ ವಿ ಹ್ಯಾವ್ ಟು ಬಿ ಪ್ರಿಪೇರ್ಡ್ ಟು ಫೈಟ್ ಆ್ಯಂಡ್ ಪ್ರೊಟೆಕ್ಟ್ ಅವರ್ ಕಂಟ್ರಿ ಆ್ಯಂಡ್ ಪ್ರೊಟೆಕ್ಟ್ ಅವರ್ ಇಂಟರ್ನಲ್ ಸೆಕ್ಯೂರಿಟಿ. ಕೆಲವರು ಬಂತಾರೆ, ಕೆಲವರು ಫೋನ್ ಮಾಡ್ದಂಗ್ಲೇ ರಗಲ್ ಹೋಟೆಲ್ ಏತು ಬೇರೆ ಬುರುಂಡು ಪೂರ ಬೇರೆ ಬಂದ್ ಹಾಕೊಂಡು ಇಫ್ ಯು ಡೋಂಟ್ ಪ್ರೊಟೆಕ್ಟ್ ಅವರ್ ಕಂಟ್ರಿ. ಧರ್ಮ ರಕ್ಷೆಗೆ ಒಂದು ಏರೊಂದು ವೈಜಂತಿ ಬಲ ಕಮಾಲ್ ಮರ್ರನಿಗಳು ರಾಣಿ ಹಬ್ಬಕ್ಕ ಎಂಚಿನ ಮಲ್ದಿರು ಏರಲ್ಲ ಒಂಜಿ ಜನ ಉಂತುದು ಪನ್ಲೆ ಇನ್ನು ಹೆಚ್ಚ ಟೈಮ್ ಪೋತುಜಿ ಒಂದು 3 ದಿನ ಒಂದು ಅರ್ಧ ಮಿನಿಟ್ಲಿ ಹೆಚ್ಚಾತು ಏರಲ್ಲ. ಕ್ಯಾನ್ ಎನಿಬಡಿ ಸೇ ಯಂಗ್ ಶಿ ಡಿಫೀಟೆಡ್ ದ ಪೋರ್ಚುಗೀಸ್ 4 times in the naval war, and that is something very important. This video has to play, otherwise I'll shoot you.
पहले हर क्रिकेटर एक क्रिकेट फैन होता है और इसीलिए वो क्रिकेटर बनता है और ये बार बार सनी जी की बॉडी लैंग्वेज में उनके हर सेलिब्रेशन में नजर आता है. इन्हें कौन रोकेगा आज?
जी हाँ, बिल्कुल रुकना चाहिए भी नहीं, क्योंकि क्यों रुके. हाय मजा आ गया देख के, है ना. ये हमारे दिग्गज है, ये हमारे देश के दिग्गज है, ये हमारा सम्मान है, क्योंकि इनकी वजह से ही तो हम सब है ना. क्योंकि जब ये खेलना शुरू किए थे उसके बाद वो मोमेंट आए, उनको देख के हम लोगों ने वो प्रभावित.
He is 76. He is also a close friend of Shashi Kiran. They used to play together some time back. See the ease of his body. See the childlike. Namma Shetrinagalegue dance malpare gottundu. Chappe neeru parda puji becce neere bodu. ಒಂಜಿ ಸರಿ ಬಂಟ ಸಂಘದ ಪ್ರೋಗ್ರಾಮ್ ಬೆಚ್ಚ ನೀರು ಬಂದ್ ಮಲ್ಪಲೆ DJ ಕನ್ಲೆ. My dear friends, good health is all about being physiologically at ease, ability to be childlike. ಬಂಟ ಸಂಘದ ಪ್ರೆಸಿಡೆಂಟ್ ಕುದೊಂದಿರು ಏಪ ನಾಳೆ ಡಾನ್ಸ್ ಮಲ್ಪು ಏಪ ಡಾನ್ಸ್ ಮಲ್ಪು ಇನ್ನೊಂದು ಉಳ್ಳೇರು ಮಲ್ತು ಈಗ ಸ್ಟಾರ್ಟ್ ಮಲ್ತಾಡ ಮಾತೆಲ್ಲ ಮಲ್ಪೇರು. So my dear friends, at the end I would like to finish by saying, well-being is not a big science. It is revisiting the basics. ಇಲ್ಲ ಕಿಂಜಿತ್ತುಂಡ ಒಂಜಿ ಕಿಂಜ ಗಾರ್ಡನ್ ಊರ್ದ ಇಲ್ಲಿತ್ತುಂಡ ಮಾರ್ರನೆ ಬಲ್ಲಿ ಅವು ಇಂಕುಲ್ ಪಾಲ್ದಗುಲಿ ಪೂರ ಕೊರ್ತ ಗೆತ್ತೊನ್ಲೆ ಪಿರ ಟೈಮ್ ಬತ್ತಂದು ಗೆತ್ತೊನ್ಲೆ ಪಿರ ನಮ್ಮಡ ಒಂಜಿ ಕಂಡೆಜ್ಜಿದಲ್ಲ ಮಲ್ಲೆಜ್ಜಿ ಉಗ್ಗೇಲು ಪುಣಿ ನಾಯಿ ಪುಚ್ಚೆ ಕೋರಿ ಕೆಲಸರಿ ಪಿಲಿ ಕಾಂಡೆ ಮತ್ತು ಪಕ್ಷಿದ ಆವಾಜ್ ಇಜ್ಜಿಡ ಎಂಚಿನ ಮಾರ್ರೆ. My dear friends, people who live in jungles are calmer than people who live in concrete jungles. And I would like to stop by saying, let us all start Sanskar, Bala Sanskar Kendras in our schools and colleges. The Christians are doing a great job with their Bible classes. Itte tirth jappun andajundu matra chappala bodute. Thank you.
Isn't he awesome? We all loved him always, and every time he comes up here and talks to all of us, life just gets better and happier and happier. Harishanna, thank you so much from all of us here. And let our president say, we carry you back in our hearts and all that you said.
I'll wait downstairs. I kept...
So we've done a brilliant job in the first part. We are bang on schedule with our lectures. The scientific part now comes to an end, but there are a lot of people to thank. First and foremost, obviously, every speaker who's been here, who's come and taken time off from his or her busy schedule, shared information with us, something that we are going to change our lives and live with. I would like to also first and foremost thank Vijayaka for launching this by explaining the difficult mathematics to you. Now you know how it all adds up to 100. Very often we hear people saying that, may you live long. I think I would like a blessing which say, may you live full. Because not the length of time that I live, but rather the quality of life that I lead is what's going to make the big difference. Whilst we're all seated here, give us a couple of minutes, 2, 3, 4 minutes to set up the stage, and then we will start with the next part of our program. As you already know, that our chief guest also is here. So we'll just set up in another 2 minutes and be ready to start with you. Bear with me.
Thank you, Dr. Ajit. Ladies and gentlemen, namaskara and a very good evening once again. On behalf of the Association of Bunts Doctor, I welcome you for the second part, and that is the stage program. Our chief guest has already arrived. We have the president of Bunts Sangha and the office bearers, trustees, past presidents, committee members, senior doctors, the Mahila Vibhag team, youth wing, regional committee, members from the allied organization, and all you guests. Your presence has touched us, and we are immensely grateful to each one of you. We have just witnessed the eminent doctors and experts share their medical brilliance in the nutshell. I think this is first of its kind at this premises at the Bunts Sangha. And the math 4 + 1 is equal to 100, which I said when we began the program. I'm sure you will all agree with me. This is not a mathematician's math, but this is the formula which is Bunts doctor's math. 4 + 1 is equal to 100. Noodu varsha badakorda. Physical, mental, social, spiritual well-being is very, very important. As the stage is set up, I now request I now request the President of Association of Bunts Doctor, Dr. Satyaprakash Shetty, along with the office bearers of Association of Bunts Doctors, Mumbai, to escort our chief guest for today's program, Dr. Shashikiran Shetty, Chairman and Managing Director, All Cargo Logistics, our President of Bunts Sangha, Shri Praveen Bhoja Shetty, along with the entire team onto the stage. I think the stage is set up now, so may I request? Yeah, I think we have 1 minute to go. So I will just ask my audience, as promised, how was the program? How was the scientific program? If it was good, then I should have a round of applause. I think this is the first medical program where there was no medico terms, there was no jargons used, but the point which was to be made, I think, was very beautifully put up. And your applause says it all. So let's have a new beginning, the new me today. Whatever has been said, let us implement it. And at the end, Dr. Harish has rightly said that the new generation which has to come, it is we who have to handhold them and teach them what is spirituality and what is the meaning of our religion. So let us take that pledge. Let us begin a new beginning for the new generations, so that when we look back, we know that we have done a good job. Thank you very much. So we have our chief guest. We have our President of Bunts Sangha, Shri Praveen Bhoja Shetty. We have the President of Association of Bunts Doctor, Dr. Satyaprakash Shetty. We have the office bearers of Association of Bunts Doctors, Dr. Uday Shetty, General Secretary, Dr. Ajit Shetty, Vice President, Dr. Ranjan Shenava, Vice President, Dr. Vidya Shetty, Treasurer, Dr. Shravan Shetty, Joint Secretary, Dr. Sadanand Shetty, Advisor, and Dr. Swarup Hegde, Chief Coordinator. Every auspicious beginning in our culture begins with the lighting of the lamp, signifying something beautiful and inviting the blessings of the Almighty. Let the light be a symbol of knowledge, healing, and divine light that guides the noble profession of medicine. I invite Shri Praveen Bhoja Shetty, President, Bunts Sangha, Mumbai, to kindly inaugurate the function with the lighting of the lamp. Requesting the chief guest, Dr. Shashikiran Shetty, President of the Association of Bunts Doctor, Dr. Satyaprakash Shetty, office bearers to join. This will be followed by the prayer song by Shruti and Sneha.
वक्रतुण्ड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा शुभं करोति कल्याणं आरोग्यं धनसम्पदा मम बुद्धि प्रकाशं च दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापं दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते ॐ
Thank you. Now I request the President of Association of Bunt Doctors, Mumbai, Dr. Satyaprakash Shetty, a highly respected and eminent doctor known for his compassionate care and clinical expertise, and also a person who is a crusader of holistic well-being. May I request him to talk about the establishment of the Association of Bunt Doctor and his vision about the association. Over to you for a welcome note.
Respected President Bunsanga, who inaugurated this newly formed organization, Association Bunts Doctors. Also is a big supporter of Association Bunts Doctors. The esteemed chief guest, the founder, CMD of Alcargo Logistics, big industrialist of international fame, Dr. Shashikiran Shetty, office bearers on the dais, and our advisor, senior doctor, Dr. Sadanand Shetty, and the distinguished guests, all heads of our allied organizations, our senior doctors and two distinguished guests who will be honored by ABD today, our esteemed speakers, and our sponsors who are here in large numbers, ladies and gentlemen. Wish you all very good evening. Materegla namaskara. सर्वांना माझा नमस्कार. मला मराठी नॉन मराठीचं भांडण नको, आम्ही सर्व मुंबईकर आहे. Warm welcome to you all. It's a sort of Bunts medical seminar. More than the seminar, it's Bunts medical Aati the Kuta, that healthy social epidemic is going on across Mumbai. And happy Raksha Bandhan to all my sisters and mothers who are here. Today, I'll be able to give you a little knowledge about health and unconditional love. I don't have any materialistic gift to give to you all. At the very outset, I'd like to thank the President Bunsanga, Mr. Praveen Bose Shetty, for inaugurating this newly born organization called ABD. He has been a supporter since from the inception of this organization. Every time he is giving us this auditorium free of cost, some financial support also, and he is very generous. On behalf of ABD, warm welcome to you, sir. Our chief guest is our own community person, but he is a special guest to us. The reason being, he is a multifaceted personality, the industrial of international fame, philanthropist, educationalist, not only education, is a spiritual person who respects human values, and he was to travel abroad. He cancelled his program, he postponed his program for tomorrow, and he graced his occasion. On behalf of ABD, my heartfelt welcome to you, sir. I also welcome, if Bunts Sangha is our Matra Sangha, Bunts Association is like a Pitra Sangha, especially for me, because the founder, president was my father-in-law, late Dr. S.N. Shetty. And today, Advocate D.K. Shetty is representing Bunts Association. I welcome you, sir. I also welcome our allied organizations, especially the IBCC chairman, IBBC president, Mr. K.C. Chetty, popularly known as Kutpadi Chandranna. Now he is outgoing president. The incoming president, Barkur Suresh Shetty, is here. Welcome. On behalf of ABD, I welcome you. Also, the most powerful body, Hotel Owners Association, I think Sudhakar Shetty could not come because of some health reasons. I think his committee members are here. On behalf of ABD, I welcome Ahar office bearers. I also welcome the CA founder, ABCA Association, Vishwanath Shetty, Lawyers Forum, Advocate Prabhakar Shetty, Mulund Bunts, CA Karunakar Shetty, Jawab, Mr. Rajesh Shetty, Thana Bunts, Mr. Ashok Shetty, and also the newly formed organization, Engineer and Architects Association, which is yet to be registered. I also welcome 10 senior doctors who will be honored here. The names will be displayed very soon. I don't want to take out the names, it's quite lengthy. I think all above 80. The criteria was practicing doctors above 80 years. Dr. Padmini Shetty, Dr. Uma Shetty, Dr. Naren Shetty, Dr. Tukaram Shetty, Dr. Mabal Shetty, Dr. Sitaram Shetty, and Sitaram Malwa, and Shivanand Shetty. There are 8 doctors here. 2 doctors didn't come because of their various health reasons. And also my esteemed speakers who are here today. And more than anything, to conduct any program of this size, we need sponsors. Our esteemed sponsors, Mr. Krishnan Shetty, Mr. B. Vivek Shetty, and there are many more from my Mulund as well as pharma companies. I welcome each one of you. Each one of you are special guests to me today. If I miss some name, it is not deliberate or intentional. We have got some time constraint. Today's MC, she is very strict. She is the principal of a Commerce College, and she will not she will not allow me to exceed my timings. In the last 98 years of Bunts Sangha's history, the first time you are all witnessing such a beautiful crowd. The difference here is the doctors' white coat sitting with their own patients. Normally, you all sit before the doctor seat, the patient seat in front of the doctor. Multa speciality banda doctor nagla barit kulder materla. ಆತತ್ತು ಸಾಧಾರಣ ಒಂದು 30 ಡಾಕ್ಟರ್ ನಗಲು ಫಿಸಿಷಿಯನ್ಸ್ ಉಲ್ಲರು ಕಾರ್ಡಿಯಾಲಜಿ ಡಯಾಬಿಟಿಸ್ ನಮ್ಮ ಜಾತಿದ ಬಾಂಧವರು ಉಲ್ಲರು ಅಕ್ಲೆ ನಿಕ್ಲೆನ್ ತೂಂದೇ ಉಲ್ಲರು ಮಿಕ್ಲಿ ಏ ಸರ್ತಿ ವಾಶ್ರೂಮ್ ಪೋಪೇರು ಹೌ ಆಫನ್ ದೇ ಗೋ ಟು ದ ವಾಶ್ರೂಮ್ ಆ್ಯಂಡ್ ಹೌ ಮೆನಿ ಪೀಪಲ್ ದೇ ಗೋ ಟು ವಾಶ್ರೂಮ್ पण आयट रड्ड तिकूंडाकलेग डायबिटीज दाखला तिक्वेर प्रोस्टेट दाखला तिक्वेर इनकांटिनेंस तिक्वेर ಅಕಲೆ ಒಂಜಿ ಬಿಸ್ನೆಸ್ ತಿಕ್ಕೊಂಡು ಬಂದು ಅನ್ನೊಂದು ಕಾತೊಂದು ಉಳ್ಳೇರು ಆಂಡ ಒಂಜಿ ಡಯಾಬಿಟಿಕ್ ಪೇಷಂಟ್ ಪಂಡಾವು ಕಲ್ಪತರು ಕಾಮಧೇನು ಇತ್ತು ಲೆಕ್ಕ ಡಾಕ್ಟರ್ ನಗ್ಲೆ ಏನು ಅನ್ಕಂಟ್ರೋಲ್ಡ್ ಡಯಾಬಿಟೀಸ್ ಫಸ್ಟ್ diabetologist will get business, second physician will get, third cardiologist will get, fourth nephrologist will get, five neurologists, polyneuritis common. Every doctor's fraternity, ophthalmology, there are some 12 ophthalmologists in our group. Everybody is going to get business if your diabetes is under control. So message is very clear, control your diabetes or prevent diabetes. This is the second. There are more than 18 orthopedic surgeons in our group who are eagerly waiting. They are watching you. Nikla encha lakkora, nikla gate enchondo, nikla knee joint enchondo, tuonde kulderakulu. Danda orthopedicians are like two-wheeler mechanics. Akal nikla chakran badli malpunakal. They will change this one. Where is Dr. Vijay? He is there. Hundreds of knee replacement of Shetty's Maldinarar. But a celebrity orthopedic knee replacement surgeon. ಒಂಜಿ 10 ಮಿತ್ ಎಂಕಲ್ನ ಡರ್ಮಟಾಲಜಿಸ್ಟ್ ಉಳ್ಳೇರು ಮೂಲು ಗ್ರೂಪ್ ಪೊಂಜನಕ್ಲ ಡರ್ಮಟಾಲಜಿಸ್ಟ್ ಪಂಡ ನಾರ್ಮಲಿ ಲೇಡೀಸ್ ದೇ ಆರ್ ಆಲ್ ಬ್ಯೂಟಿಫುಲ್ ಲೇಡೀಸ್ ದೇ ಆರ್ ಕ್ಲೋಸ್ಲಿ ವಾಚಿಂಗ್ ಆಲ್ ದ ಲೇಡೀಸ್ ನಿಕ್ಲ ಕುಜಲ್ ಎಂಚೊಂಡು ಅಂತ ಒಂದುಳ್ಳೇರು ನಿಕ್ಲ ಮೋನ್ ಎಂಚೊಂಡು ಫೇಸ್ ಲಿಫ್ಟ್ ಕೊರ್ರೆ ಉಂಡಾಕ್ಲಿಗೆ ಐಡ್ದೆಲ್ಲ ಜಾಸ್ತಿ ಎಂಕಲ್ ಒಂಜಿ 18 ಇರುವ ಗೈನಕಾಲಜಿಸ್ನ ಕುಲ್ದೇರು ನಿಕಲ್ನ ವೇಸ್ಟ್ ಲೈನ್ ತೂಂದುಲ್ಲೇರು ಮಿಗಲ್ನ ಬಂಜಿ ಮಲ್ಲಂಡು ಮಿಗಲೋಲ್ಲ ಪ್ರೆಗ್ನೆಂಟ್ ಆತು ದಾಲ ಯೂಟ್ರಸ್ ಪ್ರಾಬ್ಲಮ್ ಉಂಡ ಅಂದ ಸೊ ಐಡ್ದೆಲ್ಲ ಜಾಸ್ತಿ ಎಂಕಲ್ನ ನೆಟ್ಟು ಒಂಜಿ 75 ಮಿತ್ ಡೆಂಟಿಸ್ಟ್ ನಕ್ಲು ಉಳ್ಳೇರು ಡೆಂಟಿಸ್ಟ್ ಆರ್ಥೋ ಡೆಂಟಿಸ್ಟ್ ಬಂದು ಸಾಧಾರಣ ಒಂಜಿ 100 ಜನ ಉಳ್ಳೇರು ಈ ಮೆಕ್ಕಲುಂಡತ್ತೆ ಅಕಲಿಗೆ ಎಂಕಲೆಗಲ್ ಎಪ್ಪೋಲ ಒಂಜಿ ಎಂಕಲ ಎನ್ನು ಎಂಕಲೆ ಸುಪೀರಿಯರ್ ಪಣ್ಣದು ಎಂಕಲ ವಿ ಟ್ರೀಟ್ ದ ಹೋಲ್ ಬಾಡಿ ದೇ ಟ್ರೀಟ್ ಓನ್ಲಿ ದಟ್ 32 teeth ಎಂಕಲ ಅಕಲೆ ಲೆಪ್ಪುನು ದಿಕ್ಕಲು ಬತ್ತೀಸ್ ದಾತ ಸತ್ಯನಾಶ ಮಲ್ಪನ ಅಕಲಂದು ಆ್ಯಂಡ್ ಆ್ಯಕ್ಚುಲಿ ಅಕಲು ದೇ ಆರ್ ದ ಸೇವಿಯರ್ಸ್ ನಮ್ಮ ಮೇರು ಪಣ್ಲೆಕ್ಕನೆ ಕ್ಯಾನ್ಸರ್ದ ಶಿಶಿರ್ ಪಣ್ಣೆ ಲೆಕ್ಕನೆ ನಮ್ಮ ಹೆಲ್ತ್ ಅಲ್ತಿರ್ದೆ ಶುರುವಾಪುಂಡು ಬಾಯಿಡ್ದೆ ಶುರುವಾಪುಂಡು ದೇ ಆರ್ ನಾಟ್ ಬತ್ತೀಸ್ ದಾಸ ಸತ್ಯನಾಶ ಮಲ್ಪನಕಲು ದೇ ಆರ್ ಸೇವಿಯರ್ಸ್ 2 ಜನ ನಮ್ಮ ಸ್ಟೇಜ್ ಕುಲ್ದಿನ ಸೆಲೆಬ್ರಿಟಿ ಆರ್ಥೋಡಾಂಟಿಸ್ಟ್ ಇಂಪ್ಲಾಂಟಾಲಜಿಸ್ಟ್ ಉಳ್ಳೇರು 100 ಜನ ನಿಕ್ಲೆ ಕಾತೊಂದು ಉಳ್ಳೇರು ಅಕಲು ಸಮ ನಿಕ್ಲನ ಓರಲ್ ಹೆಲ್ತ್ ನಿಕ್ಲನ ಡೆಂಟಲ್ ಲೈನ್ ಸಮ ಮಲ್ತಿರಂದಾನ ನಮ್ಮ ಮಾತೆಲ್ಲ ಹೆಲ್ದಿ ಆದ ಒರಿಯೋ ಪನ್ಪಿನ ಮೆಸೇಜ್ అయిన ಮಿತ್ ಫಿಸಿಯೋಥೆರಪಿಸ್ಟ್ ನಕ್ಲು ಉಳ್ಳೇರು ಫ್ಯಾಮಿಲಿ ಪ್ರಾಕ್ಟೀಷನರ್ಸ್ ಉಳ್ಳೇರು ನು ದಾಯ ಪನ್ಪಂಡು ಐ ಆಮ್ ನಾಟ್ ಡೂಯಿಂಗ್ ಎನಿ ಮಾರ್ಕೆಟಿಂಗ್ ಜಾಬ್ ಹಿಯರ್ ನಮ್ಮ ಐ ಆಮ್ ಜಸ್ಟ್ ಡಿಗ್ಗಿಂಗ್ ಔಟ್ the jewels in our maternal in our medical fraternity ಈತ್ ನಮ್ಮ ನೆಟ್ ಜುವೆಲ್ ಉಲ್ಲ ನಮ್ಮ intellectual resources they are underused by the community. Today we have come to a common platform and we will be serving to the community henceforth. That is the reason of very basic idea of forming this association Bunts Doctors. The journey of this association Bunts Doctor started in 1992. In fact, today our president inaugurated the organization, but it's an old wine in a new bottle. 1992, some like-minded friends, they approached Dr. K.R. Shetty, he was the first cardiothoracic surgeon of Mumbai. They requested him, and there's a way this organization started. Over a period of time, he was president for successive 2 terms. Over a period of time, the successive presidents, they contributed in their own way. And during Corona and post-Corona, it was like a sinking Titanic. And I love to give credit to my immediate past president and one secretary of ours, Dr. Ranjan Shenava. He kept this Titanic floating for almost 10 years. And Dr. Shiv Sadanand Shetty, Dr. Venkaparai, and our immediate president, Dr. Sudhir Adyantaya. On 22nd of September 2024, they unanimously elected me as a captain of this sinking ship, where we didn't have fuel, means there was no bank balance. And I was bit hesitant to take the responsibility for two reasons. Because it was an impossible job for me to revive this organization because of various reasons, because the statutory compliance not fulfilled. There is a funny quote about leadership. Try to lead the people. If you succeed, become a leader. If you fail, become a preacher. But fortunately, I got the experience. I am the past president of Mulund Bund, so I had the experience of leader. And I was heading a spiritual organization for 6 years, so I had an experience of preacher also. So I accepted this job. And I had promised in the AGM that definitely I will not allow this ship sinking. I will take it to the shore. That's why I did in the last 8 months. Now we have replaced that old steam engine with my dynamic electric engine. I got a team of youngsters in my committee. Engala Vande Bharat Leka bullet train attanla Vande Bharat Leka nanna dumbu balpodunulla. Today, 2 programs. One program is already over, scientific session. The other is yet to happen now. The first program, scientific program, very carefully and diligently crafted. 4 plus 1 is equal to 100. As our Dr. Vijeta told you, this is not a doctor-nagle lekka barpujinda naale gunjuku sertana enkle mata lekka dengla bari poor ulla engla biology odinakulu. 4 plus 1 is equal to 5, but 4 literally speaking 4 plus 1 is equal to 100, because the World Health Organization defines health as a state of physical, mental, social and spiritual well-being, not merely absence of disease. So enkala idea ite namma janakkalege 4 health agatya, 4 health ಒಟ್ಟಿಗೆ ಡಿಸೀಸ್ ಫ್ರೀ ಬಾಡಿ ತಂದಾಂಡ ಖಂಡಿತವಾದ ನಿಖಿಲ್ 100 ವರ್ಷ ಬದುಕುವರು. ಆ ಒಂಜಿ ಮೆಸೇಜ್ ಕೊರ್ರೆ ಬೊಡದು ಎಂಕಲೆ ನಿಖಿಲೆ ಫನ್ನಿನ್ ತೋಜನ್ಲ ಅಂಚನೊಂಜಿ ಥೀಮ್ ದೀದಿನ ಕಾನ್ಫರೆನ್ಸ್ ಅರೇಂಜ್ ಮಲ್ದ ಬಾರಿ ಪೊರ್ಲು ಎಂಕಲ್ನ ಮಾತ ಸ್ಪೀಕರ್ಸ್ ಟೈಮ್ ಲಿಮಿಟ್ ದೀದ್ ಪಾತೆರೇರು ಮಸ್ತ್ ಟೇಕ್ ಓ ಮೆಸೇಜ್ಲ ನಿಖಿಲೆ ಕೊರಿಯರು. ಐ ಆಮ್ ಥ್ಯಾಂಕ್ಫುಲ್ ಟು ದ ಸ್ಪೀಕರ್ಸ್ ಆ್ಯಂಡ್ ಯು ಆಡಿಯನ್ಸ್. ನನ್ನ ಸೆಕೆಂಡ್ ಪಾರ್ಟ್, ವಿ ಆರ್ honoring some 10 doctors we have selected above 80, all practicing doctors and above 80. Right, Raddu Mujjana, there are more than 50 years they are serving to them, giving their service to the mankind. Padmina Kaulleru, Bakka Umma Kaulleru, Nama Tukarammanne Ulleru, Mekal Mata, Mast Varsha, Sundaranne Ulleru, Eet Varsha Akal Kelsa Maltinakulu. Akal, they are shying away from the social organization because Sunday akal benponu papa kande podu bayomata bendu barpinakal anchada akaleke sangha samsthada samparka kadime akalegola recognition tikiji. We thought better to honor those people. Today Dr. Narendra Shetty, Dr. Mabal Shetty, Dr. Shivanna, Sitaram Alveru anche enma jana baidere, Dr. Vijayarao Hegde and Dr. R.T. Shetty could not attend because of their health reasons. Atat Raddu Jana Sanmana Malperolla, they are really special to me because one is Mr. Vinay Shetty. He is a divine person working for a divine cause. I'll say he is like a Incha Joseph Kurian Anandadu Panunditar milkman of India and Lepura. He is a blood man of India. He is not a bloody man of India, he is a blood man of India. Dade Panda, till now he must have conducted more than 9,000 camps, and he is handling that Bombay blood group, which is very, very rare. Only 200 donors are there. Or Chennai barpundu, or Thailand barpundu, or Sri Lanka battanla overnight untudu blood arrange malpananchinonji Mother Teresa award tikinanji Satvika Naramani Vinay Shetty. We would like to honor. Not only that, ಮಹಾರಾಷ್ಟ್ರದ 11,000 ಜೋಕುಲು ತಲೆಸೀಮೆ ದಕ್ಲುಲೆರು ದೇಶದ 1,4 ಜೋಕುಲು ತಲೆಸೀಮೆ ದಕ್ಲುಲೆರು ಅಕಲೆಗೆ ಮೂಜಿ ವಾರಗೊರ ಕಮ್ಮಿ ಮೂಜಿ ವಾರಗೊರ ಬ್ಲಡ್ ಪೋಡಾಪಂಡು ಆ ಸಪ್ಲೈ ಚೈನ್ ಮೇಂಟೈನ್ ಮಲ್ಪುನ ಒಂಜಿ ಮಹಾನ್ ವ್ಯಕ್ತಿ ಪಂಡ ಎಂಗಲ ಡಾಕ್ಟರ್ ವಿನಯ್ ಶೆಟ್ಟಿ ಅವರಿಗೆ ಸನ್ಮಾನ ಮಲ್ಪುನ ಈ ಸಂದರ್ಭಡು ಭಾರಿ ಅಗತ್ಯ ಅಲ್ಲ ಮಾತ ಸಮಾಜದಕ್ಕೆಲ್ಲ ಮಲ್ಪುನ ಅಗತ್ಯ ದಾದಂಡ ಒಂಜಿ ಸಮಾಜ ಕೆಲಸ ಮಲ್ಪಿನ ರತ್ತು ಮಾತ ಸಮಾಜಗಳ ಕೆಲಸ ಮಲ್ತೊಂದು ಪಂಡ್ರೆ ಎಂಗೆ ಸಂತೋಷ ಒಂದುಂಡು ಕುಡಂಜಿ ಎಂಕಲ್ನ ಆಡಿಟರ್ ಬಕ್ಕ ಅಡ್ವೈಸರ್ ಆತೆತ್ ಫ್ರೆಂಡ್ ಈ ಸಂಸ್ಥೆ ಶುರುವಾಯಿ ಬಕ್ಕ ಇನಿ ಮುಟ್ಲ ಎಂಕಲ್ನ ಅಕೌಂಟ್ಸ್ ಫ್ರೀ ಆಫ್ ಕಾಸ್ಟ್ ಶಂಕರಣ್ಣ ಎಂಕಲ್ಲ ನಾನು ಈ ನೀರನ್ನು ಅಫಿಷಿಯಲ್ ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ನಾನು ದುಡ್ಡು ಕೊರ್ಪ ಇಡಮಟ್ಟ ಫ್ರೀ ಇಟ್ ಮಲ್ಪದ ಪ್ರೊಫೆಷನಲ್ ಫೀಸ್ ನಾನು ಕೊರ್ಪ ಎಂಕುಲ ಆ್ಯಂಡ್ ಟೈಮ್ ಟು ಟೈಮ್ ಎಂಕಲಿಗೆ ಸಜೆಷನ್ ಕೊಡ್ತೀನಿ ಆರು ಅವತ್ತಂದೆ ಎಂಕಲ್ನ ಬೈಲಾಸ್ ಪೂರ ಆರೇ ಮಲ್ತ್ ಕೊರ್ನಿ ಆರು ಎಂಕಲ್ನ ಫ್ಯೂಚರ್ಡ್ ಎಂಕಲ್ನ ಆಡಿಟ್ ಅರೇನ ನಾನು ಎಂಕಲಿಗೆ ಮಸ್ತ್ ಕೆಲಸ ಆಯ್ರ ಉಂಡು ಇತ್ತನೇ ಎಂಕಲ್ಲ ಬ್ಯಾಂಕ್ ಅಕೌಂಟ್ ಮತ್ತು ಓಪನ್ ಅಪ್ಪಂಡು ನಾನು GST, ATG and CSR registration malperondu. Yes, already taken that job. Thank you Shankarana for gracing this occasion and he'll be honored today. Lastly, the aims and objectives of this organization is very, very important. Any organization should have some vision. The leadership is only to convert that vision into reality. That is called as leadership. My job is only convert that vision into reality. There are 3-4 objectives we are having. The first objective is always charity, which is mandatory for any charity organizations. So charity la raddu type undu. One charity financial help, second is the rendering physical, professional service. ಬೆಂಕ್ಲ ಫೈನಾನ್ಷಿಯಲ್ ಸಪೋರ್ಟ್ ಕೊರ್ಪಿನ ಸ್ಥಿತಿ ಇಜ್ಜ ಇತ್ತೆ ಪುಡಿದಿನ ಆರ್ಗನೈಸೇಷನ್ದು ಅಂಚದು ಡೆಫಿನೆಟ್ಲಿ ವಿಲ್ ಬಿ ರೆಂಡರಿಂಗ್ ಅವರ್ ಪ್ರೊಫೆಷನಲ್ ಸರ್ವಿಸಸ್. ದಟ್ಸ್ ದ ರೀಸನ್ ವಿ ಹ್ಯಾವ್ ಅಪಾಯಿಂಟೆಡ್ 8 regional committee chairmen starting from Thana to Bhiwandi, Kalyan, Dr. Himakar Shetty and Dr. Surendra Shetty, Mulon, Mr. V.M. Shetty from Dombivli, and from Bandup to Ghatkopar, Kurla, Dr. Suhas Naik, and New Bombay, our Vijay Shetty, Shishir Shetty, and Adip Shetty is taking care of that up to Andheri, and beyond that, Dr. Tushar Hegde, and beyond Borivali, Vasai Virar Belt, Mira Road and all, Dr. Bhaskar Shetty, and Dr. Shishir Shetty, Vasai Virar, and city region, Dr. Chintan Shetty. We are going to display their numbers. We can just note down. They will be coordinating with our chief coordinator, Dr. Sarup Hegde. He is also happened to be the healthcare chairman of Bunts Sangha. So this is the way we are planning to work in the future. And it's not only meant for Bunts Sangha, other organization, Bunts Association, Thana Bunts, Mulund Bunts, and all other allied organization. Let me make it very clear, this is for everybody. The second most important is very close to my heart is blood donation camp. The drive will continue, and in the last 1.5 years, we have collected more than 1,500 units, and also we would like to promote organ donation, because now you heard Sujata's speaker. She explained you everything, how to pledge the organ, and definitely this is a good cause. And lastly, our senior citizen support group, we want to create a helpline to the senior citizens. There are 300 senior citizens registered with the Senior Citizen Association. ಕೃಷ್ಣಣ್ಣೆ ಮೂಲ ಉಲ್ಲೇರು ಅರೊಂಜಿ ಜ್ಯೇಷ್ಠ ನಾಗರಿಕರ ಸಂಘ ಅಂತ ಕಟ್ಟಿದೇರು ಪಂಡ ಅಬೌವ್ 60 ದಕ್ಲೇನು ಯಾನ ಅಪ್ಪಲ ಪಂಡ್ರೋಂಡು ಇರು ಜ್ಯೇಷ್ಠ ನಾಗರಿಕತ್ತು ಶ್ರೇಷ್ಠ ನಾಗರಿಕರನ್ನು ಕಟ್ಟಿದ್ದಾರೆ ಬಿಕಾಸ್ ದೇ ಹ್ಯಾವ್ ಗಿವನ್ ದೇರ್ ಹಾರ್ಟ್ ಆ್ಯಂಡ್ ಸೋಲ್ to the family as well to the society. So we'll have to take care of their health. In what way we'll be able to help? So Inkalna pilot project, immediately what we are going to start is, as Ashitak mentioned, immunize the senior citizens. Adult vaccination, mainly we are focusing on two things, two vaccines. First is 50, above 50 we'll have to take, but initially we are promoting after 60 years, every May, June, all adult, high-risk group, or irrespective of this one, every senior citizen should get one vaccine, that is flu vaccine, that can prevent the dreaded disease like ARDS and even swine flu and all these things. Second is, as he rightly said, pneumococcal. The 21 valent is going to come in the market, but it's very expensive. So we are promoting Pneumo 23, which is costing less. That can be included. That is one vaccine we'll have to give. This is a pilot project we are having that needs some resources also. We have, for this year, we'll be able to manage with whatever the fund we have collected. From next year onwards, we'll have to generate fund. So I request the corporate houses, if you are having CSR, contribute generously for a noble cause. The second thing, we need to create senior citizens need three securities. One is a social security, because most of the time, their children are not there. The loneliness is a big problem, so you have to address their loneliness. So some support group, the organizations, sanghas and all you have to do. Second is their health security, I told you, because now above 70 years, as our Bhavesh Thakkar mentioned very clearly, it is becoming very costly day by day. So we need to consider supporting them in different ways. PMJOI, Prime Minister Jan Arogya Yojana, Mahatma Phule Yojana, and there are several schemes rolled out by the government. We'll have to, that information, that message should go to the senior citizen. I think organization will have to do that job properly. Friends, lastly, my message is very clear. In the Mumbai metropolitan region and beyond that, Thana district, Rayagada district, we have more than 5 lakhs Bunts community people. 5 ಲಕ್ಷದ ಮಿತ್ತುಲ್ಲೇರು ಸಂಜಯ್ ಗಾಯಕ್ವಾಡ್ 10 ಲಕ್ಷ ಉಂಡು ಪಂತಾನೆ ರಾತ್ರಿ ಒಂಚೂರು ಪರದು ಬಂತೀನಿ ಮಾತೆಲ್ಲ ಸೇರದು ಬಂತೀನಿ ಆ್ಯಂಡ್ ಆ್ಯಕ್ಚುಲಿ ಸಮೀಕ್ಷೆದ ಪ್ರಕಾರ ಒಂಜಿ 5 ಲಕ್ಷದ ಮಿತ್ತುಲ್ಲೇರು ಈ 5 ಲಕ್ಷಡು ಸಾಧಾರಣ ಒಂದು 25% ಜನಕ್ಕೂ ಪವರ್ಟಿ ಲೈನ್ ಉಲ್ಲೇರು ನಮ್ಮ ತೂತಿನ ದುಂಬು 50% ಇದ್ದಾರೆ ಇತ್ತೆ 25% ಮಟ್ಟ ಬೈದೇರು education and health, these are the only two basic tools to reform any community, to pull out these people from the poverty line. So, health, education wise, we are doing a marvelous job. We have done a lot. Bunts Sangha has got 3 educational institutions. Bunts Associations also having 1 institution. As far as the health sector is concerned, we are lagging behind. We are far behind than any other community. So our priority should be a healthcare system, health corporate, health hospital, where we'll be able to cater around 40% of our poor patients free of cost or with the minimum cost. Another 60%, if you want, you can charge to compensate whatever the loss incurred in this. My humble request to all the allied group, we have 8 to 9 allied group along with the Bunts Sangha, to take some initiative. Let us discuss. Let us all come to one common platform. I think I have discussed this issue with our philanthropist, industrialist, Dr. Shashi Kiran Shetty also. If he is willing, definitely we will follow him. There should be a consensus. This is my opinion on behalf of my ABD, because our doctors community, ABD has got intellectual resources, and the industrial house and the other allied organization will have a financial resources. If the industrial resources will join the financial resources, I think we can think something big which we want to start. I think Dr. Shashi Kiran Shetty will seriously should think about this, and in the future, we are expecting something positive coming out. Like, with this note, I have covered three things: welcome address, secretary's report, as well as my presidential address. I am not going to talk much about the, except one or two words concluding remark. I wish you all good health, and the program will continue. Thank you very much. Thank you for patient listening.
Thank you, Dr. Satyaprakash Shetty. I think you proved your name right, Satya and Prakash. You've been very true to the cause, and now you're spreading light across to mankind. It's a reminder that medicine is not a profession, it is a mission for the well-being of mankind. And your leadership embodies the spirit of this very summit. I'm very happy to introduce Shri Praveen B. Shetty. In fact, he doesn't require any introduction because everybody knows him. Currently serving as a president of Bunts Mumbai. He is a dedicated community leader, successful entrepreneur, well known for his philanthropic contribution. He has given full support to the ABD program with the permission to host in this very premises, understanding the noble motive. Ladies and gentlemen, let us warmly welcome with a big round of applause Shri Praveen B. Shetty, President of Bunts Mumbai. I request Dr. Satyaprakash Shetty, President, and Dr. Uday Shetty, Secretary, to felicitate Shri Praveen B. Shetty and others to join in. Thank you. Thank you very much. It's my pleasure and privilege to introduce the chief guest for today's program, Dr. Shashikiran Shetty, Chairman and Managing Director, All Cargo Logistics. An iconic and a visionary entrepreneur and a global leader. Hailing from the humble town of Bantwal in Karnataka, Dr. Shashikiran Shetty stepped into Mumbai in 1978 with little more than the determination in his heart and just 25,000 in his pocket. By the age of 25, he founded his first business venture, and in 1992, his vision gave birth to All Cargo Logistics, now truly a global enterprise operating in over 90 countries, 90, with 200 plus offices and workforce of more than 8,500. That calls for a round of applause, surely. Not only this, Dr. Shashikiran Shetty's impact stretches beyond the boardrooms. A sports enthusiast, co-owner of Singapore Slammers tennis team, he represents innovation in the real estate with Planet SKS and a philanthropic spirit through his Avashya Foundation, empowering education, community welfare, and sustainable development. He is served on various industry bodies like Mumbai Port Trust and Sahyadri Engineering Colleges, and earned some highest accolades, including the Commander of Order of Leopold II, Belgium's highest civilian honor. Most recently, he has been honored with Karnataka Rajyotsav Award in 2023, and today he continues shaping the future, not just in business, but in academia too. As a chairman of Board of Governance at the prestigious IIM Mumbai, guiding one of the India's premier management institutes towards new height. A man rooted in teamwork, humility, and relationship, values shaped by his joint family upbringing, and whose extraordinary journey inspires all of us to dream bigger and give back even more. So that is the chief guest for today, Dr. Shashikiran Shetty. May I request the President, Dr. Satyaprakash Shetty, Joint Secretary, Dr. Shravan Shetty, and Advisor of ABD, Dr. Sadanand Shetty, to felicitate the chief guest for today, Dr. Shashikiran Shetty. May I request everybody to join while we felicitate the chief guest? Applause. And in doctor's language, it is very good for heart, so please applause. Good for health. Thank you. May I have Dr. Tushar Hegde on the stage, please? Dr. Tushar Hegde. Ladies and gentlemen, now we will be unveiling the logo of the Association of Bunt Doctor and website inauguration by none other than the chief guest, in the hands of Dr. Shashikiran Shetty. May I request the chief guest, Dr. Shashikiran Shetty, to kindly do the honors. Yeah, we can just... We can have the AV team, please. It was still gone behind. Just 2 minutes, the AV team will be ready. It's okay, it will be. Don't worry. Don't worry, it is come, it's come, it's come. No problem. Yeah. Yeah. Yeah, we can give it to you. Since a lot of efforts have been gone for making this logo, it takes time to unveil it. So now we have the unveiling of the new logo of Association of Bunts Doctor in the hands of Dr. Shashikiran Shetty. And also the website. May I have the next slide, please? You'll have to just press it. Yeah. You'll have to press the remote. Yeah, this is the website. Lot of efforts gone to make this website. A special thanks to Dr. Tushar Hegde for this. And the entire Bunt Doctors contribution. Acha, the website name is Bunt Doctor, Association of Bunt Doctor, buntdoctors.com. I think it's going to be a very important website. buntdoctors.com. So we are not there just physically, but also online. Thank you. Thank you so very much. Thank you so very much. Ladies and gentlemen, today, it's a rare honor to felicitate 10 extraordinary practicing Bunt doctors in Mumbai, are heroes in white coats. All octogenarians, 80 plus, whose decades of healing have been marked by skill, compassion, selfless service. At an age where most of the people are busy thinking about memories of life, they are still writing prescriptions. And the biggest remedy has been kindness. They are our living treasures of our community and shining example of life dedicated to humanity. Today, we bow in respect to their lifetime of care, celebration, and celebrating their extraordinary journey and expressing our deep gratitude for the legacy they continue to build. There are 10 doctors. We'll have first 5 doctors coming onto the stage. May I call upon Dr. Padmini Shetty. Dr. Padmini Shetty, 5. Dr. No, AV team cannot do it. We connected with AV team. Yeah. Yeah. I think we should continue with a round of applause. They are our, thank you so very much. We are so very honored. Dr. Sundar Shetty, Dr. Tukaram Shetty, Dr. Y. Shivananda Shetty. Yes, that's it. That's the spirit. They've come all the way for this, and I think we should not stop the round of applause for them. I'm sure there will be so many patients here who have been treated by them. So let us give them the honor. May I request the President of Bunt Sangha, Shri Praveen Bhoja Shetty, Chief Guest, Dr. Shashikiran Shetty, President, ABD, to felicitate all our veteran doctors, the octogenarians. Thank you so very much for making it for us. AV team, citation please. AV team, citation please. AV team, citation please. Dr. Padmini Shetty, Dr. Sundar Shetty, Dr. Tukaram Shetty, Dr. Y. Shivananda Shetty. Yes, we have the Thank you so very much. We are really honored with your presence. Meanwhile, may I also call upon Dr. Sitaram Alva, Dr. Umavati Shetty, Dr. Raghu T. Shetty could not make it, Dr. Narendranath Shetty, Dr. Mabal Shetty on to the dais, please. May I request? I repeat, Dr. Sitaram Alva, Dr. Umavati Shetty, Dr. Narendranath Shetty, Dr. Mabal Shetty. While they come on to the stage, I think, ladies and gentlemen, they deserve a standing ovation. I think we should all stand up. Good for health, good for blood circulation. We can't sit for a long time. So in doctor's language, good for circulation. So let's give a standing ovation to all the doctors. May I request all the doctors to come up on the stage so that this is how we would like to honor you. And we really mean it. Thank you so very much. And thank you, audience. You have been wonderful. Now we have Dr. Sitara Malwa. Dr. Mabal Shetty. Hello, sir. Dr. Narendranath Shetty. I request the team. I request the chief guest, the president of Bunts Sangha and the president of ABD to felicitate. Dr. Sitaram Alva, Dr. Narendranath Shetty and Dr. Mabal Shetty. I request the office bearers of ABD to join in the felicitation. Fantastic. Thank you so very much. That's the spirit. Come on. A standing ovation for our next set of doctors. And we want to see them after 20 years, 100 plus, healthy and happy. That's the motive. 4 plus 1 is equal to 100. Thank you so very much. Thank you. It was like a mini get-together of everyone. Thank you. We move on. Ladies and gentlemen, it fills my heart with pride, and especially the pride of Bunt community, to felicitate another stalwart of our community, a silent person who doesn't like the stage, but today we got him here. None other than Sri Vinay Shetty, founder and CEO of Lifeblood Council. May I request Sri Vinay Shetty to come on the dais so that I could speak more about you when you are on the dais. Sri Vinay Shetty. He doesn't like the stage, but we have successfully got him on the stage. Yes. I'll just read about him. Yes. I'll just read about him. He is a man whose life embodies compassion, service, and humility. He is a founder and a CEO of Lifeblood Council and devoted more than 3 decades of saving lives, bringing hope, quietly working away from the limelight, letting his action speak louder than any applause. An engineer from Vijay TI, a management graduate from SP Jain, for 35 years he has been a driving force and responsible for more than 900 blood donation and saving more than 27,000 lives. He is a creator of the first Bombay Blood Group Registry and an unseen lifeline during terror attack and natural disaster. His 25 years of mission against thalassemia has brought care, dignity, and hope to countless families. Awards like Mother Teresa Memorial Award for Social Justice and Baba Amte Award are just a formal recognition of what truly set him apart. His wavering commitment, quiet strength, and refusal to seek spotlight. Today we honor him not just as an exceptional humanitarian, but as a role model for our youth, a proud son of Bunt community, and proof that one person can change, can bring in humility, perseverance, and a heart that never tires to give more. Please join me in applauding this silent yet unstoppable force for good, Mr. Vinay Shetty. May I request? Yeah, may I request Sri Vinay Shetty if you could speak some few lines?
I will not take much of your time. Sabse pehle, very good evening to all of you. It's really a privilege for me to get this recognition from the Association of Bunt Doctors Mumbai and the Bunt Sangh actually. And I must say that to add to my feeling of feeling special is, presented by, I was introduced by Professor Dr. Vijayta Shetty, whom I've known for the last 10, 15 years really. First at Walia College, then of course at Vivek College. And so we've been constantly in touch with each other. So it feels very nice to, be introduced to all of you by her actually, okay. Of course, I must also thank Dr. Satya Prakash and the entire team of Bunt Association of Doctors and even the Bunt Sangh, because what happens is people keep recognizing you time and again maybe, but this is a very special recognition actually. It comes from the medical community in the first place. It comes from the Bunts community, which is my community in the second place, and therefore it feels extremely special. And I must say that, if I don't mention the contribution of my parents, I always get a little emotional. But my parents have sacrificed a lot without expecting anything in return. And therefore, I am so happy to receive this award and to acknowledge their contribution. You know, I feel that this is an opportunity that I got to acknowledge their contribution in the way I've come up in life, really, okay, without expecting anything in return. And of course, my brother and sister, and I must also take this opportunity to thank all the doctors in the various thalassemia daycare centers, all the blood centers all across the country, for always being there at my beck and call, really, okay, and always supporting me. And lastly, because we are talking about blood donation, I must pay a big salam to all the blood donors who come and donate blood regularly and ensure that there is always blood sufficiency in every terror attack that has happened in Mumbai or any other place. The blood was already there. It's a different matter that donors came and donated blood after seeing the event on television. But the fact of the matter is the blood was already there in the blood banks. And that's why the big salam to all those donors who did not know that who were going to be the recipients. But they knew, आज मैं अगर रक्तदान करूं, तो कल या परसों या 5 दिन बाद या 10 दिन बाद, somebody somewhere is going to smile. So big salute to all of them. And I must take this opportunity to thank our chief guest, actually. Nobody knows about this. Long back, I don't even remember when it was, I had approached him because we were trying to send a team of visually challenged chess players who were representing India in the World Championships, actually. And you had supported one of those players, and we managed to send the team over there. So let me acknowledge that also right now, okay? So thank you very much to the Association of Bunt Doctors for a well-organized medical summit, really. It not only had content, but it had also a lot of humor in it. You know, every presentation had a lot of humor. So gained a lot and felt very happy. And like Dr. Harish mentions, you know, a happy heart is a peaceful heart. And peace in mind is going to go a long way in helping you in doing whatever you want to do in life. So thank you very much from the bottom of my heart. I just want to say just one thing, that, you know, we've got a long way to go. Just to give you an information, the last year's collection of blood in the country indicates that 0.9 out of 100 people donate blood once a year. 0.9 out of 100. So because of the kind of focus that the Bunt Sangha has been giving to blood donation drives all over the place, that figure slowly, if all other people also join, will go to 1.1, 1.2, which is the target, actually. Okay. So thank you very much once again, and there's a lot of work to be done in the future. Thank you.
Thank you so much, Sri Vinay Shetty. Very rightly said. I think the best gift you can give is to donate blood. That's a message of today. And I must just add something that there is no principal at the University of Mumbai who doesn't know Sri Vinay Shetty, because all my principal colleagues will definitely agree that if there is a blood donation, there has to be Vinay Shetty in the campus. So that was Sri Vinay Shetty. It's my pleasure now and a privilege to introduce yet another stalwart, C.A. Shankar Shetty, the auditor and the advisor of Association of Bunt Doctors, senior chartered accountant, a social leader. He's been the former president of Bunt Sangha Mumbai, given his service for the Bunt Sangha for the past 20 plus years in various positions. He's a founder director of the Indian Bunts Chamber of Commerce and Industry. May I request C.A. Shankar Shetty to kindly come on the dais. I request the President of Bunt Sangha, Chief Guest, Dr. Shashikiran Shetty, President ABD, to felicitate C.A. Shankar Shetty. I know Shobha Shetty is telling me no, but I request Shobha Shetty, the better half, I should say the best half, and Vedant, who is also sitting, son of C.A. Shankar Shetty, to please come on the dais. Come. I request CA Shankar Shetty to be on the dais. Meanwhile, I request the President of all the Allied Association to come to the dais. I request Advocate D.K. Shetty, President, Bombay Bunts Association, Shri K.C. Shetty, President, IBCC, Shri S.B. Shetty, the incoming President of IBCC, Shri Sudhakar T. Shetty, President, AHAR. May I request you to kindly come to the dais. CA Vishwanath Shetty, President, Association of Bunts Chartered Accountants, Advocate Prabhakar Shetty, President, Bunts Law Forum, Shri Rajesh Shetty, President, Jawab, CA Karunakar Shetty, President, Mulund Bunts, Ashok M. Shetty, President, Thane Bunts, and N. Vivek Shetty, President, Association of Bunt Engineer and Architect. I think N. Vivek Shetty is not present. Advocate D.K. Shetty, President, Bombay Bunts Association, Shri K.C. Shetty, President, IBCCI, Shri Sudhakar T. Shetty, President, AHAR, CA Vishwanath Shetty, President, Association of Bunts Chartered Accountants, Advocate Prabhakar Shetty, President, Bunts Law Forum, Shri Rajesh Shetty, President, Jawab, CA Karunakar Shetty, President, Mulund Bunts, Ashok M. Shetty, President, Thane Bunts. Thank you so very much. Now I request CA Shankar Shetty to express his thoughts about the Allied Association.
ಮಾತೆರಿಗಳ ನಮಸ್ಕಾರ. It's great honor to be here today, and I must thank my friend Dr. Satyaprakash Shetty and his whole team for honoring me on this occasion. This honor is not as an auditor or advisor. This honor is for, on behalf of all the 9 associations who have come here. This is really, I'm very happy and a special occasion. I must tell you, the concept of coming together, all these 9 associations, it was early about 7, then became 8, and now 9. It started during one Chamber of Commerce award function. We thought we will introduce a concept where all the associations, including Association, Mulund Bunts, Thana Bunts, and doctors, CAs, and advocates come together, and let's celebrate that event. That event was really stupendous success, and everybody liked it. Then we went on adding others also. The idea is, as one of the speakers said, Abhi, time badal raha hai. Things are changing. We need to move to something new. The Bunt organizations are growing very fast. They are creating various assets. They are creating various facilities for the community and allied activities we have, like Matrabhumi and etc. But point is, all these activities that works, we need create impact. We should get maximum out of these activities. That is why the professional coming together will make a lot of impact, and all these activities of each association, whether it is Bunts Sangha, Bunts Association, Mulund Bunts, Thana Bunts, or Jawab, wherever they are implementing any projects for the purpose of our common good of the community, if the person with experience and professionals of the respective field, like today doctors, who better can delegate medical job than doctors? The financial matters, who better than the chartered accountants? The lawyers for the matter of legal issues. The same way now engineers are joining, and also industrialists are already there with us. It's a sort of a move which can impact or create lot of opportunities to our community. Probably in this country, I don't think any other community will have such kind of wide range of people coming together and executing a social work and bringing up the community in all ways. We are touching education, we are touching medical, we are touching social welfare, we are touching old age homes, we are touching old people, whatnot. Now we are going to help even the startups. Some concept has started there also. We would also go to help the industry, the business people who will be starting in the initial period. Bunts Chamber will provide them support. Such kind of things will provide in all the way. That is why all associations have come. This is not limited to only Bunts Sangha, it is executed to all the Bunts activities, Bunts jobs. This is about all this association. Now coming back to the doctors, I think we have doctors were not visible so far. I don't think we have seen them only in medical these things, works they are doing, but today they have executed work in such a perfect way. I think I must congratulate you for organizing the function so better way. Last 2-3 months, overtime they worked and involved all these people, and today really all the scientific session was really excellent, timely, and we must learn from you, putting that clock there, each and every one has to follow the timing. Continue your work like this. All these associations will be there with you, and they will work together for each other's success and for the community benefit. Thank you very much.
Thank you so very much. Truly said so. We are having a blessing being Bunt, a blessing from the Almighty. Whichever sphere we take in, whichever field we are, we become the leaders. So that is the blessings for the Bunt. We begin with our thanksgiving to our sponsors who have been truly a true partner, our strength for the smooth conduct, and a tribute to this medical brilliance to all of us. Our deep appreciation to our esteemed sponsors. You have been the lifeline of this medical summit. May I call upon the main sponsorer, Shri Krishna Shetty and Srimati Uma Shetty from Krishna Palace. It's an honor to felicitate you. Shri Krishna Shetty and Srimati Uma Shetty. Both Shri Krishna Shetty and Srimati Uma Shetty has been giving their services to Bunts Sangha in various capacities, various roles, and we are so thankful to them for being our main sponsors. I think we should have a round of applause. Thank you. Now I call upon our next sponsor who has been a well-wisher, Shri B. Vivek Shetty, Chairman, Founder of Vishwat Chemicals, a professionally managed company, former President of Bunts Sangha and a trustee, Shri B. Vivek Shetty. Ladies and gentlemen, we can have a round of applause from all of you. Thank you so very much. Thank you. May I request Shri Vivek Shetty to kindly speak some few words.
Thank you, sir. Thank you, Vijeta. Thank you. Sorry, Dr. Vijeta. ಮಾತೃರಿಗೆ ನಮಸ್ಕಾರ. ಎನ್ನ ಇನಿ ಪಾತರುನ ದ ಲೆಜೆಂಡ್ ಇಜ್ಜಂಡ್ ಯಾನ್ ಸ್ಪೆಷಲಿ I requested Dr. Satyaprakash Shetty, after seeing your program here, to speak one word within 1 minute. Respected dignitaries on the dais, especially the President of Bunts Sangha, Mr. Praveen B. Shetty, Dr. Shashikaran Shetty, and also all the Bunts community. Here, I have come here only to express my feelings for the doctors. To start with, in this entire crowd, I would like to divide the crowd into two. One is doctors, one is the patients. Because we are all in our life, one day or the other, we have seen the doctors. How important a doctor is in our life. Because doctor, during daytime, we go for the consultation, and night, we sit with them and drink. That is why generally, we take them for granted. So, but how important it is for us to understand. Because since the morning, afternoon, otherwise also I was thinking how important they are in our life. Now let me tell you, in a man's life, there are three things. One is birth, one is life, and the death. In this process of three things, till, child is in their mother's womb, everything is taken care of by the God and also the mother. See, these are how God's sequence takes place. First the God, then the mother, and once the child comes into this earth, from there, the doctor starts as a God. How? First starting with the gynec. Without a gynec, you can't come out. That's the most important thing. The next one that I would like to say about the doctor is that throughout your journey, till the death, they follow you. Like a shadow. Whether in middle age or till the final death, because every time, in some other form, you visit the doctor and take the consultation. So, I consider them as the living God. They are the living gods. Please look at, that you don't take it, that actually just doctor ke abhi jaake piyega. No, they are the living gods. That kind of importance, we are supposed to give them. That's the respect we should give it to us. And now, they are in a unique position, because in our life, every life, what is that? A doctor can become a businessman. For instance, Dr. Manohar Hegde, my friend, he was a doctor, but he's a very successful businessman. A businessman cannot become a doctor. You have no right to save the life. It is the power given by the God. So the life saving is one great thing, that the power the God has given to all of you, doctor. That is why I have come here to only express my feelings towards you. You are the greatest, the people for all of us. So continue to do the good work. Now, I would like to conclude one thing. See, of course, Mr. Lucky person, we started everything with film industry. I also don't want to do that. In film, MBBS Munnabai, like, Sanjay Dutt, he says that, when an emergency, when the patient goes, form bhar ke aa jao. Please don't do that. I'm just telling you. Not to you, I'm telling municipal doctor. And also, one more thing, that I'm telling, don't see, everybody from the commercial point of view. Because human touch, the sympathy, that's the most important, because we are looking at you as the doctors. Now with this, I would like to conclude. Somebody has pointed out that, because today, I think a lot of fund is available with our community people only, because that money is being gone to the other community, because especially, that private limited company, I'm not talking about the hotel industries, other industries, there are a lot of funds available, especially for CSR activities, and ATG, please try to take the CSR number as soon as possible. You will get the money, and God bless you. Once again, thank you very much for giving an opportunity, Dr. Satyaprakash. Thank you, Dr.
Thank you so very much, Vivek Shetty. I request Dr. P.V. Shetty, Payade Sports Club, former President, Buntara, and ex-Joint Secretary, MCA, to kindly come over to the dais. I request Dr. Sangeeta Shetty from Shivani Mother and Child Hospital, Mulundan, Thane, to come over to the dais. Mrs. Pradna Shravan Shetty from Windsor Refractories. Shri Sanjeev Shetty, Hotel Ashwit, CBT, Belapur. Shri Sanjeev Shetty, Hotel Ashwit, CBT, Belapur. Shri Mahesh Shetty, Baba Group and Vice President, Buntara. Shri R.K. Shetty, Secretary, Buntara. Shri R.K. Shetty, Secretary, Buntara. Shri Pandurang Shetty, Sony Appliances. Shri Harish Shetty and Dinkar Shetty, Ramada Group. Shri Harish and Dinkar Shetty, Ramada Group. R.K. Shetty is not come. Shri Harish and Dinkar Shetty, Ramada Group. Shri Samit Arasa, Arasa Hotel. Shri Prabhakar Shetty, Vaishali Hotel. Shamala Shetty, if you are around, please do come. Shamala Prabhakar Shetty, Vaishali Hotel. H&H Pharma, Dr. Hemant Hegde. Shamala Shetty, Vaishali Hotel. H&H Pharma, Dr. Hemant Hegde. Mr. Anand Shetty and Mr. Kishan Shetty. Mr. Kishan Shetty, Mr. Anand Shetty. Yeah. We have our veteran sitting here, Advocate R.C. Shetty. So we will come and give you the bouquet. May I request the President, Dr. Satyaprakash Shetty, to kindly do the honors. Advocate R.C. Shetty. Dr. Sadanand Shetty, Borivali. Dr. Sadanand Shetty, Borivali. the ABD President's friends from Mulund, the entire team. Shantaram Shetty, Shri Rajendra Shetty, Shri Ashok Adyantar, Shri Uday N. Shetty, Shri Palimar Vasan Shetty, kindly come to the dais. And we also acknowledge CA Satish Shetty, SB Shetty to come to the dais. ABD President's Friends Group, those who have given great support for this program. So that's a ABD President's Friends Group from Mulund. CA Satish Shetty, Shantaram Shetty, SB Shetty, Rajendra Shetty, Ashok Adyantar, Uday N. Shetty, Palimar Vasan Shetty, and CA Shankar Shetty. Now we have the corporates. We are very thankful to the corporates for their sponsorship. I request the representatives from IDFC First Bank, Zuventus, Shri Sudhakar Kukian, Torrent Pharma, Lupin Pharma, Zydus Cadila, Sun Pharma, if you are there. I repeat again, IDFC First Bank. May I have the representatives from IDFC First Bank? IDFC, please come, ma'am. IDFC First Bank. Zuventus, Shri Sudhakar Kukian. Zuventus. Yeah. Torrent Pharma. Representatives from Torrent Pharma. Torrent Pharma. Torrent Pharma. Lupin Pharma. Any representatives from Lupin Pharma? Do come to the dais. As we acknowledge and thank you, grateful for your sponsorship. Zydus Cadila. Representatives from Zydus Cadila. Any representatives from Zydus Cadila? Sun Pharma. Representatives from Sun Pharma. Representatives. Mankind Pharma. Mankind Pharma. And Corona Remedies. Thank you so very much. Done. Thank you so very much. May I now request the most important, the chief guest for today's program, Dr. Shashikaran Shetty, Chairman and Managing Director, All Cargo Logistic, to express his thoughts and addresses.
Good evening, everyone. First of all, my deepest respect to Dr. Satyaprakash Shetty, Dr. Sadanand Shetty, my friend Ajit. I'm meeting after many, many years. The president of Bunts Sangha, Praveen Shetty, Uday Shetty, Vidya Shetty. Pardon me, I forget your names. My dear friends at the stage. First of all, my hero, Mr. B.R. Shetty. He's 94 and he is present. which doctor is treating you? We must know that. Because we all want to live 94 years and be here in the program. We want that energy and enthusiasm. God bless you more with that. Also my friend Krishnanna, Vivekanna, Dr. P.V. Shetty, all the doctor friends, Manuanna, Shankaranna, and all of you, Dr. B.R. Narendrana, and all of you. Sorry, I'm not taking everybody's name. It is such a privilege and such an honor to be among all of you. And I'm so glad and so delighted that the Doctors Association has revived. So when we come to Bunts, we many times like to see more participation from those who are noble and those who are smart and very intellectuals, like a doctor, a lawyer, chartered accountants are few, they're active. Some doctors, of course, are also active. And I think it's hard to bring them because their work life is very different compared to many of us, because we can delegate something to somebody, we can ask things to wait for another day. But when you are a doctor, when you're taking critical care of your patients and patients are waiting for you, it is hard to get their time. I don't know how they're going to make it, how Satya Prakashana is going to manage it. But it is always a first step for a grand vision. And I'm very, very delighted that you have taken this step. Satya Prakash, as all of you know, has a very high quality leadership, a lot of passion, and is multifaceted. And he's got a wonderful wife, Sangeetakka, to support him all the time. And he always comes across so appealing and with so much of passion and energy. It gives a lot of hope that anything he puts his mind, he will do his 100%. And more importantly, he's very capable. We all know the good work many presidents of Bunts have done over the years. And right now, we have a very able president, Mr. Praveen Shetty. I deeply acknowledge also his good work, particularly for the distribution of support to the underprivileged and listening carefully about the suggestions that are being made to him. And also, administration of a Sangha like this is not an easy job. He is deeply committed for the school which is coming up in Borivali, as all of you know. And I'm so privileged that it is one of the most fantastic infrastructure, going to be one of the best schools in Mumbai. And I had the privilege to lend my wife and my mother-in-law's name to that institution. And that wouldn't have been possible without the tremendous work. I salute P.V. Shetty. He is an incredible man. He is, I don't know what keeps him going. He had health issues. He travels, he has a public service, he has a cricket team. Rohit Sharma is his prodigy. And I'm just amazed with his passion and his commitment to the Sangha, to the sports and to the community. So without him, this school probably wouldn't have come up. And he's the one who been after me for more than 2 years. It is going to happen. And I want your support. I want your name. I want you to be there. So I'm so glad, PV. I really thank you from the bottom of my heart for pursuing that with me. And today, Our name is all over Borivali, Kandivali, Malad, which we never thought that, these hoardings will come all over the place. And you, Jagdish, President, and all the other committee members are doing a tremendous job to make sure that the school not only opens in time and also, it kind of gets into the best quality at the earliest. We also have our friend Mr. Shetty, the Director General of Shipping. He's also now in the committee, so he's a good value to the institution. Kiran Shetty has done a good job, I believe, on all the construction work and all that. So I really also thank Ravi Anna and all the others, Jagdish Shetty, all of them done a great job. B.R. Shetty also, I think, right? What a fantastic job. So today's theme, what I've been given to understand about the whole vision is about prevention than cure. And we all have recognized the fact that we can prevent many diseases. If you're able to learn about it and if you know what the consequences that a certain lifestyle, if we lead and if we follow, many of the diseases can be avoided. And I think it's known to many of us. But many times, unfortunately, we don't pay much attention. We don't pay attention in terms of listening to our body. Our body always gives a signal. Our body always tells us what is good for you. Your mind tells you what is good for you, what is not good for you. And I think it is very important for us to listen to our body and take the precautions. And nowadays, with the advancement of technology and business coming into the medical field, not only pharmaceutical companies, also there are hundreds and thousands of centers where we can do various kind of tests and understand what is potentially can happen to us. I think there are many insurance policies available. Many companies provide to the employees the facilities for annual checkup. And I find in our own organization, not many people do it. I think these are very important things that we all must do particularly after the age of 45, 50. It is very important, I think, to do an annual checkup and take all the preventive care to keep ourselves healthy, keep ourselves going well. And we talk every day, health is wealth. No matter how much money we make, no matter how much reputed we are, if you don't have a good health, there is nothing you can enjoy. So, for me, I am very, very blessed to say that I am always used to be very health conscious right from a very young age. Whether it come to eating or whether it's come to drinking or smoking, I did everything in moderation. End of the day, we all think we have one life to lead. We must also enjoy. We must also socialize. We also need to travel around the world. But what's important is do it in moderation and take good care, do regular exercises, eat healthy, avoid sugar, eat as much vegetables as possible, take enough protein every day. And, I think if you do this, you can guarantee that you will have a 15, 20 years extra life. And the other very important thing about health is about mental fitness. All the negative energy in terms of anger, jealousy, greed, overly thinking about or worrying about the future, blaming the past, all these negative energies leads to a lot of stress. Everybody has stress in some form or the other. The question is how you deal with it. How do you make sure that the stress is something you don't go to bed with? But that's tough. It is easy said than done. We are all human beings. We all have shortcomings. But again, with the regular practice of meditation, yoga, and being with the nature definitely helps to have a better balanced mind. And I strongly encourage all of you to practice that if you're not doing it. I'm sure many of you are doing it. Many of the ladies are particularly overly fond of fitness these days. Ashaka is here, so she still looks so young, right? So, as far as our engagement with Bunts Sangha as a company, we always been, and individually, of course, and as a family, we always try and do our best to pick up the right projects, understand the requirement of the community, and try to help wherever possible. Of course, we also have limitations, what and how much we can do. But this is now something become a part of my life, the whole Bunts Sangha, the community, the respect to the members of our community. It is deep within me and my family, and I'm here to help in any manner I can. My one suggestion that I made to Pravidana is that whatever money we collect in the future, the profit that comes from the school or the surplus that is in the Bunts Sangha, we should spend that money, at least 50% of that. There is no point keeping the money in the bank when your fellow member to who we committed to, keeping in the bank. Because somebody is needing it badly for education or for life saving or look after the old parents or whatever the reason people are desperate for money, there is no use of that money to keep in the bank. I understand, we all understand there has to be a certain amount of money need to be there as a reserve. But the reserve can be to some extent. And I think the community today is prosperous enough to come and contribute if there is a real need of money. There are so many entrepreneurs, and many of you senior doctors, many of you are lawyers, chartered accountants, professionals, everybody can contribute. And I think that culture of contribution is also increasing more and more. That itself shows by the participation in this event today. And all the Bunts Sangha events, we increasingly find more people, and more qualified people are coming and participating. I see many intellectuals are there, and everybody wants to attach to a good work that is happening. Everybody wants to contribute for a good work. People want that amenity where they can give their hard-earned money, where it will be spent correctly for the welfare of the society. So with these few words, I'd like to end by saying thank you very much for inviting me, all of you. I really appreciate for giving me this opportunity and honor to be among the most accomplished, noble profession in the world. And I salute your work, I salute your passion, I salute your honesty and integrity to serve humanity. Thank you very much.
Thank you so very much. Indeed, as you rightly said, there is nothing more than health. Health is all. And whatever we do, we have to do in moderation and be happy. Now I call upon Sri Praveen B. Shetty, President Bunts Sangha, to address us.
First of all, my dear privileged members of our Bunts community who gathered here today for the inauguration of Bunts Doctors Association. Bunts Doctor Association actually formed long back But with the great leadership of Dr. Satyaprakash Shetty, this time they again revived, and it is my privilege, and I'm feeling very proud that it is inaugurated by the President of Bunts Sangha today. Dr. Satyaprakash is so active, even though he is Kubera of Mulund, he is calling me always a Kubera of Bunts Sangha. I also get very comfort. And you know, our respected Shashikaran Shetty, once he said, he came here to join Shipping Corporation of India, big corporate. And 4 years back, that company is offering our Shashikaran Shetty sir, Mr. Shashikaran Shetty, please buy me, please purchase me, such a fantastic personality. And he is always telling the 50% of our income of Bunts Sangha should be utilized for the underprivileged of our community for education and social. Yes, I do agree for that. Because today, you people came, yes, you are privileged people. We know how much people are in difficulties of our Bunts community. We almost around 4 to 5 lakhs Bunts, as Satyaprakash said. Yes, we are getting the application of the health care almost per month 5 to 10 lakhs. But we are able to disperse only 5 lakhs rupees per month. And Bunts Sangha, we all know, big institution, and it is my luck as a president, under the Bunts Sangha or in association of Bunts Sangha, all the Bunts associations, other Bunts associations are coming together to have the bonding within the Bunts. Whatever the equation be within the personal equation, no, Bunts Sangha has to look after all the other Bunts as their younger brother. Personal equation engine aloppu. Yan dada panpin bannaga aven pura nama buddu. Nama onji world day nama banteru malla jana andu gottu navin moolu Mumbai aven nama sabit maltu nana ee varsha tejapava panpinek doctor association form mandu nana ellanji 7 tarikku Vivekannana ನೇತೃತ್ವಡು Bunts engineering association agulu surumal tondolleru. Aidumbu Bunts law forum churuvandu. Bunts C association avu ittin already vakkat strong andu. My request, Bunts Sangha hall korpina malla vishayat. Bunts Sangha panna hall korpini oltu pannaga the donors Shashikaran nakatna donor korne agalna doddavu. Nammadala president nadala ijjait. Pura doddu pura donors na. Today people are telling Bunts Sangha is having 1,000 crores worth. How it is? Because all great major donors like Shashikaran Shetty, S.M. Shetty, Kanyana Sadashiva Shetty, Banjara Prakash Shetty, Krishna Palace, Payada Group, all these people. In the school, we already spent, sir, 135 crores till July 31st. Still, we require around 25 crores. Shashikaran said, it is the best school in Mumbai. No, it is the best school in Maharashtra. The best greenery school, what we built there. You please visit that. Once, whenever time is required, Saturday, all people are there every Saturday. People are working beyond the school day and night. Even for fund collection, even for construction, Ravi Anna, Kiran Anna. Today, the doctor association The 11th seminar, the first time, I have not imagined that 11th seminar they have conducted, very good seminar, with some comedy, with some advice, everything. To hear that, I came little late after the 5 seminar, because we have some other function. And we know we all should have 5 health. Doctor said 4 health. It is 5 health. One is physical health, then mental health, then financial health. That is very important. Then status health. Once financial health is completed, the status has to be maintained. And now Harish Shetty said the religious or spiritual health. Because we Indians, we require spiritual and religious health. And Harish also said, Dr. Harish said, starting of Sunday classes in our school. Yes, I agree. Because we don't have any schools to learn Mahabharata, Ramayana, Bhagavad Gita. Yes, I request Ratnakar Shetty Munkur to think about that, to having Sunday classes for the student to learn our Bhagavad Gita, Mahabharata, Ramayana. And I have one more request. The membership strength is very important for any organization. You being a doctors, some people may not have the member of the Bunts Sangha. Please make membership. Please make membership with the Doctor Association as well as Bunts Sangha. Because we have to show our strength at any point of time. Because last 2 months when crisis came, some minister, some MLA has been observed about the Shettys. We all went there and given in an appeal and all. They said they will look into it. See, one more thing. For the school, sir, Shashikaran Shetty, sir, we will definitely complete within 6 months at any cost. Then comes the primary important project for Bunts Sangha, it is a hospital. But before that, we will make a core committee of all Bunts Association, taking their advice. Even Vivekananda advised me. Making a core committee is very important. We are not in a hurry. Yes, with the help of all doctors also, with the blessing of Shashikaran Shetty. Sir, we have so many people for the hospital donors. We have to tap them first under your leadership. Because you set an example, sir, society. Yes, sir. Yeah, even I am the one of the members, sir. Mahishanna is there. Yes. Because Bunts Sangha is now 98 years. After 2 years, it will cross 100 years. The big project you have to make with all the Bunts. It is not that Bunts Sangha. Let me partner. Even Rajesh has supported me. Let anybody can partner in that hospital. But before that, we will discuss with all the people, not in a hurry, regarding the place, investment, cost, everything. And one more thing, I'm sure if we have the place, we have definitely get money through the CSR fund, since Bunts Sangha is eligible to get the CSR fund. And regarding I am very happy that that Vinay has been facilitated, because Vinay is doing a fantastic job. Because Bunts Sangha, for every blood collection, we have almost made a 5,000 bottle during all 3-4 years. Even Satya Prakash also did very important thing we are doing, that is life-saving, that is work of the people. And he became, emotional. See, that is the greatness. Even Satya Prakash is fettered with full of. Shashikaran is telling usko, "Arey one paper kar lente kam." At serious there is function. See, this is the thing we require. Yes, we definitely do what is the best for our community. Always. Because we are the people like Shashikaran Shetty and his advice is always required for us. And finally, I am closing my remark. It is my privilege. All the Bunts organization, I am keeping very good harmony with all the organization. Even in my president message of the AGM, I have kept a message with all the Bunts organization. And we will take the Bunts community as a world-class leader. Thanking you. Thank you much.
Thank you so very much for the vision. We also acknowledge the presence of Mr. B.R. Shetty, Mr. Ratnakar Munkur, and if we have missed out some guest of ours, please excuse us, but we are very grateful to each one of you who have spent your time and you have come here for all of us. At the end, I request for a concluding remark from none other than the President of Association of Bunts Doctor, Dr. Satyaprakash Shetty.
I'll take only 1 minute, not more than that. Let us collectively make this community healthy and wealthy. Our chief guest, Dr. Shashikaran Shetty, is a man of vision and wisdom. And he has endorsed the necessity of having a hospital in the earlier meetings. I think President Praveen Boshetty is also having the same opinion. We have got lot of industrialists, corporate houses, hoteliers, even doctors. Some of us also we can contribute. For that, there should be a broader platform of all the 9 allied organizations, and representation should be there. This is my request, because hospital is not like a educational institutions. It needs lot of effort and skills also, and our doctors are ready to give their professional services, and some of us definitely can contribute also. Let us collectively make this this community healthy and well. Thank you very much.
Thank you very much. So behind the scenes, we would like to felicitate just 6 of them. I request Premnath Munkur from Karnataka Mala, Subhash Syria from Udayavani, Vijay Shetty, live telecast, Brahmari, Ashok Hegde, photographer, Santosh Shetty, Santosh Caterer, and Praveen Shetty, the General Manager of Bunts Sangha, to come on to the dais as we acknowledge your presence. Premnath Munkur, thank you so very much. Mr. Premnath Munkur. Mr. Vijay Shetty, live telecast, Brahmari. There's just 5 minutes to go before we close in. Thank you so very much. Ashok Hegde, photographer, Santosh Shetty, Santosh Caterer, and Praveen Shetty, GM, General Manager, Bunts Sangha. Thank you for helping us backstage. So the Association of Bunts Doctor would like to felicitate you. So before I request Dr. Uday Shetty to propose the vote of thanks.
when you have a name like Vijeta, there's only victory, victory and victory all round, correct? And when they first asked me to be this thing for master ceremonies for this, I was most worried because doing the scientific was easy, but doing this part was the most difficult part. And I don't need to tell you anything about Vijeta Akka, simply that this last year's 3 awards, one is the Iconic Female Leadership Award at the House of Lords, Westminster, Houses of Parliament, London. Secondly, the Savitri Samman Puraskar by Maharashtra Rajya Shikhar Parishad and the Bunts Best Achiever Award for 2024. Join my hands and come on everybody, give it possible.
Another thanks to our other host, Dr. Ajit Shetty, who's done a wonderful job as the MC, and he's always, I had once told him that if at all he decides to retire from dentistry, he can always be an MC. Thank you, Ajit. Lastly, I'll just give the vote of thanks. Thank you everyone for coming over here. Normally we don't pat our own back, but this time, on a personal note, as honest.
When I'm blue, I think of you in your eyes, how they look at mine, so kind of like that. You slow down time and everything's just fine. I was ocean swim.
It requires guts to pull it off. He has the vision and the good intent to take this association forward. His energy levels are outstanding, and he's a real asset to our organization. Dr. Sadanand Shetty, cardiologist, the president of the Bunts Sangha, the chief guest, thank you all of you. The Shankar Shetty, also all of you, thank you very much. Also, I want to thank all the people backstage, Santosh, caterer Santosh, Praveen Shetty, the decorators, Ramesh Shetty, designer Deepak, and audiovisual Nikhil and Venkat. Thank you very much for all the backstage work. And of course, all the young doctors over here at the backstage who helped all of us. Thank you so much.
When I'm blue, I think of you in your eyes, how they look at mine, so kind of like that. You slow down time and everything's just fine. I was ocean swimming.
For the past, I think, 15 to 20 days, day and night, being in the professional, they have been really putting a lot of efforts. So big round of applause to Dr. Satyaprakash Shetty and his entire team, because I have really personally seen this. Great job. It's not just today, but you have actually set a trend. And that trend is not just physical, but online. I'm sure a lot of people will be benefited. Kudos to the entire team, because I know you do not like the stage, but today you have put everybody on the stage. Great team. Thank you so very much. It was an honor to host this for you all. Thank you so much.
When I'm blue, I think of you in your eyes, how they look at mine, so kind of like that. You slow down time and everything's just fine. I was ocean swimming with just wishful thinking of my life, the vision drifting by, until I found a lighthouse in your heart, shining like a beacon of bright stars. I was in a lifeboat wandering far, until I found a lighthouse in your heart, guiding me out the
Welcome to Tunga Hospital. We are the largest and most affordable hospital in Mumbai, successfully performing countless surgeries for better health every day. To know more, visit www.tungahospital.com.